it's important. So it is enough to trigger this syndrome.
Well, we'll talk about the syndrome in a minute. Your statement was he was probably under the influence of methamphetamine, but that's just a guess. That was your statement?
Yes.
Is that true?
It's a guess which amphetamine type drug he's under. I'm guessing methamphetamine. He's
Right.
under the influence of an amphetamine type drug.
Well, he tested presumptive positive for amphetamines.
Yes.
Does not prove he's under the influence.
The cutoff to be positive is a significant amount.
What is it? What's the cutoff?
I can't tell you on top of my head.
Okay. Now, you have determined in this case the cause of death to be excited delirium.
Yes.
Tell us, in your opinion, what is excited delirium?
Excited delirium is a acute confusional state. It has a fairly rapid onset. It always has an underlying medical condition that causes it. In this case, the underlying medical condition is the presence of a stimulant drug in his body. It is manifested by severe agitation. When these people die, they almost die same way, immediately after they're restrained, within minutes, but almost immediately they're put in restraints, they become unresponsive, they stop breathing, and they have no pulse. And that's what happened in this case.
Well, okay. Are you a member of any professional organizations?
Yes.
Which organizations are you?
National Association of Medical Examiners and the American Academy of Forensic Sciences.
Okay. And so National Academy of Medical Examiners has been referred to in this courtroom, although not explained what it was, is NAME.
Yes.
Okay, that's what they call NAME. Do you know that organization, which you're a member of, has now, for lack of a better term, debunked excited delirium in total?
No, they have not.
Are you allowed to, per your organization, use excited delirium as a cause of death?
The organization said they do not endorse using that term as the cause of death, but they do recognize that the underlying syndrome that it refers to can cause death and is a legitimate cause of death. They now want us to say the underlying medical condition. So in this case, we would say a stimulant drug intoxication, producing a delirium syndrome, resulting in death.
Well, how does that result in his death? He didn't OD.
No.
He did not OD. Let's
No.
be clear. It was not an overdose death.
No, these are not overdose deaths.
All right. So what killed him?
How the syndrome kills has been debated like for 150 years. It's well documented in medical history going back to the 1800s. Patients have this pattern. They get this delirium syndrome, severe agitation, and about the minute they're put in restraints, they just go unresponsive, they lose their pulse, and they stop breathing. That syndrome is well documented in the medical history. What has happened is the name excited delirium has been decided it's offensive. And it's very hard for me to talk with, because it just changed, because I can't explain this without using the word, but it's offensive for various reasons. And so National Association of Medical Examiners said, do not use that name. But they're not saying it doesn't exist. The syndrome exists. You can't change something just by changing the name.
But you're not saying that by using that term, excited delirium, on your pathology report, You're saying, essentially what you're saying is, well, I don't know how he died.
Yeah,
I don't know
I'm
how
saying
he
you're dying of this syndrome.
Yeah, but you're not saying how. Give me the medical, the clear mechanism as to why he stopped breathing, why his brain didn't get any oxygen. What happened?
Nobody knows.
Well, okay, fair enough. And that's why you use this term in this case, because you don't know.
We don't know the mechanism. We know that he died of this syndrome.
Well, that's your opinion.
Yes.
You're well aware that that opinion has been greatly debated and others disagree, correct?
Yes, experts disagree.
Okay. And that no one shares your opinion except the coroner here in Richland County.
Objection. It's only if he has knowledge of who agrees and who doesn't agree with him. So only if you know who agrees and who doesn't agree. Who is everyone? Well, hold on, I'm not asking, only if you know if he knows who agrees.
I can rephrase the question.
Okay.
Do you know of anyone, besides Dr. Burwell, who is the coroner in this county, you know Dr. Burwell?
I know who he is.
Okay. Besides Dr. Burwell, do you know of any other medical professional that agrees with your determination of manner of death in this case?
At the time that we did this autopsy, it was reviewed by all the doctors in our office, and there was a general agreement that that was the cause of death. I have not consulted. I have not asked other people. I haven't gone around the country asking other people's opinion, but there are pathologists. I'm not the only one who still believe or still know in their heart that in this syndrome.
Well, Doctor, you spoke way past the question. I just asked you if you know anyone who agrees with your opinions.
Hold on, I always let him finish their answer if he's being responsive. So if you want to finish, if you think you need to finish your answer, go ahead.
I'm saying I have not asked anybody else, but the people that at the time that we did the autopsy were in agreement.
Who are those people?
The pathologists in our office.
Who are they? Can I have their names?
Okay, who was working back in, there was Dr. Harshbarger, of course. There would be Dr. Casco, there would have been Dr. Brown, Dr. Upthegrove.
I'm sorry, Dr.
I'm trying,
Who?
Upthegrove, Uptegrove.
Thank you.
The doctors that were working in our office at that time.
But they didn't have any knowledge. Did they see the video?
Yes.
All of you saw the video?
We went over the video as a group.
Okay, and all those doctors were present?
To the best I can remember.
All right. Were you aware that Dr. Paul disagreed with you at the time?
I don't recall that. She may have. It's not uncommon that a fellow or a student would disagree and we try to discuss and come to some kind of a conclusion. I do not remember any disagreement that she voiced to me on this.
Okay. And if she had, what would have, who would have prevailed? Let's say if she disagreed with you, it's just you and her signature on the pathology report.
Right.
So who would have prevailed?
Well, you don't have the student have the final say. You don't have a student have the final
Doctor,
say
who would
at
have
all.
prevailed? You can say it. You would have prevailed, right? It was
Yes.
it was your opinion. And if she would have disagreed, you could have overridden that and said, no, we're using excited delirium.
I could have.
Did you?
I don't think I made that decision. I think it was done together.
Okay. That's your recollection.
That's my recollection.
Okay. So let me ask you this, Doctor. When a body comes in, you told Agent Linhart that you get an initial kind of a overview of what the body's coming down and what it's going to be. Like somebody used the example of, well, this body's coming down, it looks like a drug overdose or something like that. What was done in this case? What preliminary information did you have about Alexander Rios when he came into the Montgomery County Coroner's Office?
we would have had information from the Richland County Coroner's Office saying that he had died in jail, in custody. There was a altercation between him and the correction officers, and during that altercation, he suddenly went unresponsive. Then he was in the hospital for a week, and he died. And they at that time brought with them the video, so we had an opportunity to look at the video of that altercation with the corrections officers.
Who is the first person, if you remember, that came up with excited delirium?
I don't remember.
Okay. Would it have been Investigator Ball?
That is highly unlikely.
I'm sorry?
That's highly I don't remember, but he would not have done that. I mean, we wouldn't even consider talking to him about that.
But you had an initial information about what had happened, right?
Yeah, the general description of the events.
And so you don't remember if you were the one that came up with excited delirium?
I do not.
Okay. It would not have been Dr. Paul, would it?
I do not remember. I really do not remember how that came about.
Okay. And when you saw the video, what did you note about that?
Well, was the events. The guy is acting in a very bizarre manner.
Let me stop you right there. Why do you say that? Tell me specifically what you remember about that video that led you to that conclusion you just said. He's acting, in your term, very bizarre.
Okay, he's climbing on walls, jumping off of walls. He's shouting, yelling, screaming. He's not talking in a coherent manner. He may respond.
Excuse me, doctor. Let me stop you right there. What did he ever say? You said he was not talking in a coherent manner. What did he say that you didn't understand?
Well, he's just yelling and screaming.
Okay, but that's different
Shouts.
than coherent.
It wasn't organized thoughts and sentences like we're using. He did respond at times to a question or something with a short answer, but he's not carrying on a rational conversation.
Okay, and again, that's your opinion, right?
Yes.
Okay, go ahead. I'm sorry. Go ahead.
Then, at some point, the correctional officers, apparently for concern for his safety, and the safety of the people around him, decided to put him in restraints. There was a struggle, and it was very difficult to put him in restraints. And typically in this syndrome, it is very hard to put a person in this excited state in restraint. One or two officers can't do it. Some more join in. And in this case, there's like 5 officers struggling pretty much as hard as they could to get him in restraint. And then at the end, he died suddenly. He at least went unresponsive suddenly. He stopped breathing. He was pulseless. During the restraint, at one point, there is an officer on top of him, or there is pressure on his back. We know that.
And what do you think of that?
I don't know what. Excuse me. Can I have water?
Yeah, we'll get you one.
We don't know what to make of that part.
Why not?
Well, people with this delirium state, in the medical literature, it reports people with this state die suddenly or respond, just like he did basically, with weight on their back, without weight on their back, when they're placed on the side, and even if they're sitting in a chair. So we don't know what role that weight on his back is doing. If he could have died without the weight on the back, how can we say with certainty that the weight on his back killed him?
Okay. But as you know, you can't change the facts. You say, well, people can die sitting in a chair or on their side. Maybe, okay, but that's not the facts of this case. He was prone on a cement floor. You're aware of that, right?
Yes.
Prone means what?
He's laying on his stomach. I'm sorry.
Go ahead. Take your time.
Okay.
Take your time.
He's laying on his stomach. Prone means you're laying on your stomach.
Okay. So he's laying on his stomach, and a cement floor is underneath him.
Yes.
Okay. We were all at the jail yesterday.
Yes.
Okay, so we viewed it. And did you take into account the size of the man who was standing on his back?
Yes.
What did you think about that?
He's a large man.
Okay. And what do you think, as a medical professional, the physical effects on a human being who's laying prone on a cement floor with a large man standing with his full weight on his back? What do you think the physical effects of a human being would be?
It would make it more difficult for him to breathe.
Or impossible?
Not
Could it be?
necessarily. Not necessarily, but it could.
Not necessarily. I didn't say that. I said, but could it have made him unable to breathe? Did you consider that?
Yes.
Okay. And so, how is it that you can't say if he's unable to breathe because of somebody's actions, right, that is not at least a contributing factor to his death?
Because people have been studying this for years, and they're experts, more experts than me, saying both sides. What, if any, effect this weight is causing? The degree it may decrease his ability to breathe. But is it decreasing his ability to breathe to the point that with a short amount of time, probably less than minutes, that that would account for a quick, sudden stoppage of the heart, unconsciousness, and ultimately death?
Maybe I didn't understand what you just said. What was the amount of the length of time that you saw, hang on, I'm not done, that you saw Mr. Cooper, well, you don't know who it was, you saw some officer putting pressure on Alexander Rios' back. What was the length of time that they continued that pressure on his back?
When the full weight when the full weight of the officer was on his back, the period of time was, I think, seconds.
Okay, that was full weight. I didn't ask that question. I know that what the full weight was. What was the amount of time he had pressure on his back? Do you know? Did you try to determine that?
I don't have that. I can't remember what that time was.
Okay. Not only did you notice after he was standing on his back, right? He then, when he got off, do you remember what happened next?
This is the point where he died, I think.
And then, but what did the man who was standing on his back do next? Do you recall?
No, I do not recall what he did next.
Do you remember him kneeling on the center of his back?
I did. At this point, I don't remember that.
Okay.
I believe you.
All right. I'm asking you to believe me. I just was asking if you remember that. Would that cause? So this person, as you said, he's at least to your knowledge and sight, was unconscious at that time and unresponsive. Correct?
Yes.
Okay. Do you think there was any need to then continue to put pressure on his back?
I'm going to object at this point, Master Pro.
Yeah.
Doctor, would the length of time that somebody put pressure on Mr. Rios's back affect his ability to breathe? In other words, I guess what I'm saying is the longer the pressure is on his back, would that make it more difficult for Mr. Rios to breathe?
I don't think how long the pressure is, the length of time, is what, when it's stopping for breathing. It's going to be how much. Is it a significant amount of pressure that he can't breathe? But if it's a moderate amount, it could be a very long time. I mean, I don't quite understand where we're going.
Oh, well, okay, I'll tell you where we're going. You saw the video, and you heard Mr. Rios, did you not, struggling to breathe. Is that a fair statement?
Yes.
Okay, so what caused him to struggle to breathe?
The whole position he's being in with weight on his back.
Well, but who had the weight on his back?
The person that was pushing on it.
Right. The other 4 officers, if you watch that video, each had a limb. Is that fair to say? Does that
Yes.
refresh your recollection?
Yeah.
And so they were not putting pressure on his back.
As far as I could tell.
Okay. And so would you agree or not, Doctor, that trying to gain control of a limb would not medically affect his ability to breathe?
I would agree.
Okay. So again, you ask where we're going. What affected his ability to breathe?
Pressure on his back.
By one person.
And being in the prone position.
And being in the prone position,
Yeah.
right. Which he was.
Yes.
That's a fact.
Yes.
And only one officer applied pressure to his back. And by the way, we keep saying back. What portion of the body was he actually, anatomically, what portion of his back was he applying pressure?
The chest region, chest region, upper back.
Upper back.
Yeah.
Okay. And so where are the lungs located?
In the chest.
Okay.
Yes.
So I know we know that. I'm just trying to, for the record. So that would be someone standing on his back or putting pressure on his back would do what physically to his torso?
It would put pressure on his torso.
Compress it. Would that be a fair statement?
Yes.
And it would compress the lungs.
Yes.
Correct?
Yes.
That's a question. I don't mean to testify. Tell us when you breathe how the lungs work. When you take a breath in, what happens?
Oh, what causes the lungs to expand?
Well, okay.
Okay.
Do the lungs expand? That was my question.
Okay, the lungs expand.
Okay. And what does cause the lungs to expand?
So you're lifting your rib cage up and you're pulling your diaphragm down.
Okay. And so when someone's standing on your back, you're unable to, the lungs are unable to expand. Is that a fair statement?
Well, they don't just stop. I mean, there's still some breathing going on. It limits the ability to expand.
And how does that affect someone medically? When you can't breathe or when you're struggling to get air, how does that affect someone medically?
Well, then, obviously, they're not getting as much air as they would usually get.
Well,
Yes.
so I said medically.
Medically, they may have less oxygen because they're not bringing in as much air.
And what does that do to a person when you get less oxygen than you need? What medically happens?
We don't know that he got less than he needs. We know he got
I
less
didn't
than
ask
he
that
could would
question.
have normally.
Doctor, I didn't ask you that question. I'm asking you now, just medically, what happens to a person who can't get enough oxygen in their lungs? What happens medically to that person?
If the person can't get enough oxygen in their lungs to survive, they will go into hypoxia and die.
Tell us what epoxy is
Lack of oxygen
to the
to the body.
brain, right?
Well, brain, all the organs.
Right, but isn't that what really would cause a death? And I know you disagree with this, but in this case, if somebody found that was the cause, wouldn't that be the mechanism? That he wasn't getting enough oxygen to his brain, and that's why he died, correct?
Well, if there wasn't another cause of death that could have just as well have happened.
Right, I know, but isn't, I'm saying medically, isn't that would have been the reason if somebody who disagrees with your opinion, saying the pressure on his back caused him not to get enough oxygen and therefore he didn't get any oxygen to his brain, and that's how he died?
People, there are experts that would say that.
Okay.
Yes,
And you know that there are in this very case?
yes.
Okay. Before I show you the video, Doctor, I just want to ask, why is it in the, let me show this to you. And you know, it's been marked for identification previously, the state's exhibit number 1.
Yes.
Can you tell me what that is, please?
This is a copy of the autopsy report that was written by Dr. Paul.
Okay, and signed by you?
Yes.
Your signature, Tom?
Yes.
Okay. Have you reviewed this?
Yes.
Okay. Recently?
Yes.
Okay. Why is there no notation in this pathology report? This is a pathology report?
Autopsy report.
Autopsy report, I'm sorry. Why is there no notation of the fact that you and or Dr. Paul watched the video?
We don't do that in our office. We watch a lot of videos, door cam, body cam, video, cell phone surveillance. We do this routinely, it's useful, but we never incorporate that in the autopsy report. The autopsy report deals with the autopsy itself.
But you've used that and you've told us this, it's very important to get the history and the police reports and all the information before you can determine the cause of death, right?
Yes.
So it's clear that you at least took that into consideration, the video, to determine cause of death.
Yes.
Okay. Dr. Paul told us that you told her not to put that in the report. Is that accurate? She said she asked you if she
I
should
find
know.
that highly unlikely. A long time ago, I do not remember any conversation like that, but in our office, we don't do that. So if it came up, I would say that that's not the way we do things in our office.
Okay. And if that's the explanation, that's it. But just, do you know why? Why don't you think that's important to put in wouldn't it be more complete to say what you looked at and what you used to come to your conclusion?
Well, it might be, but we're reviewing a lot of things, and we don't list that in our autopsy report, everything that we review.
Okay.
We review medical records, the police reports, the videos, talk to the police, whatever. We don't list those things in our autopsy report.
All right. Isn't a symptom of excited delirium, if you believe in that is hypothermia, elevated,
Hyperthermia.
which means
Elevated blood fever, high blood pressure, high temperature.
Okay, and you're aware from reviewing the medical records that did not exist in this case.
No, there's no hyperthermia.
Okay, did you consider that before you? Isn't that unusual? Don't they usually have very high body temperature?
No, that's actually an unusual finding. Like about 7% of people that have this syndrome will develop a high temperature, and they're considered a unique category of this syndrome. I think it's separate. They have people with high temperature have a higher rate of death than people that don't have a high temperature. But the people that have high temperature are a minority of the people that die in this syndrome.
Okay. You also told Agent Leinhardt that the urine screen was just, in your words, just a quote, it's just a screening test, not a definite test.
Yes.
Okay. All right. Judge, can I have Agent Leinhardt help
Yes, absolutely.
State's Exhibit number 3. Doctor, I'll just show you this real quick. This is State's Exhibit number 3. It's a thumb drive, and the video's on it.
Okay.
All right, so I'm going to attempt to play that for you. Before we watch this, Doctor, I'm going to ask you, just so you know what's coming, that once you see this video, is this the video you watched? Okay. So
Okay.
just keep that in mind when you're looking at it. Yeah, would you? Thank you. So, for the record, I'm going to start to play the portion of State's Exhibit number 3. Go ahead, Eric, if you would, please.
What's this?
Rios.
Rios, I need you to come down so we can. Okay. Alright. Alright. I'm not gonna call anybody unless you come down from down here. Okay, this is the last time I'm gonna ask you. I've asked you for like 5 minutes. I'm not gonna do it anymore. Okay? We're gonna put you in a restraint chair for your safety due to not listening, being a writer, causing a risk to harm yourself. We don't have time to continue that all night. Okay? Alright, this is the last time I'm asking you. We're gonna go in, we're gonna go ahead and put you in the chair.
Why didn't you just open the door?
Alright, come on down. No. Is that a yes or no? Go ahead and turn around, put your hands behind your back, and cuff up for me. If not, we're gonna come get you. Alright. No? Okay, we're coming to get you. Let's go. Go. Go to the hands behind your back here.
Use your taser! Taser! I'm not even playing him!
Glasses, let me get my goddamn glasses.
Taser! Ow! 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 Alright! Ow! Oh! Can someone try tasing? Can you explain to me? Because you're a dumbass. Now you're the dumbass. I didn't say you were her.
Doctor, do you see at this point that there's being pressure applied to his back from a foot?
Yes.
Okay, and that's at, well, it's been, Eric, could you back it up a few seconds? Please. Keep going. A little bit more. Okay. Go ahead and play.
Hey, you were her.
So at 3:27 it starts, right?
Yes.
Okay. Now, is he still struggling at this point?
Yes.
What's he exhibiting? What's he exhibiting there? Is he? He's
He's
not. He's
moving
not
his
up.
head, he's squirming,
Does he? He doesn't. He's to this. Well, I'm going to play the whole thing and I'll ask some questions. Go ahead. I'm sorry.
Fucking took out all his stuff.
Really?
Yeah, he's like,
Give me your hand behind your back.
oh shit.
Somebody take it.
He's on some type of, I believe.
Keep playing.
You need to. anybody else available? Rios? Rios. Alexander Rios. Yeah, he thinks he's supposed to be out of here and.
Doctor, would you agree from here on out, he's not making any more noise, not breathing? Can you tell that?
I don't remember that, but I'm going to take your word for it.
Well, no, don't take my word. I'm asking you to watch the video. If you disagree, that's fine. Go ahead and
I
play.
just don't know.
Jack, I think the question's from here on out.
Yeah, we'll
He's
play.
not given an opportunity to watch it, and he says he can't.
He's already seen it. Yes, he has had the opportunity to watch.
Okay, well,
And determination of cause of death because of it.
Turn it off. Let go of the car. I'll fucking. Let go of the car.
Right up there on the wall.
Pull that thing out.
Get a pair of shackles.
We got another hit. You can come.
Where's the other hand?
I got it.
Where's that?
Now we go.
I only have one hand guard. I can't.
You want a pair of shackles?
Okay, I'll get another hand.
So I can't
beside me. You know you
Got it.
get up. All right.
Grab some, oh, he's got them. He got shackles.
Ready?
Alright,
Yeah.
shackles.
Give me the other hand. Bring it forward from guys. You got it.
Shackle down there.
This glove.
Number two, babe?
You know, 1 second. Where's the red?
Is this on YouTube, babe? Go slide his foot out there?
Where's that?
Alright.
That might be able to cinch up around his ankle. Do his ankles now, so. Keep going. Yeah, come on the other side of the wall. When we come up, we're going straight up into the chair. All right. Good, we're out behind you. And long behind you.
I got you.
All right, I got the chair so it doesn't move. Okay. You two ready? Just turn them. Straight up. Hear me? Get up.
He's turning blue. Call squad. Master control, call the squad.
Lead down. Give 1 sec. Try to give it some dark to make sure everything's going okay for him. You can move.
So we just watched Stacy Exhibit number 3. Doctor, is that the video you reviewed? Do you
Yes.
Do you recall that? Okay.
Yeah, it's as I remember it, yes.
Okay. So that is the video you saw. I just want to be sure. Oh.
That's what I think. It's been a while, but yes, I think that's the one I saw.
So now that you said before when I asked you, you didn't notice or didn't remember that him kneeling on his back, right? Did you see that happen when he finally released his foot from his back? That he immediately, within seconds, kneeled on the center of his back?
Yes,
Okay. Would that affect a person's ability to breathe likewise?
it would affect his ability to breathe.
Okay. The statements have been made that he struggled all the way until he was cuffed. Do you agree with that after watching that video?
He became unresponsive, stopped struggling shortly before, sometime before the cuffs were on, yes.
Okay. And so, Doctor, do you remember how many times you watched that video before you determined cause of death? Or did you just watch it one time?
Oh, no,
Many times?
several times, but I don't know how many times.
Okay. And so having having seen that again, and I know it's been a while, right? It's probably been a
Yes.
few years, right? Having seen that again and knowing that there are other pathologists that disagree with your determination, can you understand why another medical professional would disagree with your professional opinion?
Oh, yeah. I mean, I'm not saying that they're incompetent or they're lying. I think they have an honest opinion, and I can see how they would come to that conclusion, yes.
Okay. Tell us what you know to be positional asphyxia.
Positional asphyxia is when somebody is in a position where they're unable to breathe.
Because of that, they're unable to breathe because of the position they're in, right?
Yes.
Did you or would you consider that in this case?
I would give it, I would give it consideration,
Okay, and did you?
yes.
And what led you to not determining that that was cause of death in this case?
Well, the short period of time that he's having trouble breathing, not, hours. It's a short period of time when he's not trying to breathe. And we don't know how much he is unable to breathe, how much less than normal he's able to breathe. They have done studies where they put weights on people, like 250 pounds, and the experts say that is not life-threatening. There's probably more than 225 pounds on him. But I don't know if this difference in weight is enough to make such a dramatic change where it's not life-threatening to almost instantly killing him. And I know that people with this syndrome, even without weight and not in this position, just sitting in the restraint chair, die just as we just saw. In fact, in Montgomery County, several years ago, we had a case. Nobody was ever on him. I saw the video. He's sitting in that restraint chair that you saw. And just when they got him clamped in, he just went like that, stopped breathing. He was pulseless, and it was just that quick. It was over.
But in this case, again, doctor, I'd ask you not to change the facts. The facts in this case are that he did have pressure on his back, and his lungs, to what you said, would have most likely been compressed and deprived of oxygen. So don't change the facts. I'm asking you not to change the facts. That happened in this case. I understand you're saying you used some other case somewhere.
Correct. I believe counsel's testifying with respect to what happened in this case. That's what it is.
Okay, I'll let you rephrase, I'll just.
Well, would you disagree with me, doctor, that that's the facts of this case? That's what you just watched, is the man was putting pressure on his back and made it difficult for him to breathe. Do you disagree with that?
No, I agree with that.
Okay, so again, I know you've seen other cases where there's no pressure, but that's not this case, is it?
No.
Okay. So, doctor, are you saying it's your belief that if he didn't have any pressure or somebody wasn't standing on his back, that he would have died anyways?
I don't know.
Well, I know, but you're an expert. You're a
Yeah.
pathologist. That's
Yeah.
what your job is, right? So do you have an opinion of that?
My opinion is we don't have enough information because we know without pressure on the back, these patients die. They die too with pressure on the back. We don't know what role that pressure did. Is that pressure changing the chain of events, or would he have died without the pressure? We don't have that information. I can't say and come up here and stand and testify to a reasonable degree of certainty that I know that pressure on his back killed him. Because I know he could have died without any pressure on his back.
Yeah, but your job is to render a medical professional opinion. You do that every single day as a cause of death.
Yes.
So you're saying, well, I don't know, but first of all, you guess that he's under the influence of methamphetamine. You guess, right? Your words.
I'm guessing which drug it is. I know
Right.
he's under a stimulant drug, and stimulant drugs cause this syndrome.
Right. Isn't that the leap, though? like you would be to say the pressure on his back causes death. You're making a leap that he's under the influence when the fact is he tested presumptive positive for amphetamines. And to your quote, that's just a screening test, not a definitive test, right?
Yes, but it's finding something. It's
I
finding an
understand.
amphetamine type drug,
Right.
a stimulant drug in the system.
Just like the video shows him standing on his back. Just like that.
Yeah.
And then you have to take the next logical step. For your amphetamine, to methamphetamine, to pressure on the back, to him not being able to breathe, not getting oxygen to his brain and dying right in front of him. Right?
I think if I follow you, yes.
Good. That's all I have to.
Before cross-examination, ladies and gentlemen of the jury, let's take a 10-minute break. Remember the instructions about not discussing the case, not forming or expressing any opinions, not paying any attention to media coverage, and not doing your own research and investigation. We'll come back in 10 minutes and we'll continue with Dr. Jones' testimony.
Doctor, you're welcome to take a break. Just don't discuss your testimony.
I think I'll see.
Okay.
Thank you.
Need some more work.
Thank you.
Awesome. Richland County Common Police Court is back in session.
May be seated. Yeah. Go ahead.
Thank you, Judge. Good morning, Doctor.
Good morning.
My name's James Mayer. I'm going to ask you some questions on behalf of the defense here this morning. Just like you did earlier, if anything's not clear, ask us to rephrase and I'll try and ask a better question, okay?
Okay.
All right, so I kind of want to, some of this is going to be going over some of the same ground, of course. And so I kind of want to get back to the structure, starting out of the Montgomery County Coroner's Office, some of the responsibilities and that kind of thing, okay?
Okay.
All right, so how long have you been working at the Montgomery County Coroner's Office?
34 years.
34 years. You've indicated that you've testified as an expert how many times?
Hundreds of times.
Hundreds of times. And I suspect that because you all perform autopsies not just for Montgomery County, but counties like Richland, that you testify, would seem all over the state.
Southern Ohio mostly, yes.
Southern Ohio. To that end, I'd like to approach you with what's been marked as Defendant's Exhibit A. May I approach, Judge?
Yes.
Okay. I'd like you to take a look at A, just for a moment, and tell me if you recognize the graphic that I've provided to you.
Yes, this is a...
Can you hold it up so the jury can see it with the court's permission?
Go ahead.
This is a map of Ohio, and there are colored in blue counties that we do the autopsies for in the state of Ohio.
And I think on direct exam you indicated somewhere 30 plus counties is the estimate?
Yes.
And it would seem as though that's consistent with that, right?
Yes.
You also indicated it covers most of the southern half of the state?
Yes.
And that also seems accurate, right?
Yes.
What's the red county there right in the middle?
Red
is that where the
county
most
is-
trouble is, or what is that?
That's Montgomery County.
Oh, I see. All right. So that's where you do all your work.
Yes.
All right. There's even one over here in what looks like somewhere outside of Ohio. What's that?
Wayne County, Indiana.
Okay. All right. So you perform autopsies for Wayne County, Indiana as well.
Yes.
All right. You indicated you've been there how long doing this?
34 years.
Are you a board certified forensic pathologist?
Yes.
Okay. Testified hundreds of times, you indicated. Generally speaking, when you get subpoenaed, it's by the state of Ohio, I presume?
Yes.
You also get subpoenaed by the defense from time to time, right?
Yes.
But ultimately, when actually raising hand and testifying, it's for the state of Ohio in your experience, yes?
Yes.
Okay. And in fact, you are here testifying in the state's case, correct?
Yes.
All right. In looking at the report that you signed back on November 22nd, 2019, do you have a copy of that in front of you? Well, we've got an exhibit
Yes.
that I think we can. May I approach, Judge?
Yes, but it looks like he has his own copy.
Okay. Would you take a look at State's Exhibit 1 and just see if it's the same? Actually, I think we'll just have you look at that and confirm that that is the report that you signed.
Yes.
Okay. You signed that down there at the bottom on November 22nd, 2019.
Yes.
And you signed that where your name is typed out also indicates Chief Deputy Coroner. Yes?
Yes.
Explain to us the structure. Who is the county coroner in Montgomery County?
The county coroner is Dr. Kent Harshbarger.
Okay. And that's an elected position, is that right?
Yes.
Okay. Yours is not?
No.
All right. Explain to us how many forensic pathologists are working in the Montgomery County Coroner's Office at any given time, average, for Dr. Harshbarger performing autopsies?
Full-time, there are 6 of us, and then there are about 4 or 5 part-time.
Okay. And are all of them called chief deputy coroners?
No,
How many are?
just 1
And that's you.
at that time.
At that time. Okay. And at that time, that made you number 2. Is that fair?
Yes.
Okay. And so when you say that you discussed these findings that led to the opinion that we have had discussion about already here and we'll have more on during my questioning, you indicated that that was arrived at based on a discussion between you and obviously Dr. Paul, right?
Yes.
But you also named off a number of other doctors as well, yes?
Yes.
And those would have been some of the other full-time forensic pathologists that you just mentioned were on staff then?
Yes.
Okay. And also there would have been discussions with the guy whose name's on the door, Dr. Harshbarger, right?
Yes.
Okay. And collectively, after having reviewed all of the findings and the video, as you indicated several times, the determinations, the cause of death are what you mentioned, yes?
Yes.
And that was at the time excited delirium, correct?
Yes.
All right, we'll get into that in detail as we go on. You did not offer an opinion back in 2019 as to manner of death, correct?
Correct.
And as I understand the testimony Tuesday from Dr. Paul and also your testimony earlier, that's because when any of these other counties in blue bring you a body for an autopsy, you will conduct the autopsy and make an opinion as to cause of death, correct?
Yes.
But you do not make an opinion as to manner of death. You leave that to the coroner who is elected in the county where the death occurred.
Yes.
Okay. And so you were asked, however, by Mr. Salisbury, if you had had the opportunity, or I suppose, for example, this all occurred in Montgomery County, you would have made a conclusion on manner of death and an opinion, correct?
Yes.
And that opinion as to manner of death on November 22nd, 2019 would have been accident, yes?
Yes.
Okay. And you indicated that that has everything to do with the lack of intent, right?
Yes.
All right. A lack of intent to harm.
Yes.
Now, you also were working in a teaching capacity at the time, correct?
Yes.
All right. And that's sort of how Dr. Paul factors into this, right?
That is correct.
She was a fellow, which you have indicated is similar to a residency, right?
Yes.
All right. And so it's a teacher-student relationship.
Yes.
And I believe you indicated on direct exam, if there's ever a difference of opinion between teacher and student, the way the process works there at your office is the teacher opinion prevails, correct?
Correct.
And that's just similar to any other teacher-student type relationship, right?
Yes.
Okay. Now, I'm going to ask you some specific questions. I believe Mr. Salisbury for the state asked you if you ever recalled any discussion or disagreement between you and Dr. Paul in this case as to the opinion that she signed as to the cause of death being excited delirium, her opinion. Was there ever a discussion that you recall or a disagreement about that?
I do not recall any specific discussion. Discussion.
All right. Well, she took it a step further when she testified, so I want to ask you this. Do you recall pressuring or otherwise ordering her over her objection, pressuring her to make this opinion of excited delirium?
No.
Did she ever come to you and say, why are you pressuring me into this, complaining or anything like that?
No.
Do you ever remember her sitting down in one of these roundtable discussions and laying out a detailed alternative theory to the excited delirium that she signed her name to?
No.
With respect to the video that you were asked extensively about, why doesn't the video, I believe the questioning went, why doesn't that we watch this video appear in the pages of this report? And it does not, correct?
It does not, and we do not put it in our report what we review, because we review a lot of things, medical records, police reports, EMS run sheets. We review a lot. We do not list them in our report.
And that's policy,
Yes,
every case,
yes,
ordinary course of business.
yes.
Okay. So it's not an effort to hide the fact that she looked at the video and you all didn't want it to be in the report. That's not what happened here.
No,
How sure are you of that?
absolutely.
All right. Now, there is a system in your office that allows, whether it's you or one of the trainees, the students, to indicate what they did review, right?
Yes,
And you told Agent Leonard about that in an interview that Mr. Salisbury referenced, didn't you?
I did.
And that was about 5 or 6 minutes explanation that you gave about how it is documented and reported that you did watch the video in this case and any other, right?
Yes,
Has to do with something called the LIMS system, right?
yes.
We're not talking about arms and legs, right?
It's a computer system.
All right, tell us how that works and tell us how, in this case, that would have been documented that she watched the video, everybody else watched the video, and how it works generally. What's it for?
The computer system is a record-keeping system, and it keeps documents such as the autopsy report, the investigator's report, toxicology, and part of that system, record-keeping, is that the doctors can write notes when they do an autopsy, things that they find or they perceive or could come up later. Like if there was a case in the hospital and I thought that the doctor had done something wrong, I would specifically say what I read and when I read. We have that option. We do it. We don't in every case say every time I see a police report, I don't say I reviewed the police report. But when it's something that anticipate that will be of use later, it's put in there, and that's what happened in this case.
So there absolutely is record in the system at the Montgomery County Coroner's Office that the videos were reviewed, that the video was reviewed in this case.
Yes,
There's no cover up here.
yes.
To that point, you were asked questions about Bob Ball. Do you know Bob Ball?
I don't know if I actually met him. We talk on the phone a lot.
Okay. Now, as it relates to this case, you were questioned by Special Agent Leonard about whether Bob Ball is the one who started getting everybody at the Montgomery County Coroner's Office talking about excited delirium, as if he was influencing you to make that opinion. Do you remember Leonard asking you about that?
Yes.
How did you answer that?
No, that never happens.
Would anything like that ever happen?
No, it doesn't.
Well, why not?
We're consultants, and they're asking us for our opinion, and we would probably be highly insulted if somebody tried to tell us what we are going to find. He's an investigator, we're the doctors, we're the consultants, and I think we would have found it offensive.
Did any detectives from the Richland County Sheriff's Office come down there and tell you this is what we want?
No.
Would you find that offensive?
Yes.
If that happened, in this case or any other, Richland County looks to be about the furthest north on that blue. Do you think you would say we're going to turn that white?
I think we would have, yes.
Meaning you all wouldn't be doing their autopsies anymore, would you?
We would not.
All right. You indicated that Dr. Paul performed the autopsy, conducted it, right?
Yes.
Standard procedure that she would be able to do that?
Yes.
And it was under your watchful eye, correct?
Yes.
And you were in and out of the room as it's happening, right?
Yes.
Okay. There were other people in the room as well, standard practice, and you can tell that if you need to refresh your recollection from your report,
Yes,
correct?
yes, she isn't alone. There's a photographer and there are usually several assistants. And, it's not a one-person thing.
Assistants that work in the Montgomery County Coroner's Office?
Yes.
Are they also forensic pathologists, fellows, or something, I guess, maybe structurally below and on the totem pole?
They are, I think an analogy would be like a nurse-doctor relationship.
Gotcha. Okay. All right. And so they're also, in this case, and not uncommon, a representative from law enforcement was there, correct?
Yes.
And that would have been this Detective Radojicevic?
Yes. I think that's what's in the report, yes.
Okay. We've also heard testimony that an agent from BCI stopped in at some point. Does that sound as though something that would be normal?
BCI almost always accompanies a case, suspected homicide, or a case from any other county. BCI usually gets involved and it will come to our office in a company case.
Nothing uncommon about BCI being involved?
No, that's pretty routine.
And like you told Special Agent Leonard, they're welcome to come whenever they want, right?
Yeah, we do. We don't have any rules.
Right. And so when the autopsy is being conducted, this is the table here, right?
Mhm.
And you've got Dr. Paul working, just generally, the people who are observing, right,
Yes.
in this circumstance, the law enforcement types, they're just actually in the room, right?
Yes.
So they're not like we see in some movies or things like that behind glass or up in a balcony or something like that, right?
No.
They could be as close to me and you
Yes.
if you're performing.
Yes.
They can hear things like conversations going on.
Yes.
Not uncommon for the forensic pathologist that's performing the autopsy to make some comments to assistants and or law enforcement during the process, right?
That is not uncommon.
And generally speaking, it would be common for the person performing the autopsy to say things that are of note.
Yes.
Take note of this is what I see here. All things that might be relevant later to cause of death, yes?
Yes.
Okay. And in this case, there were several of those things to talk about during the autopsy, right?
I wasn't there, but I'd agree with you.
Okay. Now, you mentioned the photographer. Photographer in every autopsy?
Yes.
All right. Special Agent Leonard wanted to ask you about the photos in this case. Do you recall that?
Yes.
And he said, well, there were only 18 pictures taken. Do you remember that?
Yes.
All right. Is that out of the ordinary to have just 18 photographs taken of an autopsy?
No.
Is there a number that you have to take?
No.
What's the standard?
In our office, we take what we call standard photographs, and we photograph the condition the body is when it arrives at our office, with the clothes, medical equipment, whatever is on them. And after we document that photograph, maybe describe what we see, the body is disrobed, the body is washed, and then we photograph the body from the right side, the left side, the back, and we take pictures of the face. We take standard pictures that pretty much document the entire skin surface of the body to show if they're injured or if there isn't any injury. And then during the autopsy, if there's something related to damage to the lung, damage to the liver, or kidney, damage in the neck, or anywhere in the body, if there is an injury or some significant findings, we'll photograph that. If there are not, there's no injuries there, no damaged lungs or heart or whatever, there just aren't that many, we don't take pictures, we don't take a lot of pictures of normal.
Don't take a lot of pictures of normal.
Yeah.
Right. So you're not in there just taking pictures to take them.
Yes.
So it stands to reason that a person who has a more unremarkable examination during their autopsy, there'd be less pictures, right?
Yes.
All sorts of injury and different things of note with respect to abnormalities. You could have many, many, many pictures, yes?
Yes.
Okay. And so as it relates to the 18 photos that were taken in this case, you've reviewed them, correct?
Yes.
Consistent with the findings as to what was photographed?
Yes.
All right. And we'll talk about some of the photographs that were taken that were of consequence or of note in this case, okay?
Okay.
In a little bit. All right. So I want to kind of get right into the report itself, okay? The report appears to be broken down essentially almost conclusion first, and that's page 1, right, with opinion?
Yes.
And some of the accompanying underlying relevant pieces of information that lead to that opinion. Is that fair?
Yes.
Okay. And then from there, beginning on page 2, you just kind of get a head-to-toe examination starting with the external and then progressing to the internal organs. Is that fair?
Yes.
Okay. And then the last portion of that is what has been described previously as a toxicology report or a lab report, right?
Yes.
Okay. All right. So I want you to confirm some of these things for me. The report confirms that Mr. Rios, upon his arrival, was 5'10" and 194 pounds. Yes?
Yes.
Appeared generally fit?
Yes.
Okay. Aged, according to the report, 28-year-old white male.
Yes.
Okay. Talked about the number of photos that were taken. If you need to, as you take a look at the report, during the external examination, there is discussion about the eyes. Can you get to that portion?
Okay, my hearing isn't good.
I was looking down. There's a discussion about the eyes and the examination of the
Yes.
eyes and also the mouth. I want to start with the eyes. It's on page 2. Looks to be second paragraph under external examination. Let me know when you're there.
Yeah, I'm there.
Okay. So we're talking about the eyes when we talk about the sclera and the conjunctivi as being unremarkable.
Yes.
What does that mean for these folks?
There's no damage, no injuries, there's no evidence of disease.
Okay. We go on to talk about the eyes being free of petechiae. Can you give the jurors a definition of petechiae?
Okay, petechiae are small hemorrhages, little red spots. But what has happened, the capillaries, little small vessels, capillaries would break, and they show little, basically red dots in the sclera and the white and around the eyes. And that's what she's describing, that they weren't there.
That they weren't there.
Yes.
And so if they're not there, are we going to take a picture as standard procedure so that we can say they're not there?
Generally, no.
Because we don't photograph normal, is that right?
Yes.
Okay. Petechiae show up in other areas as well sometimes in autopsies, yes?
Yes.
Where else can they show up?
Actually, it could occur anywhere, but often in the face, particularly around the eyes, inside the mouth, oral mucosa, in the throat, on the larynx, epiglottis, that area.
All of those areas were examined by reading through this report, correct?
Yes,
And there is no mention of the discovery of any petechiae in those areas either, correct?
that is correct.
Okay. Now, for purposes of discussion, petechiae are relevant to note in certain types of cases. Well, they're always important to note, but what relevance do they have when it comes to your line of work and what sorts of determinations you can make based on presence of petechiae in any of those places?
Okay, petechiae are a sign of an asphyxial death, but particularly if there's like strangulation or if there is a compression asphyxia, like we're talking about in this case. What happens is the blood pressure that's in the chest or blood pressure through closing off your neck rises in the capillary. When closing off the neck, it's because you're stopping the blood from returning through the jugular veins. So the heart is pumping blood up into the face. It can't escape through the jugular vein when you're compressing the neck, and then the capillaries break. A similar thing happens when you're putting a lot of pressure on the chest. The pressure in the chest is now going up through the veins into the face, and then the capillaries break and you get those small dots that you're referring to.
And that pressure on the chest can be either on the front portion, I guess, of the chest, or pressure on the chest from behind.
If it's being compressed, yes.
And so someone in a prone position who's having pressure applied to their back could exhibit petechiae.
Yes,
And in this case, we have no evidence of that.
correct.
Relevant to you when you were making some of the determinations that you made in this case?
It's relevant, but probably disappointing to you that the problem is they don't stick around. So we're examining the body a week. He's been in the hospital for a week. And in that time, they can resolve. And it's entirely possible that they were there. And by the time we got the bodies, they have resolved, they're gone.
Okay. No evidence from any of the hospital records that they were present.
That is correct.
Okay. And so can resolve over that period of time suggests potentially not resolve either though, right?
Yes.
Fair. Okay. I want to talk about the examination of the neck. There was both an external and an internal examination of the neck, correct?
Yes.
With respect to the external examination of the neck, there was nothing unremarkable.
Yes, there was nothing to describe, yeah.
Examples of remarkable would be any type of discoloration as a result of bruising, correct?
Right.
All right. And in fact, there were no bruises on the anterior or the posterior neck, correct?
That is correct.
Nor on, I guess, the sides. Is that a technical term?
No, there were no bruises.
What are the sides? What would we call that?
The sides.
All right. All right. And And this would be anterior, wait,
Yes.
posterior back here, anterior hip.
Yes,
All right. One more. All right, so also the internal examination.
yes.
How does the internal examination of the neck occur and how did it occur in this case? Do you need to refer to your notes to help you?
Well,
To your report?
I know it's in
Yes.
the report. I didn't actually witness, the exact procedure. I may have, but I don't recall the exact procedure that was used. But in every case, we're taking up the skin, and we're examining the muscles, and we're looking for fractures of the hyoid bone, we're looking for damages to the carotid arteries, the jugular veins, any bruises in any of the muscles.
Internal bruising.
Yeah, that's part of every autopsy,
Sure.
but I didn't know the exact procedure, or at least I don't remember the exact procedure that was used in this case.
When you talk about those muscles that you're looking for internal bruising, are those called strap muscles?
Yes,
What are the large vessels that are also mentioned alongside strap muscles?
okay, am I hearing bad again?
Are the large vessels the carotid artery and so forth?
Oh, yeah, she's referring to the jugular vein and the carotid arteries.
Okay, and the strap muscles are the surrounding support system?
Yeah, those are what turn your head and lift up and down.
No abnormalities, no internal bruising noted with respect to that internal
Yes.
examination.
Yes,
Hyoid bone and the larynx were both deemed to be intact and uninjured.
yes.
Show us where those are.
Well, the hyoid bone is right here. It's it's what your tongue is kind of attached to, and it's squeezing on the neck. That could fracture. That's a fracture of the hyoid bone would be a fracture, injury we'd see in somebody strangled. Okay, I forgot the rest of the question.
No, that's fine. With respect to the examination of those two areas, the hyoid bone and the larynx, both were intact and uninjured.
Yes,
Okay. It also indicates there were no tongue contusions.
yes.
What's that mean?
But he didn't bite his tongue, basically. Bruises in the tongue usually happen when somebody's biting the tongue. It could happen in an altercation, but the most frequent time we see is somebody bit the tongue, and it's most often in a seizure or something like that.
Okay. And there was nothing to support any of that, no damage to the tongue, correct?
Correct.
Okay. The back was examined as well, correct?
Yes,
The examination of the back was, quote, unremarkable.
yes,
Okay. From that, we can conclude that his entire back had no bruising.
yes,
Okay. Now, when we're talking about the distinction between pressure in a compression situation,
yes,
okay, I heard you drawing a distinction between length of time and how much pressure, right?
yes,
Okay. And so you talked about studies where people have weight vests loaded up with 250 plus pounds to see how
225 pounds. I
225.
said 250, I was wrong, 225.
225 loaded up, and findings you can make based on that, people being able to breathe and
Yes.
not being life-threatening and so forth, right?
That's what the expert said.
Certainly stands to reason that at some point, there's enough weight you can put on someone's back where they're not going to be fine. Is that fair?
Yes,
Okay. And when you have that, you can have actual injuries that are associated with that, correct?
yes,
You were asked questions about the mechanism of breathing, right?
yes,
It's the rising and falling of the rib cage, the muscles in between, and the diaphragm that help with that process. Is that fair?
yes,
Okay. In a compression injury, if there is enough weight placed on the back of someone in a prone position, there's nowhere to go at that point, right?
yes,
You can have broken bones like broken ribs or fractured ribs, correct?
right,
Are you familiar with the condition flailed chest?
yes.
What is that?
Flail chest is when the ribs, all the ribs on both sides are fractured, usually toward the front. And when that happens, if the patient tries to breathe, the chest goes in. You have to, there's no way to expand the chest. And if they try to breathe with their abdomen, the same thing happens. The chest caves in because it's movable. The chest has to be somewhat rigid for basically a vacuum to form to pull air in so that people can breathe.
Right. So that would be an example of when a person's in a prone position and weight keeps getting loaded on top of them, the weight's not going to give, eventually the body can give, right?
Yes,
And that can be evidenced by fractures.
right,
It can also be evidenced prior to that by bruising, yes?
yes,
All right. And to be clear, in this case, in the examination of Mr. Rios, there were no injuries noted whatsoever to his back.
that is true.
Okay. One thing that was noted was kidney stones, correct?
Yes,
Okay. And that might have been something that was discussed, not as it relates to his death,
Yeah.
but
Yes.
as an interesting finding.
yes,
Okay. Let's talk specifically about evidence of injury,
yes,
okay? This paragraph can be super long or it can be real short, right?
yes,
In this particular case, the injuries would best be described, evidence of injury would best be described as minor, yes?
yes,
And certainly non-life-threatening.
yes,
Spray a little Neosporin and a Band-Aid maybe, right? Abrasions.
yes,
Okay. And there were 4 of them noted, all ranging in 1/4 of an inch to a 1/2 an inch on different areas of your body, of his body, and Dr. Paul testified to those already. Do you agree with those?
yes,
Okay. Now, I want to get to what was the subject of so much of your testimony earlier, okay? As you were making your opinion, you indicated that with respect to 2019 and the opinion of excited delirium as the cause of death, you described it as a syndrome, which is characterized by a pattern or a group of findings, right?
yes,
And we'll get into those in a moment. But in explaining that to the jury and also to Special Agent Lenhart, you indicated that the syndrome has to be brought on by something,
yes,
right? And what you really mean is the delirious state, right?
right,
Which is still a thing in 2023, as I understand your testimony.
yes.
We just not going to call it excited delirium anymore.
We can't use that word.
We're going to show our work, and we're going to give you all the group of findings that would support delirium,
Yes,
but we're not going to call it that.
we're just changing the name.
Doesn't make it any less of a thing, though, right?
No, it's still there.
But it is unusual and it is uncommon, right?
Yes,
But it's brought on by something, right?
yes,
And you have opined back then, right, and today, that you believe it had to do with methamphetamine intoxication,
yes,
right? Methamphetamine psychosis is a thing, right?
yes,
All right? And it's a delirious state, right?
yes,
And it's characterized by a number of things, right?
yes,
We'll get to those. All right. Now, in getting to that opinion, you were challenged on the idea that, whoa. The hospital test doesn't say positive for methamphetamine. It says presumptive positive for amphetamine. Remember that?
yes,
And you said, yes, that's true, right?
yes,
But you also indicated that the threshold, the cutoff, has to be a significant amount of amphetamine to make it into that panel to be a presumptive positive, correct?
Objection.
Basis.
He said he didn't know what the cutoff was.
Whatever the cutoff is.
If you can answer, if you know, you can.
I don't know what the cutoff is,
Right.
but
You know that there are cutoffs at hospitals.
yes,
And you have a familiarity that whatever the cutoff is, it's consistent with what?
that it's a significant level. The doctors don't want a lot of false positives. They don't want to try to treat something that is not significant.
Right. And certainly, and in a urinary screen, you're not going to get presumptive positive for methamphetamine, right?
No,
What you're going to get are something that would be a component of methamphetamine.
in the same class.
Same class, yes. And that would be the amphetamine, right?
Yes,
And that's a stimulant drug?
yes,
Okay. And so you concluded that presumptive positive was one of the factors that led you to believe that Mr. Rios was suffering from methamphetamine intoxication, right? One of the factors.
yes,
There were others, right?
yes,
One of the peculiar findings, perhaps unusual, you tell me, was the examination of the stomach of Mr. Rios, correct?
yes,
You were not asked about that, were you?
no,
Okay. But that's documented in the report, what was located in his stomach, correct?
yes,
All right. And what was located in his stomach was a small plastic bag-like object that was ruptured or torn, correct?
yes,
And that was significant enough that it was collected by Dr. Paul, yes?
yes,
And it was provided to law enforcement right there at the scene, right?
yes,
For evidence.
yes,
right? And that happens from time to time, right?
Yes.
But not all the time.
No, not all the time.
All right. So anything that might be relevant to the investigation as to anything else that law enforcement is doing, if it's located during the autopsy, protocol would be to allow law enforcement to collect it.
Yes,
And that's what happened in this case.
yes,
All right. Now, referring back to page 1, which is the opinion page, you have Roman numeral 1 at the top. You see that?
yes,
You indicate sudden collapse, signed off on sudden collapse, your opinion, following excited state and physical altercation with law enforcement, correct?
yes,
That speaks directly to the physical altercation with law enforcement, right?
yes.
You're not ignoring that, right?
No, we're aware of that.
Right. So much so that it's in the first sentence that you put on the opinion page that happened, right?
Yes,
Okay. And that physical altercation with law enforcement is almost a hallmark of excited delirium, restraint-based interactions, right?
yes,
Okay. Now, you indicate Roman numeral 1, first letter A, torn, ruptured plastic bag-like object in the stomach, yes?
yes,
And then right after that, you move into section B, which is the urinary drug screen, positive for amphetamines following hospital admission. In your opinion, are A and B1 connected
yes.
in making the determination for excited delirium?
We're not relying entirely on it, but we're using that as further support. That
What
diagnosis.
relationship, just so we can just give it to them straight, what relationship does the locating of the plastic bag ruptured, torn object in his stomach, how does that dovetail, if it does, with the presumptive positive for amphetamines in this case?
We do thousands of autopsies, and prisoners, once they're arrested, occasionally, shortly after they're arrested, die of a drug overdose. And for the most part, they're not getting the drugs in jail. What is happening is if they have drugs on their body by the time they're being arrested, in an effort to hide that evidence of the drugs, they swallow it.
And so you've seen this before,
Yes,
and it has in the past led to overdose deaths in your experience?
yes,
Okay. And so the location of that evidence in the stomach dovetails with the presumptive positive for amphetamine when you were making the conclusion of methamphetamine intoxication, right?
yes,
Of course. Just common sense based, yes?
yes,
All right. And it's also consistent with your experience in drug overdose deaths, right?
yes,
All right. Now, a lot of discussion was had with respect to what the floor could be on a presumptive positive, right?
yes,
Okay, when Mr. Salisbury is asking you questions. And that's fine. We'll get to what the threshold cutoff is, and you've told us what those are in general. Because we don't have a confirmatory test, that test would not just tell us, right, like hospital blood, would tell us not just specifically what the drug is, but it would tell us levels, correct?
yes,
And so, stands to reason that because we don't have that confirmatory test, we could be dealing with a astronomical level with respect to the methamphetamine that was consumed, if that's in fact the case, correct?
correct,
All right. And it stands to reason that the more methamphetamine you ingest, the more erratic and psychotic your behavior can become, correct?
Objection. If you know.
I think we're confusing actually two things.
Please.
There's,
Thanks for correcting.
you can have reaction to methamphetamine the way he's describing as an overdose. Or, in this case, a reaction that's causing a syndrome.
Sure.
And I think you're mixing the two together.
Fair. What I'm getting at, to be clear, is we can't tell from the presumptive positive. We know what the basement is on what that threshold cutoff is on the amphetamine presumptive positive, right?
Okay,
What we can't tell is what the absence of the confirmatory test can't give us what, in the absence of that, we can't get the level, right?
that is true.
And that level certainly could be at a toxic level, correct?
Yes,
Okay. Toxic meaning potentially causing death.
right.
Okay. Are you familiar with what the toxic level is with respect to, if you know, methamphetamine?
There isn't like one level. So, and the question comes up a lot. If, I even can't give you enough, if there's a significant amount and then you have nothing else. It could be maybe 100 nanograms and maybe 1,000 nanograms. If that amount of methamphetamine is in the body and we have no other reason to explain the death, then we'll contribute the death to methamphetamine. But there isn't one level that we know will kill you and a safe level below that will not kill you.
Okay. But certainly the greater the level, the greater the risk.
Yes.
Okay. All right. And so the last piece to this, as far as making the determination or the opinion that methamphetamine intoxication plays into the excited delirium and the condition that Mr. Rios was exhibiting, is his behavior, right?
Yes.
Okay. And so when you talk about the syndrome, which is a group of findings, you have testified this morning that it is hallmarked by an acute confusional state. Yes? All right. What I'd like to, where someone without warning sort of goes from being relatively normal to disoriented. Is that fair?
Right.
Okay. These people that are exhibiting this pattern of findings also typically combative. Yes?
Yes.
They also display extreme agitation.
Yes.
They also can exhibit increased strength, I believe you told Officer Leonard.
Yes.
And that's consistent with your experience and expertise and training with respect to excited delirium and now the pattern of findings that would go along with that.
Yes.
Okay. And they also can prove to be difficult to restrain.
Yes.
And I would assume that that has to do with everything that just came before that put together.
Right.
If they're combative, if they're disoriented, if they're confused, and they're exhibiting increased levels of normal strength, then that's by definition going to make it more difficult to restrain someone like that, right?
Yes.
These people are probably also experiencing some degree of natural adrenaline as well, right?
Yes.
Okay. And adrenaline is what people think of, right?
Right.
It's like people that are in a stressful moment. Your story is about people being able to like lift the back of a car. I mean, they're anecdotal, but things like that, right?
Yes.
All right. People that have adrenal moments and maybe even this excited delirium, they can have dumps at the end of them, right?
Yes.
Okay. Now, so when you put all of that together, when you're talking about something has to trigger the delirium, right?
Yes.
And you're pointing to methamphetamine intoxication, what you indicated to Leonard is what you've told this jury today. You have hypothesized or opined that it seems that this individual ate a bag of methamphetamine that led to this, right?
Yes.
Okay. And so you've got the presumptive positive for amphetamine, the behavior, and the bag in the stomach. And that was the information that was available to you back in 2019 that caused you to conclude that the triggering event for the delirium was in fact the methamphetamine ingestion intoxication. Yes?
Yes.
Okay. All right. I'd like to watch the video with you a little bit as well.
Okay.
Is that okay?
That's okay.
All right. Just like Mr. Salisbury here moved on Agent Leonard, I'm going to lean on this fellow who's standing up. Can we have a moment, Judge? Yes. By we, I mean.
It may be down below there, where the arrow's at. But go further down. This one? Bottom. This one? Right there. There. Thank you.
Sean, I'm going to ask you to pause at points in time, okay?
Yep.
I'm sorry, Judge. Just one minute. On paper. All right, hit it.
What's his last
Rios.
name? Rios, I need you to calm down so we can.
You were supposed to let me
Okay.
go this morning.
Alright.
All along.
Alright. I'm not gonna call anybody unless you come down from down here. Okay, this is the last time I'm gonna ask you. I've asked you for like 5 minutes. I'm not gonna do it anymore. Okay? We're gonna put you in the...
All right. Now, during direct examination, before they put that video up there, they asked you questions to explain how he appeared to be acting confused. And you gave examples of, well, he's speaking in confused manners, he's shouting, things of that nature, right?
Right.
Okay. When we pause it, all right, where was he standing?
He was standing on a short wall.
Yeah, like a short cement half wall, right?
Right.
All right, and he's wearing what amounts to a green suicide type suit, right?
Yes.
All right. Now, if I took a break here and climbed up on this half wall and started asking you questions, but instead of that, just started saying, I'm not supposed to be here, call the law, would it be your opinion that I'm acting in a confused state?
Yes, it would.
It's common sense, right?
Yes.
Objection. I guess sustained.
All right. I'm not going to do that, okay? But when we talk about evidence of a acute onset of a confusional state, that's evidence of that, right?
Yes.
Okay. And keep playing.
Straight care for your safety, do not listening and be uninvited or causing a risk to harm yourself. We don't have time to continue that all night. Okay? Alright, this is the last time I'm asking, and we're gonna go in, we're gonna go ahead and put you in the chair.
Why didn't you just open the door?
Alright, come on down. No.
Handcuff.
Is that a yes or no?
I'm supposed to.
Go ahead and turn around, put your hands behind your back.
Stop.
Cuff up.
Do you see Mr. Rios looking around up in the ceiling and trying to look up here for things?
Yes.
All right. Also evidence of some confusion there, perhaps, as you're watching the video?
Yes.
All right. Keep going.
For me. If not, we're gonna come get you.
Right.
Alright.
You got
No.
it wrong, man.
Okay, we're coming to get you.
Ready?
Let's go. Go.
Yeah.
Go through that. Hands behind his back here.
Pause. All right. So you indicate that a person that is exhibiting signs of the pattern, delirium, that they appear agitated,
Yes.
sometimes extreme agitation.
Yes.
Agree he seems agitated, if not extremely agitated, as he's in there and as he bursts out of the cell through the COs?
I agree.
Okay. You indicated that people exhibiting pattern of the syndrome are combative,
Yes.
running through the COs and around the booking area and then wrestling with them. Is that what you see here?
Yes.
Evidence of combative?
Yes.
Okay, please continue.
Come on, man. I know you're fighting.
Use your taser.
Pause. You see evidence of Mr. Rios up to his knees and starting to raise to his feet there?
Yes.
Okay. You see a number of individuals in black uniforms, corrections officers at that point?
Yes.
Fair to say that all four of them at that point are struggling and using their body weight to try and gain control of him.
Yes.
And this all is occurring as he is wrestling with them, correct?
Right.
Please continue.
Baby.
Crazy.
No, dude, take it off. Taser. I'm not even playing.
More wrestling?
Ah!
Okay, we just heard a taser there, right?
Yes.
Now, talk to us about a taser. Something that you have familiarity with at the coroner's office?
Some, but I'm certainly not an expert on tasers.
Okay. But you know that it is an electronic stun device?
Yes.
All right. What else do you know about it? Just
Crazy, painful shock. Yeah.
the idea is to bring compliance with that, right?
Right.
Okay. And it does so by causing pain to the body of the person that is tased.
Yes.
And that puts a toll on the body, correct?
Yes.
All right, please continue.
Ow! Ow! Last week I got them guys so later. Ow! Ow!
You see more tasing going on there?
Ow, already.
Yes.
Please pause. At this point, we see more corrections officers. You can kind of see the head of an individual here at the top of the screen. Do you see that?
Yes.
It was described by Mr. Salisbury that all the other corrections officers during this attempted restraint were holding on the limbs of Mr. Rios. Just watching the first minute or two of this restraint, would you agree that it seems like many COs are putting their weight on Mr. Rios?
I think I can agree with that. Yes.
He's in a prone position, correct?
Yes.
We do not see any foot on the upper back area at this point, do we?
No.
Instead, we can see this officer who appears to have his body behind. That would be his weight on top of Mr. Rios, correct?
Yes.
Just a portion of it.
A portion.
We have this corrections officer laying completely across, putting pressure on Mr. Rios' head, correct?
Yes.
And we also have tasing going on during this time.
Yes.
And then from this video, we can't tell what the other corrections guys are doing, right?
I agree.
Okay. But we can tell it's a collective effort to try and get him restrained, right?
Yes, it is.
Okay, please continue.
Oh! Oh! Can someone
Try tasing.
Can you explain to me? Because you're a dumbass.
All right.
Now here's the dumbass.
Pause it, please. Okay. And I believe now at this point we do have pressure being applied to the back area, upper back area of Mr. Rios. Would you agree with that? Did you see
Yes.
that? Okay. And so to be clear, when you were answering the questions about amount of force and that sort of thing, right?
Yes.
It wasn't so much about length of time to you as it was how much pressure is being applied, right?
Right.
And the only time during this entire video that we can make any determination as to the individual who gets up on both feet, applying all of their body weight, is during that 7 seconds when that happens, right?
Right.
Every other moment that any pressure being applied by anyone, and it's just clear that there's a lot of people applying pressure intermittently to Mr. Rios, correct?
Yes.
And not just his limbs, right?
That is correct.
Right. And so the only time that we can tell how much pressure is being applied by the individual who gets up on both feet is during those 7 seconds, right?
Objection.
Based on what he sees on the video, if you can answer, if you know.
That's all I see. Yes.
Yes. And so right now, when that foot first goes up on the shoulder area, we can't tell how much weight is on this leg and how much is brought to bear on the foot that is actually on Mr. Rios' shoulder, correct?
Correct.
That's an important thing, an important vital piece of information that you simply didn't have available to you and can't have available to you when you're making your determination, correct?
That is correct.
Right. And if I understood your testimony, it's one of the reasons why your answer is, I can't tell what the actions of the officer who lifted both feet up, what role that had with respect to the death, right?
That is correct.
Please keep rolling.
Didn't say you were her. Oh!
Thought he took out on himself.
Really?
Yeah, he's like,
Oh! Ah! Your hand behind your back.
oh shit.
Somebody take it.
He's on some type of, I believe.
Keep playing.
Please pause. Back it up, the 10-second little loop there, Sean. Okay, roll it.
Somebody take it.
He's on some type of,
Pause. We can see the green suicide smock here, would you agree?
Yes.
Here, it's just all black, right?
That is correct.
And this is on what would be the mid to lower back area, right?
Yes.
This would be the weight of another corrections officer on his mid-low back, right?
Objection.
If you can tell, based on the video.
I don't know.
Right. Stands to reason, right?
Yes.
Again, only if he's able to make a conclusion.
Fair to say, it's difficult to make a conclusion because it's a sea of bodies wearing black that are all crawling around on him, right?
I agree.
Okay, please continue.
I believe.
Keep playing.
You need to.
Pause. During this time, you can hear Mr. Rios communicating in some ways with the correction staff, right?
Yes,
There's that period where there's the dialogue about who's a dumbass and the confusion and who caused this and all of that, right?
that is correct.
He's also making some yells and things like that, right?
Yes,
All indicating, if he's communicating things like that, that he's breathing, right?
yes.
Okay. At no point in time during the time he's communicating does he at any point say, "I can't breathe." You don't hear that on the video.
I did not hear that.
Okay, please continue.
Do we have anybody else available? Rios? Rios. Alexander Rios. Yeah, he thinks he's supposed to be out of here and he's reading it on the wall.
It's during these 7 seconds that you know that that full 250 pounds or whatever gentleman weighs at the time, right?
That is correct.
Okay. And now he's back down.
Yes,
So we go back to not knowing how much pressure is being applied
yes,
by him.
yes.
Okay, please continue.
Hey, Mom. Let go of the cup. I'll fucking. Let go of the cup.
Pause. Some 15 seconds or so after the individual gets off of the back, his full weight, you were questioned about there's no meaningful movement after that or something to that effect.
Yeah.
Did you hear the officer indicate twice, let go of the cuff?
I think that's what I heard.
Okay, would you like to hear it again?
I don't really want to hear it again.
Okay. But you think that's what you heard, right?
Yes,
Right? The officer's instructing the individual to let go of the cuff, right?
yes,
Suggest meaningful effort and movement by Mr. Rios, right?
Objection.
If you know, if you can make that opinion.
it suggests that, yes.
Okay, please continue.
Right up there on the wall.
Pull that thing out and come out.
Get a pair of shackles.
Can we get another hit? Can you come? Where's the other hand? I got it.
You hear the CO still talking about getting shackles and getting handcuffs, correct?
Yes,
You want a pair of shackles?
Okay.
So I can't beside
me. Alright.
grab some, oh, he's got them. We got shackles.
Ready?
All right.
Yeah.
Shackles.
Give me the other hand. Bring it forward, guys. You got it?
Shackle down there.
This glove.
Those are too big?
You know, second.
Where's the latest? Is this gonna be too big? Let's slide this foot up there?
All right.
Okay. Don't jump around the ankle. Do his ankles now, so. Keep going. Okay, come on the other side of the wall. When we come up, we're going straight up into the chair. All right. Cooper, I'll be behind you. And I'll be behind you guys. All right, I got the chair so it doesn't move. Okay. You two ready? Just turn. Straight up.
All right. Thank you for going back through the video and answering my questions on that.
okay.
All right. And so that is the video that you watched several times before you ever put pen to paper on this video, correct?
That is correct.
And you've had an opportunity to answer questions this morning for the better part of, I'd say, 2.5 hours with a little break in there.
Yes.
As to how you arrived at that opinion.
We
Recall that?
we arrived at
You had questions, you had an opportunity to answer questions all morning about how you arrived at that opinion, correct?
yes,
Okay. And so as you sit here today, you can confirm that your opinion back then was excited delirium, correct?
Yes,
You also confirmed that had you been given the opportunity, had it happened in Montgomery County, the manner of death, in your opinion, would be accident.
yes,
The same autopsy was conducted today, subsequent to the changes with respect to how NAME wants you to describe excited delirium now, okay?
Yeah.
How would you describe the death as cause of, how would you describe the cause of death today?
we can't use that term. And what NAME endorses is to put the cause of the delirium down. And we know there is a stimulant drug, so it would be a reaction to a stimulant drug, probably or possibly methamphetamine, causing a delirium or causing a fatal delirium, something to that effect.
Okay. And then leading to what, as far as the pattern with respect to the delirium, leading to what did that cause? The methamphetamine intoxication.
The methamphetamine intoxication is causing the delirium, which results in death.
Right. Okay. And so is your opinion changed today as to cause of death?
No,
Okay. Despite all those questions by Mr. Salisbury.
it had not changed.
Okay. Now, what about manner of death? What's your opinion on manner of death today?
Accident?
Same as it was in 2019, same as it is today in 2023.
Yes.
One moment, please. Sure. Okay. And I think I need to ask you this question to sort of finish the conversation. Once you cite all those indicators as far as the pattern for the delirium, the methamphetamine intoxication, all of the things that we've been through with respect to the onset of confused state, combative, all of that, increased strength. Once you cite all of those things, do you then get to the conclusion that it was all of those things that brought on the anoxic encephalopathy?
No.
Then explain to us how we get there.
He had a cardiopulmonary arrest. His heart stopped, he stopped breathing. And then he had CPR, maybe 15, 20 minutes, whatever it took to his heart to start beating again. Now during that time, he's not getting enough oxygen to keep his head alive. There's a period of time after he stopped breathing before he start CPR, and even with very good CPR, it is not unusual that the patient ends up with damage to the brain and anoxic encephalopathy. And when that happens, they end up on a respirator because they can't breathe, and eventually they die of respiratory failure. Because they can't breathe on their own, they can't keep enough oxygen going to their heart, and the heart stops. So I think that's what you're referring to.
Yeah, and so if I understand, that becomes a byproduct of the cause of death that you've described.
Right.
No other questions, thank you.
Follow-up questions, Assistant Prosecutor Salisbury?
Thank you. If you photograph all the important things, why didn't you photograph the plastic what is noted as a plastic bag in the stomach,
It's photographed.
in your photographs.
Yeah, it's photographed. I would think you would have them.
Okay. Well, I would too. You know that you don't know what that is, what that object is, that it's been, since Mr. Mayor brought it up and he correctly pointed out that I didn't go into that, but he did. You know that that has been tested at BCI and you cannot determine that that is in fact a plastic bag, correct?
Correct.
Okay. And you know that it did not test positive for any drugs, correct?
Jack can ask you a question.
Yeah, come on up. Layman, it's about lunchtime. There's some stuff I need to do with the attorneys, and it may take a little bit of time. So it makes sense for us to go ahead and take our lunch break, and then I can have conversations outside of your presence and the juror's presence with the attorneys. Let's do that. Let's take our hour lunch break. Come back in an hour, ladies and gentlemen, and we'll continue with Dr. Layman's testimony. Same instructions as before. What to do during the break. Thank you. Oh, not now.
Yeah, just, I said,
Yeah, so we're still on the record. So there was a question about live streaming, and I don't have a problem live streaming during the trial, and this is part of the trial, just on breaks. I didn't want live streaming if the attorneys are talking, whether it be the prosecutors are talking to on a break, or the defense counsel are talking, or defendant. That's when I didn't want live streaming. I'm fine with live streaming during portions, because this is anything that's on the record, like we're on the record now. That's totally fine. It's stuff that's when we're not on the record. I want to make sure we're not recording prosecutor conversations with a witness that are off the record, or defense counsel discussing the case with their client on a break. I don't want that to be obviously live stream. So it's when we're on the record, I have no problem. It's off the jurors have left, we're still on the record. Do you want Dr. Lehman, can he go, or do you need him here?
I don't think we need Dr. Lehman for this.
Okay. Dr. Lee, we're gonna let you have a lunch break, and we'll come back, and I appreciate you staying over lunch. I would like to finish you up, but there's some stuff I gotta do that might take some time. Thank you, Doctor. We're gonna let you take your lunch break too.
All we do is ask them.
So what we were talking up here, and I didn't want to have a discussion in front of the jurors, was about the question being asked of Dr. Lane was whether he knew that the item taken from Mr. Rios' stomach did not test positive for drugs. And that created a conversation about discovery and those kind of issues and whether there was a report or not a report. So that's where I wanted to do this outside the presence of the jury. So where we were, we can begin again.
I think it would be appropriate. I think they've got an opportunity to communicate amongst themselves. Maybe they just know the answer at this point.
Okay.
So I'm referring to the report that was given to Mr. Mayor by Mr. Thompson. The Friday, June 12th, Bureau BCI forensic scientist David Davidson completed the analysis of submitted evidence. In addition, 2 digital photograph Davidson indicated the following question material submitted as item number 1 is found to be polymer that is 30-something minus 125 mils thick, having convex shape. The exterior surface of the polymer has a very fine texture.
I would appreciate it if you wouldn't read that quite so fast.
I'm sorry. The interior surface is smooth. Some of the edges of the polymer are jagged and appear to be torn, indicating that the piece was either a part of another item or has had material removed from it. Instrumental analysis and special library search revealed the composition of the polymer to be consistent with polyvinyl chloride PVC.
So that's what you were referring to?
Yes.
That's not only what he was referring to. He also asked Dr. Lehman, isn't it true that the bag was tested and tested not negative for presence of drugs?
Well, that, Judge, my
That
question is
is what I'm
maybe
getting.
inarticulately stated. In that report, it did not test positive for any type of drug.
What, do you know if it was, in fact, was that analysis done on that date, was that part of the analysis to see if it did have anything on
Of
it?
course not. That was a trace, that's a
I don't
trace
know.
guy. Specifically not a drug.
Hold on, I'm asking him.
I don't know.
Okay. Well, I think then,
Leonard does.
I
I've
think-
spoken to him about it.
okay. Well, I think that, the question then would be not related, so the objection would be sustained to that question, and then you can follow up with the fact that well, I don't know if you follow up with this
Well, I
witness,
think
you
it goes
just follow up with someone else, that there was no definitive test done.
It's now the second time that this has been affirmatively stated by the state in this case. During opening statement, Mr. Thompson stood up and in talking about that bag, he indicated that it was tested and it did not have drug, and it did not come back with the presence of drugs. Okay, so that's the second time this jury's had it. So I'm going to ask one time on the record, was that bag ever tested, that came out of his stomach, that bag, was that tested in a BCI crime lab for the presence of drugs or any crime lab in the United States of America? Yes or no?
The test that was done, you have.
Judge, I want an answer on that.
Well,
It's yes or no.
my answer would be this. There was clearly nothing to test on that, or because it's a BCI technician, and if they would have seen anything on that to test, they would have tested it. So that's my answer.
No, that's
He's
not
a
clear.
trace
He's a
guy.
trace guy. We spoke to him when they gave this 2 days before the trial, only because we found out about it. We called him and he said we wouldn't do anything. We're not a drug lab. The drug lab's in a different part of the state. I'm a trace guy. I look at paint, I look at footprints. I don't do anything with drugs, period. That's a mischaracterization. And when I spoke to Special Agent Leonard, he said the exact same thing and specifically told me that he did not have it tested for the presence of drugs, period.
So
That's the
it
answer.
sounds to me like it was never tested by a drug, it would be someone like Tony Tambasco.
Right.
It would be looking, it was never tested for that.
It was not, Judge, but
Even though it sat in Tony Tambasco's office for 3 months.
because there's nothing to test. That's my point. There's nothing on there. You can't test nothing. I mean,
Then don't tell them that they
test
tested it and it was
Then
negative.
don't tell him that.
Yeah,
I didn't tell him
Grossly,
that.
yes, you
I'm
did.
asking a
You
question.
specifically said, isn't it true that that bag did not
He could
test?
answer however he wanted to answer.
Well, I don't think you can
And
ask
that
the
goes to the
question
other
that.
point, I don't think this guy knows any of that.
Well, I get it. And I don't think it's appropriate to ask, that's not an appropriate question to ask if it was never tested. That do you know if for a fact it never tested positive for drugs? If it was never tested positive for drugs, you can't make that assertion in front of the jurors because you're giving them information that is misleading. And
Well,
you can't mislead the jury.
I
There was a
understand.
test done.
Not my intention, Judge, I apologize. However,
Second time it's happened in this trial on that
as
issue.
Mr. Mayor, taking a shot, pointed it out, I didn't even bring it up. He brought it up, but the reason he brought it up is he's misleading the jury and wants them to think that it's a baggie of methamphetamine and
It's a
it's
reasonable
legal. And
inference
that
that
is
this
not a
doctor has-
reasonable inference. As you've said, it's not been tested, so how is that a reasonable inference? It's
Circumstantial
absolutely a
evidence.
guess.
Well,
And
Your
he
Honor,
said
it's
it's a
not a guess.
guess.
It's circumstantial
He said it's a guess.
I let
His
these
words.
guys go back and
Educated
forth.
guess.
Now, I want to say this, on the record. There is no evidence that that's a bag. None. It has not been established in any testing anywhere. It was a fragment of a piece of plastic. And the evidence will be adduced that it's just as likely a piece of medical equipment that was used during the intubation than it was a plastic bag.
There's
so the
actually
piece of
evidence
that they're
right
talking
here
about-
in this autopsy report that says it is a torn, parentheses, ruptured plastic bag-like object.
Then go
So
back
there
to the
is-
comment
there
in there,
is
if I may.
And I want to follow up on this, and this is the other piece to this. This lab that they gave us, only because we found out about it 3 days before the trial, specifically excludes it as a medical device that was provided by Leonard for comparison. It's excluded they have 5 categorizations of confidence in their finding, and it's 5 excluded, meaning it is impossible that the medical item that he brought to them met any of the same criteria. It is scientifically possible that what he brought after 6 months of looking for it that we never knew about as their smoking gun theory as to why this isn't a meth bag, their own scientist says it's excluded what they brought him. And so to say that it's just as likely is just a fairy tale. And I'm gonna tell you one more thing. He's not even subpoenaed by the state of Ohio. We only subpoenaed him because we don't know what to do about this information that isn't provided to us in a case that we have been ran down for 9 months because we aren't ready for trial. How can you not be ready for trial when they're withholding evidence that they intend to stand in front of this jury and try and make a mockery of our argument? This is a trial by ambush. And the last thing about it is I think that the entire question about PVC material should be stricken. The jury should be made to disregard it because that is an expert report that was provided days before the trial by the state. They can't make any reference to it. They can't call Davison. It's a non-starter in this case. If they wanted that in this case, they should have been in here begging for a continuance so that we would have the time to use it. We didn't ask for it because we didn't expect they're going to talk about it when it excludes it as their theory. I mean, what are we doing?
Judge, I'll say again, I did bring up the baggie, he did. I didn't touch it with.
How can I not bring up the baggie when it's in the corner
And it is not
side?
excluded, he's misleading you. What I talked to Davison, and what he said was, it didn't match the object that Leonard brought to him. Not that it wasn't a medical device. It wasn't that medical device. He will say that.
How many others
And
did
he
you
said
bring to
to
him?
me over and
Fair
over again,
question.
I have nothing to offer in this case. I have no idea what that was. I have no idea.
Are you intending to offer any testimony that you don't know what it is? Is that something that is being offered by a witness to say, are you offering a witness to get up here and say, I don't know if it's a plastic bag, I don't know what it is, I don't know what it is? Okay.
No, we do not plan to do that.
All right, so in that case, then I don't think we can argue facts not in evidence. So if it's, the problem with the state's argument is that the autopsy report says a plastic-like bag. So it's in evidence, it's in the autopsy report, so they can talk about it. Now, you guys can talk about it that we don't know what it is, or it could be something else, but it's in the autopsy report. How does it not?
Then I would ask that the defense not refer to it as a baggie of methamphetamine. It's a plastic-like bag.
Okay. Well,
And words are important, Judge. I mean, he's just said he doesn't know what it is. That's like that. Now he also used the word when he talks about methamphetamine intoxication, and he admitted it, that I'm guessing. He said that, I'm guessing.
what an opinion is. Well,
No, it's not.
What he said was, he believes it was meth because he believes that he had a amphetamine in his system, and he's like, well, the most likely amphetamine would be methamphetamine, and then based on all his other findings, that's why he came up with his opinion of excited delirium, because he relates it. So, yeah, you're right, he says it, he's guessing it was meth because of the presumptive positive for an amphetamine and being in the urine. That, so, I think he's allowed to opine those things, even though he's saying, I don't know exactly what kind of amphetamine class it was. I believe it's most likely to be methamphetamine, which is what I think his testimony was. So he's allowed to say that. We can't argue, we can't say something we know is not true, which is that the bag was tested, the bag-like item was tested and it did not contain drugs. If it wasn't tested by somebody to confirm or deny whether there was drugs on it. So I would sustain that objection, and so we can't ask that question because I think it's misleading. So.
And I'm gonna ask for, both of those questions regarding the PVC-like material, all that be stricken, because that's evidence that's not in this case. It's an expert report that was provided to us days before trial. They're not calling that witness.
Well, I remember the question about the baggie not testing for a substance.
The lead-in question, the lead-in question was, it's not a bag at all, it's PVC. Was the gist.
No, that's not.
Well, we could just read it back. Let's just read it back. I'm cool with
Read it
that.
back, that's not what I said. I said,
Yeah,
we
read it
don't
back.
know what
I
it
said the
is.
gist.
It's consistent with PVC. We don't know what it is.
That's what
I'm
I
not
said.
saying it's not a bag. I'm not saying it is. Nobody can.
You are absolutely saying it's not a baggie when you're asking questions like that. You know,
I'm not.
As much as I'm saying it's a baggie of meth, you're saying it's not a bag.
I'm not saying it's not a bag. We don't know.
Then don't argue
And I
that in closing.
think it's
I bet
unfair
you
to
will.
argue that.
I bet you will in closing, or your partner.
Well, I think that it's fair to say that it's baggy-like. So I think the state can argue that we don't know. We don't know exactly what it is. It's described as baggy-like. It's an exhibit, is it not? Is it going to be?
Yeah, and that's another thing. They took 4 or 5 pictures at the they complained there was only 18 pictures. 1/3 of them they're of the bag.
Outside of the body after it was washed. Outside of the body after it was washed.
Were taken until he told you that bag. Come on.
So if I
It's right here. It's right in the report I gave you. Yes, I do know. The picture wasn't taken where it was found.
In the body.
What I would-
no pictures were taken.
What I would
of the bag.
propose, hang on, what I would propose, I strike the last 2 questions and tell the jury to disregard those questions, and we get Dr. Lehman back, and we continue on it in the future. We don't make arguments that it didn't contain drugs, because that's something that's not in evidence, and it's not going to be put into evidence. You can argue we don't know what it's baggy-like. We don't know what it is baggy-like. You can make that legitimate argument.
But you said we can't say it didn't contain drugs, then I'd ask that you tell the defense not to argue that it did contain drugs.
It's an inference.
What's good for the goose?
It's not good for the goose. What you can do is
why are they allowed to infer it did, and we're not allowed to infer it didn't?
Well,
I would also ask, Your Honor, here's the exact language that comes from the medical report.
okay.
The gastric mucosa is arranged in the usual rugal folds. The lumen contains 10 milliliters of tan fluid in a single piece of semi-lucent cellophane-like material, approximately 1.0 by 0.75 inch. That's the totality of the description of that plastic. What they're referring to. Can I finish a sentence anytime today?
When you say us, it's asking for a response.
I'm saying that the reference to the bag-like material is in the summary in item 1.
Right.
Torn, ruptured in parentheses, plastic bag-like object in the summary. That's a summary. That's not how it was described in the medical examiner's report.
And that's fair. You can absolutely point that out. That's
Thank you.
absolutely fair to point out to Dr. Lehman.
I'm totally cool with that.
I just don't want to, and I get you're saying we don't know what was in the bag.
If anything.
They're going to say, though, they're
We
going
don't
to
even know
argue.
it was a bag.
They're going to argue an inference. We know this. Mom said it already testified. Mom's already testified that he had meth abuse issues. I don't know if there's gonna be testimony about whether he was, what happened in scans coming in. You told me a little bit about that in pre-trials, that there might be, when they ran into a scanner, there might show something. I don't know. I'm waiting to hear that. But I think there's enough that there's an inference, and then with what this doctor says, his opinion about excited derivative, I think there's enough that it can make an argument that there's an inference that the bag contained. And you can follow that up and say, first of all, we don't know it was a bag, because we're not sure, bag-like. And second of all, we don't know what was in it.
We agree. We're not saying they can't argue against it.
Right.
We're just saying they can't get up there
You
and
don't
start
wanna
saying
say-
there was a test done and there were no drugs in it.
Right. That's
It's
what
apples
I'm
and
saying.
oranges.
I'm saying don't say that there was a test done, because there was no affirmative test done on the bag to determine whether it contained drugs. So don't make that argument, but I think everything else is open to argument. So I'm not limiting anybody, I just don't wanna say something that we know isn't true, that is, the baggie was tested for drugs, and it didn't have it in there. And I guess you could make an argument, we don't know if it's a bag, we don't know what it is. So if you say it's PVC, we don't know what it is, right? We don't know what it is, it's plastic.
We're going to object to any testimony that that is PVC.
Because we don't know.
No, when there is a report
We know
that we
there's a
were provided
report.
with 2 days before trial.
I keep
which is
hearing that,
X.
Your Honor, we got it when he got it.
That's not
That's
true.
just absolutely.
That's not true. That report says Forrest Thompson asked us to look at this to determine what this bag is. It
That's
didn't have some-
absolutely correct.
Okay, and on top of that, we know that Dr. Mitchell received those items, including that report.
No, Dr. Mitchell did not receive that report.
It's in his materials
He responds, he makes reference to notes from the BCI agent. That's what he's referring to.
And
He never refers to this, not that I'm aware of.
That's, first of all, that's the autopsy report. But second of all,
Excuse me, wherever it lays.
he absolutely references the BCI report regarding polyvinyl chloride,
Well, now you're just arguing that you got it.
100%.
That you got it, because you got the expert report 9 months ago.
No.
So you got it.
No, we
So
didn't.
you did get it. You're saying
We
you
got
it.
Mitchell's report.
Right.
with no explanation
Right.
as to what it is.
Well,
And
you
so
bothered to follow up?
we did. We called that guy and we called Davidson.
Same old defense.
Well, again.
Same old defense attorneys.
Well,
Same
wait
old
a minute,
defense
don't-
tricks is what I said.
Well,
Why didn't
listen,
you get it? I didn't.
So you're arguing.
How else do I get it unless you give it to me?
I did, you had it in Mitchell's report. You just said you did, you just admitted it.
Pull Mitchell's
You
report
just
out.
admitted
Pull
it.
Mitchell's report out and read what it says, and you tell me.
I'm
what
not
it
doing
says.
what you say, Jim.
Well, you're telling me
I'm
how
not
it is.
telling you, I'm telling you got it and you just admitted it on the record.
We didn't have it.
You just admitted it.
We didn't have it until that guy showed
You
up.
just
before-
admitted it, you
Before
stepped on
trial
yourself.
started and handed it over.
Let's put Leonard under oath and ask how this all went down.
Well, I assume he'll probably go under oath at some point. You probably.
But it's going to be as to inadmissible evidence. I think it's important enough as a discovery violation that we have testimony under oath, because that man right there is going to say that he walked into this courtroom on the morning of the final pretrial, which was days before, and handed an envelope with my name on it to this man, Mr. Thompson, and explained to him what it was, which were the contents of all of the reports that we never got, and all of the narratives that this man created that all had to do with the PVC bag testing that went on at BCI. 2 separate lab reports and a narrative that we never had. And the only reason we became aware of it is a cryptic line in the Mitchell report that references a report that was done by some scientist Davison that we put together to mean, well, maybe BCI did some more stuff with this. Probably not, because every pretrial we showed up to, we said we want all the BCI stuff and all the lab reports, and we're sure that we had it all. And I guarantee you, if Agent Leonard gets up on that witness stand, which will take about a minute, he's gonna say that's exactly how it went. And the way the whole process got triggered is because I called him and he called me back a day before the pretrial or 2 days before the pretrial and just was honest with me about all the extra stuff that was done and had no explanation as to how we wouldn't have it, because he gave it all to the prosecutors in the matrix when it happened in real time, which was 2 years before this case ever got indicted. And they used that material and sent it to Dr. Mitchell, and it formed the basis, apparently, for some of the opinions that he gave. And so that's how this went. And for him to say, oh, you stepped on yourself and you actually had it all the time, come on. That's how it happened. Leonard knows it, and Davidson knows it, because they were both just honest in talking about how it happened.
So your argument, get back to your argument, you don't want them to say anything about PVC, because
Absolutely
that was
not.
something that was done in a report you didn't get until not within the 21 days.
Correct, and when we sat in your office in the continuation of the final pretrial, Mr. Thompson indicated, well, we're not using that anyways, there's
Right.
no need, and as soon as we talk about this bag, they can't wait to get up and start talking about it.
All right, well then, the ruling is don't talk about baggie being tested for drugs if it wasn't, and don't talk about PVC tests if those weren't provided in discovery before 21 days before trial. And then that's just simple. I don't think we need to put anybody on it, do any testimony, just don't.
That's fine, Judge,
don't bring
I
it
don't
up.
see Agent Leonard sitting over there disagreeing with any of this, so I think we know what's up.
All right, well, that's the ruling. Let's get our lunch break, and then we'll come back and I'll strike those 2 questions and we'll continue on.
Judge, what time are we supposed to be back?
I have no idea.
shut it off until the judge comes in.
Okay.
Fortunately, there's no way to get around turning it on to make sure everything's working. So I'm just temporarily feeding as a test, guys. Hey, it's Eric. Just doing a check from Mansfield. Mic check, 1, 2, 3, 3, 2, 1. Check, check, check. All right, I'm going to shut it down until Judge comes in. All right, bye.
Can I get some water? Is that okay if I go back there? I got it. Thank you.
Welcome back to CLE Weekend. Now, who doesn't love free stuff, especially
just wanted to kind of clear up the record.
Good afternoon, I'm Dan DeRose with 19 News Now, coming to you from our digital desk. We're going to get back to our gavel-to-gavel coverage of the Richland County corrections officer who is facing some very serious charges, manslaughter as well as reckless homicide. This stems back to a case involving an inmate in the Richland County Jail back in September of 2019. That young man, 28 years old, Alex Rios, was pretty combative. He was in a holding cell. The corrections officers had to try and get him down. They were going to restrain him. He breaks out of that holding cell, runs down the hallway. He's then tackled, and 5 corrections officers have to try and get him into cuffs and shackles. In that struggle, there is one corrections officer, Mark Cooper, who puts the weight of his foot on the back of Rios while he was pinned to the ground. At one point, for 7 seconds, you see the correction officer pick up his other foot. So all of his weight is standing on the back of Rios. Rios, about a minute and a half later, was blue, unresponsive. He would die 7 days later in a hospital. There is going to be some debate. We've been watching the trial since this morning. There was a debate this afternoon about a plastic material that was found in Rios's stomach in the autopsy. There is debate on whether or not this was a bag, whether it was a baggie, whether it contained some sort of drug. Did he swallow that? And is that why he was acting erratically? And then it comes down to what the coroner ruled at the time, that his cause of death was something called excited delirium. It's this instance, and it's even a phrase that's no longer being used. It was at the time in 2019. It is this instance where an individual has drugs like amphetamines in their system. They're put in a situation and their body basically goes into overdrive. And it's that in connection with a lot of other things that can cause death. We are going to hear the testimony of the medical examiner at the time. He claimed that it was consistent with someone who swallowed drugs, a baggie. The judge debated with both the prosecution and the defense during the lunch for the jury that they can't determine exactly what was in that baggie. It was never tested. So they need to tell the jury to strike any question that was asked earlier or late this, just before lunch, about a baggie with drugs in it. And so they just have to take it at face value that some form of plastic was found in Rios's stomach. It's a very complicated trial. The video that was taken when they went into Rios's cell, I'll show a little bit of it here. This video is, I'm going to warn you, dramatic. You can see Rios standing on a half wall there, and it is a warning. It's graphic, and they've shown it several times now to the jury of when he's pinned to the ground. He's being pinned for multiple minutes. He turns blue and is unresponsive, and again dies 7 days later at the hospital. So let's get you back to the courthouse there in Richland County to resume our trial of corrections officer Mark Cooper.
Right, that the defendant has, and I don't think there's been any indication that we've been over backwards to make sure we got the public, and it's just I'm trying not to have everybody just wander in and out constantly while we're in the middle of Dr. Layman's testimony, because it's very distracting. Thoughts from the parties?
Who's the attorney from?
I think he's from Columbus. Probably from Gahanna. He had a case. I think he was interested in watching because he wanted to watch because the sheriff's department. He's had cases involving the sheriff's department in the past, so he was curious. So
perhaps you should tell him to live streaming the trial.
He can do that.
Watch it in his living room.
He can watch it in his living room.
I have no problem with Attorney Farmer or anyone else, but I agree with your ruling, Judge, that it is a little distracting if it's in and out.
As do we.
Yeah, and that's what we're trying to do. We're trying to make sure the jurors focus on the witness and not on who's wandering in and out. But when we ever have a break, we bring everybody back in, who's out there who wants to come in and go out. And we have, for the record, the couple of the family members of the Rios, they don't want to see the video, and that's obvious. And they go out, and that's fine. They leave before the video is played, and I understand that because they don't want to watch it, and it's been played several times already. And so they like to leave before it gets played, and that's nothing wrong with that. I understand. So why don't we do this? Why don't we bring the jurors in?
Dan DeRose with 19 News. As you heard the judge there, just some procedural items they had to clear up. Someone apparently from Columbus who just wants to watch the trial has been coming in and out of the courtroom, and it sounds like the judge is trying to at least limit the amount of people who are coming in and out of the courtroom because it's a distraction. Again, this has been a really interesting trial. It's taken a lot of different turns. Earlier this week, we heard testimony from basically a woman who was a resident at the coroner's office. She was a student at the coroner's office, and she originally signed off as a student on the excited delirium. And then she gave some really interesting testimony saying she was coerced into saying that and that she no longer believed that. But in the testimony that we'll hear today, it is from the actual Richland County coroner. And he was asked on the stand today, so if you have a student and a teacher that are signing off on an autopsy, whose word counts more? And of course, the coroner said obviously it would be the coroner or the teacher, and it would never be the student's opinion that should be weighed upon by a jury. Again, it all comes down to this definition of excited delirium. Was it the weight of the corrections officer that didn't allow Rios's lungs to inflate, or was it this? Was it a medical condition based on drugs in the system, based on some sort of baggie that was in Rios's system as he struggled with the officers? We can tell you he was originally arrested. I want to make sure I get this right. The reason Rios was arrested and brought in, he had outstanding warrants, but he was being transferred to the jail, arrested for a misdemeanor domestic dispute in Wakeman. And that's when he ended up in the Richland County Jail. You're seeing the ceiling shot here because the jury was being let in, and of course, we don't want to see the jury. Let's get you back now into the courtroom.
So when we took a break, I had some conversations with the attorneys on the record, but outside of your presence, ladies and gentlemen. What I'm going to do is strike the last two questions that Prosecutor Salisbury asked. Just strike them, to disregard those last two questions as though we never heard them. He's going to continue his examination of Dr. Lehman at this time. You may proceed.
Thank you. So, Doctor, in their cross-examination by Mr. Mayor, talked about petechiae, right?
Yes.
Is that, and you've already said the one thing I was going to ask you about, that it could have cleared up in the 7 days while he was in the hospital, correct?
Yes.
If it was ever present.
Yes.
But also, just to be clear, petechiae is not always present in an asphyxiation death, correct?
That is correct.
Okay, so you've seen even strangulations where there's no petechiae, correct?
Yes.
Okay. That's just kind of one indicator that you look for, right?
That is correct.
Okay. Why, so again, back to this confirmatory test versus the screening test, as you called it, or the initial test.
Yep.
How do they confirm it? Do they confirm it? They would confirm it with blood, if I'm not mistaken, correct?
If it was at the coroner's office, we would do it with blood. But
In an emergency room, I mean.
in the emergency room, I don't think they would normally do that. It's an expensive test, and it would probably take a week to get the results. So I'm pretty sure that they would not routinely do it anyways.
Not routinely, but if they were asked by law enforcement, say, to do it, how would they do it?
It would probably be a gas chromatograph mass spectrometer. It would be very specific to one chemical, or in this case drug, as opposed to a class of drugs.
Right. And that, again, would that be blood or urine?
I have trouble hearing.
Would that be blood or urine?
They would probably do it on the urine, because that's what they're working with.
Okay. And as far as injury goes, the same, the lack of broken ribs or the lack of bruising, that's, you've seen cases of like this where that isn't present. I mean, that's not that unusual, is it?
No,
Okay.
it's entirely possible that it would not be present.
Okay, all right. And again, that wouldn't, the fact that that's not present wouldn't rule out that finding of death by asphyxiation or positional asphyxiation.
That is correct.
Okay, all right. That's all I have, Doug. Thank you.
Thank you, Assistant Prosecutor Salisbury, Attorney Mayor, follow-up?
Just a couple. On that last question, the lack of petechiae doesn't rule out an asphyxial type of death, correct?
Correct.
It does nothing to help that finding though either, does it?
That's correct.
And with respect to lack of compression-related injuries on the back, based on the chest compression,
Yes.
the lack of bruising on the back, although not required to make that finding, correct?
Correct.
It does nothing to help support it either, correct?
That is correct.
And that goes for any evidence of trauma internally, like fractures or broken bones.
That is correct.
Have one more?
Yes.
Dr. Lehman, thanks for coming back after lunch, but I think that's all we have.
Okay, thank you.
All right.
Before you leave,
Oh, sorry.
before you leave, Dr. Lehman, I want to make sure to see if any of the jurors would have a question. If you have one, if you have a question, put it on a separate sheet of notebook paper, question or two, and provide it to the bailiff. Parties can approach.
Again, this is a little bit of an unusual move. I've been covering court for 20 some odd years here. I've never seen the judge take questions from the jury in the middle of the trial. Right there, you see the man whose future is at stake here, Corrections Officer Mark Cooper. Very interesting that we finish with the coroner and the judge asking the jury if they have any questions right now of the coroner to write it down on a piece of paper. He's going to give it to the judge asking for the attorneys to come up to the bench. They will read those questions, presumably, to decide to make sure one side won't object over the other, or whether or not it's an appropriate question for a juror to ask. Again, this is rare. I've never really seen this in the middle of a trial, letting the jury write down a question for a witness that was just on the stand. Looks like we might be.
The second question.
There we go.
Doctor, you've answered that question as to your opinion of what caused the death of Alex Rios. The first question was, I think we've heard testimony about a class of amphetamines. And you've talked about methamphetamine. What are the kinds of amphetamines in the class? Could you give us some examples?
There aren't many. The two main ones are amphetamine itself, methamphetamine. There is a drug that's used for weight loss, and I can't remember the name of it. That might be in this class. I don't think we found a weight loss drug. And there is a drug in the antidepressant drug. To my knowledge, he's not on the antidepressant drug, but it's primarily those drugs. But there may be others that I'm unaware of.
Follow-up questions from the prosecutor?
How about pseudoephedrine?
No, to my knowledge, it does not. show up. To my knowledge, it does not, as far as I know, it does not show up on their drug screen.
Thank you. No others?
No question. Thank you, doctor. Step down, appreciate it. Who would the state like to call as their next witness?
Agent Rodriguez, John Rodriguez.
Okay.
Do you solemnly swear affirm the testimony you're about to give this court today is the truth, the whole truth, and nothing but the truth, so help you God?
Yes, ma'am.
Please be seated.
Sir,
Good morning.
could you state, afternoon. Could you state your name, spell your last name for the record, please?
John Rodriguez, R-O-D-R-I-G-U-E-Z,
Where are you employed, sir?
Ohio BCI.
And what is your job with Ohio BCI?
I'm a special agent with the Ohio BCI.
And are you a sworn peace officer in the state of Ohio?
Yes, I am.
And how long have you been a police officer, peace officer?
12 years with the state of Ohio, roughly 10 years down in Florida.
Okay. And as an agent, a special agent for BCI, just tell us generally what your duties are.
Currently, I'm a member of the Special Victims Unit with BCI. We handle sexual-based offenses.
Okay.
And I'm also a special agent. I handle a variety of offenses as requested.
And if you remember back to September of 2019, how were you employed the same way? Did you have the same job?
Yes.
Okay. Did you receive an assignment to attend the autopsy of Alexander Rios?
Yes, I did.
And can you tell me about that, how you got that assignment?
It was the morning of September 30th. I received a call from Special Agent Supervisor Mark Kohler of SIU, Special Investigation Unit down in Richland, Ohio. He mentioned to me that they had got a call in the morning of that Alexander Rios was going to be autopsied that morning. And would I be able to attend the autopsy? Of course, I accepted the assignment and went down to Montgomery County.
Okay. And when you got to Montgomery County, just tell us what happened.
I entered the lobby, presented my credentials, signed the ledger they had at the receptionist, and stated I was there for that purpose.
Okay. And what happened?
I was told to wait a second. Montgomery County investigator from the coroner's office, from the Richland County Coroner's Office was in there, and he was notified. I believe it was Robert Ball. Several minutes later, Robert came out, asked me why I was there. And I told him that I was called by my supervisor to attend the autopsy.
Okay. And what happened then?
Robert said, wait a minute. I believe he went back to the room. I immediately called Mark Kohler, told him about the circumstances about.
What do you mean? Why did you do that?
Well, obviously because there was some question on why I was there.
Okay.
So I believe just because of the questions I was being asked, they didn't know I was coming.
Okay.
So I called I called Special Agent Kohler. He says, advised them that we were there. We were advised of the autopsy, and I responded.
Okay.
I was eventually let back near the examination room. I was provided some PPE, personal protective gear. I signed another ledger, went into the autopsy room.
Okay. When you entered the autopsy room, what was happening?
The examination is based on my experience with prior autopsies. The examination was well underway.
Okay. Why do you say that?
Just the condition of the person being examined.
Okay. And were you notified of anything else that had taken place before you got into the room?
Mr. Ball Detective Radio Check had told me that there were photographs that were already had been taken.
That were already taken before
Yes.
you got in the room? Okay.
Yes.
And then, so how long total were you in the autopsy?
I gotta guess maybe less than a half hour.
Okay. And did you take into your custody any evidence that was obtained during that autopsy?
Yeah, yes.
Tell me about that.
During the examination, it was mentioned by the person examining Mr. Rios' body that a piece of plastic was found in his gastric. That was the exact words mentioned by the attending. The piece of plastic was removed from his body and placed on a table. A short while later, the examination concluded, and I had left the examination room. After it was obvious that it had concluded, I already had left. But backing up a little bit before that, me and Robert had mentioned that if BCI had requested any information, any documents or anything, that we would have to request those items, including the photos.
Okay.
So the plastic item that was extracted from his body was, I didn't have any intention of taking this custody, but when I exited the exam room, a person from the staff of the Montgomery County Prosecutor's Office approached me.
From which office? I'm sorry.
From the Montgomery County Coroner's Office.
Coroner's office.
Yes.
Yeah, you said prosecutor's office.
I'm sorry.
All right.
I apologize.
That's all right.
Anyway, I was in the process of signing out. So they came out. The item was already bagged. And I had signed a property receipt to take custody of the item.
All right. Have we shown this? Yeah. Okay with it?
Yeah, we open it up.
Let him do that.
I'd like to see what's in it too. Yeah, it's just sealed right now.
Yeah.
If you feel more comfortable.
I'm sure there's a pair of scissors.
Yes, thank you. Sorry.
Dan DeRosa with 19 News here. This could be an interesting moment. If this is the baggie in question or the piece of plastic that was found in the stomach of Rios, and you have a major crime investigator on the stand in Mr. Rodriguez from BCI, there is question as to whether or not this is the kind of baggie that holds drugs or would have held drugs that Rios may have swallowed as he was being arrested or shortly before. So this will be interesting to see what this piece of quote-unquote plastic is, as you see some of the attorneys, the defense attorneys, getting their first look at it, period. They would have seen it in photographs, but the actual piece of plastic.
So Agent Rodriguez handing you what's marked for identification purposes as State's Exhibit number 6.
Okay.
And you watched us over at the table pull the contents of that out, correct?
That's correct.
Okay. Can you tell me what that is, please?
That's the item that I took custody of in Montgomery County Coroner's Office.
And how do you know that that's the same item? What markings are on that exhibit that cause you to believe that's the same item you recovered and took into evidence?
It was handed directly to me.
Okay.
And I'm familiar with the item.
Okay. And is there a chain of custody? Well, let me ask you this. What did you do with it?
I took it into custody, and when I left the coroner's office, I contacted Agent Lerner, Eric, and stated what I had taken into custody, and can we meet so we can exchange.
Okay. And did you do that?
Yes.
So on that day, you handed it over to Agent Leonard?
That's correct.
Okay. And so the first line on the chain of custody is from the Montgomery County Coroner, is that correct?
That's correct.
And then that's your signature?
Yes.
And then over to Agent Leonard, right?
Right.
Okay. Thank you, Agent. That's all I have, Judge.
Thank you. Cross-examination. Attorney Boone.
Thank you, Judge.
Good afternoon.
Good afternoon.
My name's Sean Boone. I represent Mr. Cooper here.
Okay.
I'm gonna ask you some questions.
Sure.
If you don't understand what I'm asking, let me know. I'll try to do a better job, okay?
Sure.
All right, so you testified you're a special agent with BCI, correct?
That's correct.
Can you tell me what BCI is?
Bureau of Criminal Investigation.
And more specifically, works for what agency? Under what agency, I guess?
Actually, we work under the Attorney General's office.
Okay. And it's my understanding that BCI is like the investigative agency of the Attorney General's
We are
office,
the
correct?
investigative agency. Okay.
And you are essentially called into cases either to assist local law enforcement, correct?
Yes.
Or to just completely take over a case, right?
Yeah. I guess that's.
Do I have it wrong? Maybe I have it wrong, so you just tell me.
We're a requested agency. We don't have original jurisdiction, so we have to maintain a request. There's a couple of different ways we work on cases.
Okay.
But we're assisting the agency.
Okay, ultimately assisting the agency. And you have been a special agent with BCI for how long?
I started back in 2012.
11 years now?
11 years ago.
Gotcha. And you're currently in the Special Victims Unit?
That's correct.
That's sex offenses, right?
That's correct.
Not this case, right? Were you in that unit back then?
Yes.
Okay. So explain to me how somebody from the sex offense unit of BCI ended up going to an autopsy on this case.
We're a rather small agency, and I work a variety of offenses. And I assist on a number of offenses. I've been called out on officer-involved shootings, assisted on homicides. So it just depends. I was the closest agency. I was the closest agent to that request, so I accepted the assignment.
That was my assumption.
Okay.
This autopsy happened in Montgomery County, correct?
That is correct.
That's like in the Dayton area, is that right?
That's correct.
And where is your office?
I'm in London, Ohio.
You are in London, Ohio, and that is just west of Columbus, is that
Yes.
accurate?
Roughly about 35 minutes.
35 minutes west of Columbus. Now, you testified that you spoke with Agent Linhart here.
That's correct.
He has an office up in Richfield, is that
That's
right?
correct.
And that's up near Cleveland.
That's correct.
So it would have taken him a while to get from Cleveland down to Montgomery County, right?
I assume.
How long did it take you to get to Montgomery County?
I was residing in the Hilliard County, the Hilliard, Franklin County area.
Okay.
I wasn't in the office that day, so when I received the call, I was still working local at my home.
Okay.
So roughly an hour and 15 minutes.
All right. And this autopsy, we've heard testimony, and I think you testified to it. It happened on September 30th of 2019.
It did happen on September 30th.
And that was Monday morning, I think.
I believe so. I don't have a calendar in front of me, but I'll stipulate that.
And according to the autopsy report, the autopsy began at 9:08 a.m. Were you
Okay.
aware of that?
Mm-hmm.
Does that sound about right with your timing?
Again, I didn't arrive when the autopsy started. I arrived when I arrived.
Sure. Do you recall when it was that day, exactly what time maybe, that you got the call to head on down there to Montgomery County?
I didn't keep a log of the time.
Okay. But it was morning time, right?
That's correct.
And you were working from home.
Mm-hmm.
Are you aware that BCI became involved in this case on September the 29th?
No, I did not.
Okay. Your first knowledge of anything that was going on was when you received a call to head on down to Montgomery County and
That's correct.
witness this autopsy. And that's something that you do,
Yes.
correct?
Mm-hmm.
This is not the first autopsy you've gone to?
No, I haven't.
Okay. So you get down there and it's some point in the middle of the autopsy, is that right?
I don't know how far along it was. I mean, when I went into the room, it was obviously Mr. Rios had been worked on.
Okay. And explain that to me. What do you mean by had
Just the condition of his body, my prior knowledge of,
He had already been opened up.
That's correct.
Essentially. Okay. And you mentioned that you had, when you got there, you had some conversations with Bob Ball, is that right? And I think you testified that he works with the Richland County Coroner's Office.
That's to my understanding, yes.
Okay. And is it commonplace, if you know, to inform a coroner's office, hey, you know, we're going to be heading down here to take a look at this?
I mean, it happens in a variety of ways. We were involved. That's why I got the call.
Sure.
I don't know where the investigation was at that day. I know I got instructed to go down to the coroner's office to assist in any way I could.
And you said that Mr. Ball, did you make a phone call to your supervisor, or did Mr. Ball make a phone call?
I made the call.
Okay. And did Mr. Ball ultimately end up speaking with Mr. Kohler?
I don't recall that, no.
Okay.
He didn't do it on my phone.
Gotcha. But after you spoke with Mr. Kohler, Mr. Ball said, come on in, right?
I don't think it quite happened that way. I think he went back and then returned.
Okay. But then brought you in?
Yes.
It didn't prevent you from coming in or anything like that?
No, he escorted me back eventually.
Sure. And you were allowed to go essentially wherever you wanted in the autopsy room, right?
No.
Tell me.
Well, when I went back to the autopsy room, my specific purpose was to go back there and view the autopsy.
Sure. And we've heard some testimony from the actual coroners that they said that the people observing can like freely look at what's going on and things like that, right?
Okay.
And you were allowed to do that, right?
Sure.
They didn't make you just like sit in the corner and
No.
And you could see whatever you wanted, correct?
That's correct.
Okay. And during this time, people were talking, coroners were talking, things like that. Yes?
That's correct.
Okay. You mentioned it was about a half hour that you were there, less than a half hour.
I didn't keep track of the time. I apologize.
That's fine.
I know it was a brief period that I was there.
Okay. And ultimately, when you were there, did you hear anybody talk about the piece of evidence that they had collected from the gastric contents? Were you aware that that had happened
Yes.
while you were there?
Mm-hmm.
But ultimately, you started to leave without actually collecting that evidence,
That's
right?
correct. I did not collect the evidence.
Okay.
As I was in the room.
When you were called by BCI, were you told, hey, collect any evidence that they might have?
No.
Okay. But ultimately, somebody from the Montgomery County Coroner's Office came out and said, hey, you might want to take this with you. Yes?
Yeah, more or less. That's the way it happened.
Sure. And you did, right?
That's correct.
And I think it's your testimony that you took it with you and then you met up with Agent Lainert later that same day, is that right?
That's correct.
Okay. And do you remember where it was that you all met up and passed that off?
We eventually made a location that was nearest to, kind of in the middle for both of us. We ultimately met near 71 in Delaware.
That 36, 37 exit.
Yeah, that's
right
correct.
there? Yeah. And you handed it off to Agent Lainert, right?
Mm-hmm.
And that essentially ended your involvement in this case.
That did end my involvement.
Until right now,
That's
correct? Okay. If I could have just 1 minute. Sure.
Dan DeRosa with 19 News here.
All right, thank you.
Any redirect?
No, Your Honor.
Do any of the jurors have a question for Special Agent John Rodriguez? Special Agent Rodriguez, I don't see any. Thanks, sir. You can step down.
Thank you, Your Honor.
Dan DeRosa with 19 News here. I'm watching this right along with you at home, trying to figure out just exactly what the importance was of having Mr. Rodriguez on the stand. If he was just simply, and we're going to get yet another sidebar here, it looks like. The importance of the piece of plastic is very clear. Now, the importance of calling Mr. Rodriguez, who showed up to the autopsy first, and he's the one who collected it and then handed it off. I guess you just have to show sort of a chain of where that piece of plastic went. And we got a brief look at it. It wasn't but about that big a piece of plastic, just based on cases and trials in the past. We've all seen balloons that are used to put drugs in. Not sure if that's what that was. There's been quite a debate already today away from the jury about what that piece of plastic is made out of, what it is. So we'll see if we get a little bit more clarification here. Perhaps, I'm assuming, whoever the agent was that took that piece of plastic will be next.
5 or 10 minutes. Same instructions as always about not discussing the case, not forming or expressing any opinions, no research or investigation on your own, and no paying attention to any media coverage. See you about 5 or 10 minutes, and then we'll bring you back in. Thank you.
We're getting a 5 to 10 minute break here. What we're going to do, and I want to start with a warning. We're about to show you the video of the confrontation between Rios and the 5 corrections officers. Remember, it is only one officer that's on trial here and has been charged. It's Officer Mark Cooper. In the video, and I'll let you watch most of it without interrupting, I will point out that Officer Mark Cooper is the one who has his foot in the back of Rios, right about here. And then you'll watch the other foot. I believe it's his right foot that's on his back. And you'll be able to see his left foot. And at one point, his left foot also comes up off the ground, showing you that he's putting his entire body, he is not a small man, I believe 260 pounds is the weight that's being used in court, and he has his full weight on Rios for 7 seconds.
Yes.
Let's go back into court.
As a court's witness, but before I have Odell testify, I want to do the Miranda. So
So we are still on the record here, and that's why we want to make sure we don't miss anything here. I don't believe the jury has been brought back in yet. Again, there may be some questions about discussion in front of the jury about the plastic itself and about what was in the bag, because we know it wasn't tested.
You're being called as a witness. Before you testify, the parties wanted me to give you essentially Miranda warnings so you understand your rights before you decide whether you want to testify or not. So Miranda warnings, you probably know them, but I'm going to go over them with you. You have the right to remain silent. Anything you say can and will be used against you in a court of law. You have the right to talk to an attorney. You have the right to have an attorney present while you're being questioned. If you cannot afford to hire an attorney, one could be appointed and one will be appointed to represent you before any questioning begins. And you can decide at any time to exercise your rights and stop answering questions and not answer any more questions or make any more statements. So those are your rights. Do you understand those rights?
Yes.
Okay. With having those rights in mind, what is your thought about testifying here today?
I mean, sure.
Okay, you're okay with it?
I mean, I don't love it, but yeah, sure.
Okay. All right. I just wanted to make sure that I advised you of those things, and that we can before. And I'm going to do this not just for you, but I'm going to do this for the other COs too. So what we'll do is we'll bring back in the jurors, and then we'll begin questioning from the prosecution, and then we'll follow up with questioning from the defense counsel. All right. Thank you. We'll bring the jurors back in if they're maybe they need a little bit of a break.
Very interesting here. This looks like this is one of the other corrections officers in the video. He was read his rights, that he could remain silent, he could get an attorney, because he's going to be asked about what happened. And it looks like we are going to go on full break here, so maybe we'll get to this video. Very interesting that he had to be read his rights because he's apparently involved in the struggle. And let's just start this video so that you can watch it. It's about 5 minutes long. This is my last warning I'm going to give you. This is graphic. This is what eventually leads to the death of Alex Rios, but it is very important in this case. So take a look.
I need you to come down so we can.
You were supposed to let me know this morning.
All right.
Call the law.
All right. I'm not going to call anybody unless you come down from down here. Okay, this is the last time I'm going to ask you. I've asked you for like 5 minutes. I'm not going to do it anymore.
What do you mean?
Okay.
I'm not supposed to be in here.
We're gonna put you in a restraint chair for your safety due to not listening and being on the divider, causing a risk to harm yourself. We don't have time to continue that all night. Okay? All right, this is the last time I'm asking, then we're gonna go ahead and put you in a chair.
Why can't you just open the door?
Right here, go. All right, come on down. No.
Handcuff.
Is that a yes or no?
I'm supposed to.
Go ahead and turn around, put your hands behind your back, and cuff up for me. If not, we're gonna come get you. All right.
You guys
No.
are wrong, man.
Okay, we're coming to get you.
Ready?
Let's go. Go. Cuff your back. Hands behind his back.
Come on, man. I'm not even fighting.
Use your taser.
I'm not fighting.
Baby.
Taser.
Fighting.
No, dude, take it off.
Taser.
No, taser, taser, taser.
I'm not even fighting him. Ow! Ow! Ow!
Glasses, let me get my goddamn glasses off. Taser.
Ow! 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 All right. Ow! Ow! Can someone
Try tasing.
Can you explain to me? Because you're a dumb.
No, you're the dog.
I didn't say you were. Oh.
Got out of the cell.
Really?
Yeah, he's looking.
Okay, you can see Officer Cooper there with his right foot on the back of Rios. It'll be here in the next 30, 40 seconds, 50 seconds that he then shifts all of his weight to stand on the back of Rios for 7 seconds.
You need to. We have anybody else available?
I got this, man. You got it?
Rios? Rios. Alexander Rios.
Oh, that's the one that they supposed to warn on last night, wasn't it?
Yeah, he thinks he's supposed to be out of here and he wouldn't get down off the wall.
That's safety.
Cut it off. Cut it off.
Turn it off.
I would like to help.
Let go of the cuff. Ow. Let go of the cuff.
For the rest of this video, and again, this is a warning, this is pretty graphic, Rios is unresponsive and you'll start to see him turn blue.
I try to pull that thing out when it comes out.
Get a pair of shackles.
And we got another handcuff.
Where's the other hand there?
I got it.
Where's that?
Behind me now.
I only have one hand, guys. I can't hold
Do you want a pair of shackles?
Okay.
Well,
Somebody
I
get
can't
beside me. Nino, you
Buck.
have to get up. All right.
Grab some, oh, he's got them. We got shackles.
Ready?
All right,
Yeah.
shackles.
Give me the other hand.
And there is now Officer Cooper putting his knee into the back
Shackling down there.
after standing on Rios. And at no point during this next 30, 40 seconds does anybody realize he is unresponsive.
Where's the radio center?
Think that's gonna be too big? Let's fly this foot out there?
What we got?
Try it.
That might be able to cinch up around his ankle.
Let's do his ankles now, so.
Keep going.
Hey, Gardner. Yeah. Come on the other side of Long. When we come up, we're going straight up into the chair. All right. Cooper, I'm behind you. Me and Long are behind you guys.
I got you.
Yes.
All right, I got the chair so it doesn't move.
Okay. You two ready?
Rolling, rolling. He's turning.
Straight up.
Turning. Hear me?
Get up.
He's turning blue.
Get up.
Call the squad. Master Control, call the squad.
When you
Turn him on his side. Turn him on his side. Just laying down on his side.
Leave him on the side. Try to get some oxygen, make sure everything's going okay for him.
Get the AED.
What's his last name again?
Again, it is a tough video to watch. We know that 7 days later, because of the oxygen that had been cut off to his brain, 28-year-old Alex Rios would then pass away. The investigation would begin. Again, there is the video to watch. If you're wondering why it's such a clear picture, in a lot of these cases now in county jails, when they encounter an inmate that they're going to have to go into a cell, an inmate that is not responding to orders, they will get out some sort of camcorder or recording device and they will start to record so that they have evidence in a case like this. And I always, in cases like this, always ask our viewers to put yourself in the shoes of the jury, not just with that video. You have the coroner's report that said he died of excited delirium. That's a phrase that is no longer used. In 2019, that's what he was, what the cause of death was, and the exact manner was accidental. Excited delirium is an individual that has amphetamines or drugs in their system, is in an excited state, which causes sort of that delirium. The coroner was on the stand earlier this morning. Even he had a hard time explaining the excited delirium, which is why that phrase is really no longer used in cases. We're about to hear from, I believe this will be the next witness, is going to be another one of the individuals that was involved in that takedown of Rios.
We gotta swear him in. Sorry.
Please stand and raise your right hand. Do you solemnly swear or affirm the testimony you're about to give this court today is the truth, the whole truth, and nothing but the truth, so help you God?
Yes.
Please be seated.
Sir, would you state your name, please, and spell your last for the record?
Jamal Odell. Said spell last. O''D''E''L''.
And sir, my understanding is that you're retired from the Richland County Sheriff's Office?
Yes.
Is that right? And when did you retire?
2020 in September, I believe. August or September.
And what were your duties when you did work there?
I was lieutenant on third shift.
Okay. And lieutenant from corrections officer?
Corrections.
You're, just to be clear, you're not a duly sworn peace officer, are you?
No.
Okay. How long did you work as a CO?
Just over 20 years.
Okay. All with Richland?
Yes.
Okay. And I mean, you know why we're here on September of 2019. Were you present for an incident that happened between the COs and Alexander Rios?
I was present.
And tell us what your role was.
My role was initially observing the behavior of this individual and making a determination of what we needed to do to proceed to take care of what we had going on.
Okay.
So basically, as a supervisor, I was seeing a situation that needed to be taken care of and responding to it.
And tell us about that. What was that situation that you thought that needed to be taken care of?
We saw an inmate in his cell, and he was acting in a manner that caused a risk of harm to himself or possibly others.
And what cell specifically was that? That's not a normal cell, is it?
It was in our booking area, and cell 12. I think it was cell 12.
Okay, but I mean, he was put there. He wasn't. That's not general population, correct?
No, booking it was on suicide watch at that time.
Okay.
In booking.
And he had the suicide gown on, correct?
Right.
All right. Who made that determination?
It would have been medical staff along with whoever the officers were at the time that made that decision based on his behavior.
Okay, and it was not you?
It was not me.
Okay. And you said you saw some behavior that you thought needed to be taken care of. Tell me specifically what was going on that concerned you.
He was up on the divider inside of the cell, and he was reaching towards the top. We have a sprinkler head there, and it appeared that he could easily fall down, he could harm himself. His behavior was such that it didn't look like he was, it seemed like something was going on that was of significant concern to us from a medical standpoint.
Who was before the video started, which I believe you originally had the video camera, correct?
Yes.
Before that started, what was happening? Were you talking to him?
When I first observed, when I came into the area, I observed him up on the top there, and I knew right away we were dealing with someone that was definitely a potential risk of harm to themselves or other.
Okay. And so what kinds of things, before the video started, what kinds of things was he saying and doing to you? What was your interaction?
It sounded to me that he believed that he wasn't supposed to be there. It wasn't right that he was inside of there. So I tried to speak with him, but in order to do that, try to get him to come back down.
Okay. And that's not that unusual, is it? That somebody in a seg cell, would you call it, segregation cell, right? That they don't think they should be there?
That's not unusual, but the fact that he's on top of the divider and risking a potential harm and not sounding like he understands the questions very well, and what he's repeating, that sounds like a concern.
Okay. And tell me about that. What do you mean you didn't understand the question? What kind of questions were you asking that he didn't understand?
I can't recall 100%, but basically it was around his health and well-being, making sure that we could get him to come down and find out a little bit more about what was happening with him personally.
Okay. When he was saying, and so after the video starts, we've heard a little bit about it, he's saying, I'm not supposed to be here, man, right? Couldn't you have taken it that way, like, hey, I'm not trying to harm myself. Why am I in this suicide smock? Why am I in this cell? Isn't that a reasonable interpretation of him saying those things?
Yes.
Okay. Did you interpret it that way?
No.
You did not? How did you interpret it?
I interpreted that it wasn't something, his situation wasn't a situation that seemed understandable. It seemed like he had a little bit of confusion personally.
Okay. All right. And so what was decided to do?
Can you repeat again?
What was decided? What did you decide to do?
So for his safety, we decided we'd take him out of this cell and have him placed in a restraint chair.
Okay. And how were you gonna, what was the plan? How did you go about accomplishing that?
We had the restraint chair there. We had officers, we called for officer assistance. And the plan was for him to turn around and to cuff up through our food flap. Mm-hmm. And we realized that if he doesn't listen to our commands, then we have to open the door and we have to get him for his safety and put him in the restraint chair.
Okay. And so you knew there was a potential for use of force?
At the time, when we went in, yes.
Okay. And in fact, isn't that why you started the video?
That, and to show that we're attempting to have conversation, that we're giving them opportunities to comply, that we're having a conversation, yes.
Mm-hmm. But isn't it, it's my understanding, and correct me if I'm wrong, that at the time anyways, that it was the policy of any time that there was a planned use of force that you'd videotape that?
Yes.
Okay. And so you did, right?
Yes.
You started videoing it, right, correct?
Yes.
And then were you the one that made the ultimate decision to open the door?
Yes.
Okay. And so what's the plan before the door opened? What was the plan? What was the plan supposed to be? There was how many officers were there?
I don't recall.
Okay. But more than a couple. Okay. What was the plan? How were you going to extract him? Let's say he didn't do what he did and he just remained up on the wall or just remained in a cell? What was the plan?
Well, if he's up on the wall, then officers would go in and they would help him come down from the wall and to the divider and then put him into the restraint chair. And then other assisting officers would help to make sure the restraints were put on there.
Okay. And then what's the plan if somebody does what he did, which is run?
When he runs, then it's a situation that we have to respond to where he's at. If he's not compliant when he's open in the area, then we have to assist him down, to the ground and try to get him handcuffed, try to get him secured so we can put him in a restraint chair at that point.
Okay. And so this is all for his safety, right?
Right.
So, and we've seen you've seen the video, correct?
Mm-hmm.
He wasn't going anywhere. In other words, that's a lot. And we visited yesterday. All of us did, the jury included. There's nowhere to go, right? He's locked in there. He's locked in that booking area. He couldn't have escaped that booking area, could he?
Not by opening the door unless someone else did at some point.
Right. So, and not by opening the door, you said, but not by any way. I mean, he couldn't get out of there, right? So, and there were no other, as we saw the video, there were no other inmates that were out of their cell, right?
No.
So no other inmates were in any kind of danger, were they?
No.
Okay. So this was just solely for him.
He's also, though, in that situation, he's a threat to himself, and he's also a threat to officer safety as well. So it's a concern for everyone at that point.
And so what was immediately done was what? I mean, he runs, and we saw it, and we're going to see it again. He ran around a corner there, and what happened?
I believe an officer met him and tried to assist him by getting him down, and other assisting officers helped that officer to do the same.
Were you present when he was eventually taken down?
Yes.
Okay. Isn't it true that he was taken down by one officer?
I don't recall.
Okay. Do you recall that one officer tried to take him down and he slipped out of his grasp, and then the second officer took him down by himself? Do you recall that?
I honestly don't recall.
Okay. So, again, this is for his safety and officer safety. I understand that. Why the need to take him to the ground? Why couldn't you just? You had four or five officers there, right? Why couldn't you just grab his arms and like we see on TV, right? Put him behind his back and cuff him and put him in the chair.
Well, one, he was not complying, and second, he presented something that we thought was highly unusual with his behavior. So when we noticed something going on with his behavior, we realized that that's a general process for us to assist him down, and then to have assisting officers handcuff and to shackle.
Okay. All right. So at what point did you relinquish the video and give it to, I think you gave it to Officer Mahan or something?
When it became apparent that we were dealing with someone that was presented more than the usual set of circumstances of concern from a safety standpoint.
All right. And so what did you do?
What did I do? I assisted his legs.
His legs? Okay. Tell me about that. Both of his legs, one of his legs, how did they? Both?
Both.
Okay. And at that time, with the time you got involved in that, how many officers other officers were involved?
I don't recall. I know there were a few, but I don't recall the actual number.
Okay. Well, would you disagree with me? Was Officer Long was there?
No.
He was not?
I would not disagree with you.
Oh, I'm sorry. Well, let me ask it a different way. I'm sorry, it's a bad question. Was Officer Long there?
Yes.
Was Officer Long Shore there?
Yes.
Was Officer Pendergrass there?
Yes.
Okay. Was Officer Cooper eventually there?
Yes.
Okay. And for the record, do you see Officer, or former Officer Cooper in the courtroom?
Yes.
Can you point him out for me, please? Tell me what he's wearing.
He's wearing a gray outfit and a black tie.
Just point to him so I know who you're talking about. Thank you. Just so I know you've expressed to Mr. Thompson several times. You and Officer Cooper, or former Officer Cooper, are personal friends. Is that correct? You're
Yes.
You're close with this family.
Yes.
Okay. And there was another officer there that has since left. It was, do I have the Prandy? Is that a name? Do I have that name wrong? Sorry. Gardner, that's one thing. No, I'm sorry. Officer Gardner was there too, correct?
Yes.
Okay. Thank you. So that's, and including Officer Mann, or Mahan, however you say it, that's 6 officers, correct?
Okay, yes.
I mean, I'm not asking you to agree, right? You can count them. And so what were the other ones doing, to your knowledge?
Well, we had the one that was recording once it was handed off. We had a few that were up front trying to secure his arms, and I was trying to secure the legs, and there was, I do believe, another officer behind me.
Okay, doing what?
If there was any movement, perhaps he was going to be utilized for to use a taser.
Okay. Was a taser deployed?
Yes.
By whom?
Well, there may have been a number of deployments, but I know that one of the officers, Longshore, did deploy a taser, and then later on in that incident, I also did.
Okay. And the first deployment of a taser, is that the one that went into C.O. Cooper's hand?
I believe so, yes.
One of the prongs?
Yes.
The other prong went where?
I don't recall.
Do you know that if it went into the suicide suit?
I don't recall.
Okay. Let's say it had gone into the suicide suit, would that have made any contact or have any effect on Alexander Rios? It's a thick suit, right?
Yes, it's a thick suit.
And likely that if it went into that suit and got stuck, if we hear testimony of that later, then that would have had no effect on him. Does that seem reasonable to you or not?
It seems reasonable, yes.
Okay, all right. During this time, were you able to get Alexander Rios in the prone position on his stomach?
Were we able to, and from the beginning of our incident with him to the end, we were not able to gain compliance in that way until likely towards the end, the very end.
Toward the end?
At the very end, once we recognized that he was in a state that we had to do something along those lines, yes.
Okay. During that time, did you notice Officer Cooper's foot on the back of Alexander Rios?
I do not recall.
Okay, not during the incident. Because you're busy doing what you're doing, right?
Right.
All right. Now, you have been trained in the use of force, correct?
Right.
And that's part of your training is because you were CO in situations like this, correct?
Yes.
Okay. Have you ever been taught or trained that standing on someone's back or putting pressure on someone's back with your foot and with body weight is an acceptable form of restraint?
No.
Okay. And as a matter of fact, you're trained that that is not an acceptable way. Isn't that true?
Yes.
And why is that? Do you know? Do they tell you why not? They say don't do this, right? And here's why. Do they tell you why?
Well, we know when it comes to safety, we can try to do what is necessary in order to be safe, but we have other methods that we use that would be more successful under those circumstances.
Well, okay, fair enough. But I'm asking you, Why do they tell you not to do it? Do they tell you why, don't do this, because fill in the blank?
We are aware that some harm can come
Okay.
to an individual.
Okay.
Yes.
And you're trained that way?
Yes.
Right. And so you've watched the video before, so you gave a statement to Detective Radio at about 3:44 a.m. Does that sound right to you? I know you probably don't remember the time, but.
Yes, that sounds reasonable.
Okay. And that's actually quite a while after the incident happened, isn't it?
Yes, probably a few hours.
A few hours, right? Three and a half hours
Yes.
later, right? Do you remember what transpired between the time that this happened and Mr. Rios was taken to the hospital and before Detective Radio gets there and interviews you? What were you doing?
What was I doing?
Yeah.
Initially doing all the review of video, contacting our administration, letting them know of the incident, those events, all
Okay.
of those things.
So-
making sure someone would go immediately to the hospital with that individual as well.
Yeah, and I believe it was CO Pendergrass that went with him?
Yes.
Yeah. Was that at your order or
Yes.
direction?
Yes.
All right. So, who decided to watch the video after it happened before you got interviewed? Was that your own decision, or were you told to watch it?
Well, I always review video after any incident happens. As a supervisor, I would review video.
Okay.
And then anything that happens that is significant, we'll do our chain of command. I'll let my captain know, and the sheriff, and everybody else would come and review it as well.
Okay.
When something significant along what happened along those lines, when that happens.
Okay. Did you do that in this case?
Yes.
Okay. And what did you tell? Do you remember the reason you called your who'd you call first, the captain or the sheriff?
I don't recall. I'm certain it would have been the captain because he's my immediate supervisor.
And who was that? Captain who?
Captain Blanc.
Captain Blanc.
Yes.
So so he wasn't working, or did you call him, or?
I had to call him.
You had
Yes,
to call him.
it was at nighttime. He wasn't working, so he had to be called in.
Okay. Do you recall what you told him?
I do not.
Okay.
Don't recall.
But there's a reason. So you were concerned.
Yes.
What were you concerned about?
I was concerned that we had an incident that resulted in a significant thing that happened with one of our then inmates at the time.
Okay.
So it was a very serious incident.
Okay. Were you also concerned at anything that you saw when you reviewed the video?
There were developments between officers that I saw where different things happened. Nothing specifically at that time immediately was any different other than letting my captain know and having them take a look at that video and come into a determination on the video.
What specific things that you're talking about that
Just
developed?
different methods that officers use, whether it be
Yeah, come on.
Dan DeRose with 19 News here. You heard the objection and the judge calling a quick sidebar. There is clearly is this leading a witness. This is a supervisor who reviewed the video, and they're trying to figure out, well, why did you review the video? What was it about the video that had you concerned? Basically trying to get him to say when he saw, and that's, I'm just hypothetical here, this is what the state is trying to get this officer to do, is to say that when he saw Officer Mark Cooper stand on the back of Alex Rios, that's what made him call his supervisor when reviewing that tape. He's already been asked, are you trained to stand? Is that the way you're trained, is to stand on the back of an inmate to subdue them? And he said no. And he said, in fact, aren't you trained that is not the way you're supposed to do it? And he said, yes, we are trained not to do that because it is not effective. So you've got a supervisor saying what his subordinate there, Officer Mark Cooper, sitting there in the gray, that by standing on someone's back in an attempt to subdue an inmate is not what they are trained to do. That is obviously not very good for the case of Officer Mark Cooper, and his attorneys there starting to object, as now the jury is about to hear it for a second time, that when this supervisor saw the video, that something caught his eye enough to call the captain and then call the sheriff. And he started to say some of the tactics that the officers were using. As any good defense attorney would do, you raise an objection when you see something that's extremely damning to your client and see if you can get it thrown out. The judge calling a sidebar to ask why they were objecting, and we'll see what we come up with here. But again, so far, this testimony, and it's only half of it. We get to hear the defense also question this corrections officer, the supervisor, and I'm assuming there will be a line of questioning that if this man was such an extreme danger, you have to do anything you can to get him in cuffs. Isn't that correct? And so we'll probably be hearing some line of questioning, something similar to that in the redirect. Looks like we're about ready to get underway with testimony again.
Mr. Odell, anything on that video that was against your training, that was you were trained not to do, and as we've already talked about, that concerned you so much that that was the reason you called your captain?
No.
Okay. No. So, and again, you said you saw the video, and you, during that video, did you see Officer Cooper's standing on inmate Rios's back?
Honestly, I don't recall. I do know that I did see him standing in upright position, but in terms of anything that would have been something I talked to my captain immediately about, I would not have noticed that unless our captain reviewed it and came away with the concern as a result of all of officers' use of force. But the primary thing was the safety of the inmate at that time.
Well, did your captain express concern after he saw did your captain watch the video?
Yes.
Did he express concern to you about that?
No.
You did not?
Objection, that's calling for a hearsay response.
Sustained.
Did you, before you were interviewed by Detective Radio, did you get together with the people, the other COs involved in the incident and talk about what had happened?
I don't know if we had an after-incident review where everyone was together. We may have a little bit, but mainly I think that I was in the supervisor's office talking with my direct supervisor and making sure everybody was called. So there were bits and pieces of interaction, but I don't know that we had an interaction all together afterwards.
Okay. And did the other officers stay? Longshore, Long, well, we know Pendergrass went to the hospital, right?
Yes.
Gartner, I think. Mahan, how do you say her name? Mahan, I'm sorry. Did they all stay?
That night, yes.
And did they all watch the video before they got interviewed?
I do not recall that because I don't make the video. As a supervisor, when we watch the video, I don't make that video. It's just, it's a supervisor reviews it and then our administration looks at it. So it's not something that everybody looks at that video, to my knowledge. No,
okay.
We wouldn't do that.
All right. You say they wouldn't do that?
We would. It would come from me. I would have the actual, from the camera.
Yeah.
I would have to allow other officers to watch the camera.
Did you do that?
No.
Okay. I'm going to play the video now and ask it, and then I'm just going to let the whole thing play through, and afterwards I'm going to ask you some questions about it, okay?
Again, Dan DeRose with 19 News here. We're going to give another warning that the video they're about to play, it's the video we showed earlier. It is tough to watch. We do know that the end result in this is the death of Alex Rios.
Okay. All right. All right. I'm not going to call anybody unless you come down from down here. Okay, this is the last time I'm going to ask you. I've asked you for like 5 minutes. I'm not going to do it anymore. Okay? We're going to put you in a restraint chair for your safety due to not listening, be uninvited, causing a risk to harm yourself. We don't have time to continue that all night. Okay? All right, this is the last time I'm asking you. We're going to go ahead and put you in the chair.
Why can't you just open the door?
Right here. All right. Come on down. No.
Handcuff.
Is that a yes or no?
I'm supposed to
Go ahead and turn around, put your hands behind your back, and cuff up for me. If not, we're gonna come get you. Alright. No? Okay, we're coming to get you. Ready? Let's go. Go. Drop your back. Hands behind his back here.
Come on, man. I know you're fighting. Use your taser. I'm not fighting. Crazy. Crazy. You take off. Take off. Taser. I'm not even fighting him. Ow. 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 Glasses, let me come out them glasses. Taser. Ow. 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 All right. Oh, oh, can someone try tasing? Can you explain to me? Because you're a dumbass. No, you're the dumbass. I didn't say you were. Oh. Fucking took out of himself. Really? Oh. Yeah, he's like. Oh. Oh. Give me your hand behind your back. Oh, shit. Somebody take it. He's on some type of keep playing. You need to. We have anybody else available? Rios? Rios. Alexander Rios. Yeah, he thinks he's supposed to be out of there and bring it out on the wall. That's safe. Put it off, turn it off. Turn it off. Let go of the car. I'll fucking. Let go of the car. Right up here on the wall. Pull that thing out. Get a pair of shackles. Can we get another hit? Can you come? Where's the other hand? I got it. Where's that? How do you know? I only have one hand. Do you want a pair of shackles? Okay. So I can't beside me. He's got it. Get up. All right. Grab some. Oh, he's got it. Ready? You got shackles. Ready? All right. Yeah. Shackles. Give me the other hand. Bring it forward from guys. You got it. Shackle him down there. This club.
Number two, babe?
Get out in a second. Where's the red?
Is this on you two, babe? Let's slide his foot out there.
Close that right. Okay. Do his ankles now, so. Keep moving. Hey, come on the other side of the wall. When we come up, we're going straight up into the chair. All right. Go out behind you. And walk behind you. I got you. All right, I got the chair so it doesn't. Okay. You two ready? Just turn him. Straight up. Get up.
He's turning blue.
There.
Call squad. Master control, call the squad.
We need one side. Hang on the side. One side. So give us some marks and make sure everything's going okay for him. Get him in that.
Mr. Odell, is that the video you saw that night?
Yes,
Yeah.
I believe so.
And during that video, did you see Officer Cooper's foot on his back and at one point had both feet on his back, standing out?
Honestly, at that time, I
No,
don't
right
know
here,
that
right
I
here.
saw.
Right here.
In here? Did I see it?
Yeah,
Yes.
yeah, that's what I'm asking. I'm not saying during the incident. I know you were, whatever you were doing, right, busy with his feet and his legs, right? But I'm saying, after watching the video, you saw that, right? You saw him doing that. And then after he got off, he actually took his foot off, and then did you see what he did next? Did you see him kneel on the back of his back?
Yes.
And not only kneel, but put his left hand on the back of his, is that, from your training, are you trained to do that? Are you trained not to do that, Mr. Adele? And listen, I know Mr. Cooper's a friend of yours. I understand. This is hard, but I gotta ask. Are you trained not to do that?
Usually, I mean, we can get leverage, but it just depends. We can get leverage on a person when they're, to make sure that they don't move around. We can do that.
At this point, now I'm talking about specifically when you saw Officer Cooper remove his foot and kneel on him and put his hand on him, right? I'm talking about that specific moment. He was not struggling anymore, was he?
He did not appear to be at that time. No.
Did you see him? Did you see his color? I mean, I know you were at his feet. I'm talking about here in this video.
I did not see real good until the very end.
Okay.
Yes.
You agree with me? He was blue. I don't have anything else.
And for the record, he shook his head yes. Cross-examination, Attorney Boone? Oh, I'm sorry, Attorney Mayor.
Thank you. Have a moment to get set up, Judge?
Yes.
Thank you.
Dan DeRosa with 19 News. Some very damaging testimony for Mr. Cooper when his own friend / coworker could not answer the question, are you trained to stand on the back of an inmate? And he went silent for about 30 seconds and did not answer the question. I think that was enough for the jury, whether he verbalized it or not.
Good afternoon, Mr. Odell. Thank you for coming in this afternoon. My name is Jim Mayer. I represent the man you've identified as Mark Cooper. I'm going to ask you some questions this afternoon about your recollections from that event. I'm also going to ask you some questions about background, just about everything that we think is relevant to your testimony, okay?
Okay.
Have you and I met before?
I don't know,
Yeah.
honestly.
Okay. But you were working down at the jail for a long time, right?
Yes.
How long?
Since 1999.
Since 1999. And I believe you testified on direct exam that you've been acquainted with Mark Cooper for some time.
Yes.
Described yourself as friends.
Yes.
I'm guessing you got to know him probably not long after he started at the jail?
Yes. Yep.
Which would have been roughly when?
Early 2000s, maybe 2003, 2004.
So not long after you.
Yeah.
And the both of you worked there consistently until your retirement.
Yes.
Which was when?
For me, 2020.
Right. And because you're friends with Mark Cooper, you know that he continued to work at the jail after this event, yes?
Yes.
And you know that he continued to work at the jail after your retirement, yes?
Yes.
And because you're friends, you also know that Mark Cooper just decided to leave the jail to take another opportunity, correct?
Yes.
Okay. In other words, he was not let go. He was not fired, right?
He was not, no.
He was not placed on leave, correct?
No.
Not your decision, right?
Right.
But those are the facts.
Yes.
Okay. Now, we're going to go through a number of different topics that you testified to and some that you didn't. But I kind of want to ask a question real quick. You were indicating that seeing the video gives you the opportunity to kind of have a perspective that you didn't have when the events were unfolding in real time Yes. On September 19th, right?
Yes.
Okay. And it's fair to say that when these events are unfolding in real time, it's not the same as sitting in that chair or any of these chairs or what this prosecutor was doing, taking you through a play-by-play and breaking it down, is it?
No.
What's different?
When the event's unfolding, you have a lot of different factors that are going on, and you're not going to see every development that's going on in real time. You're going to see what you've done and what you're hoping to accomplish from a secure standpoint, but you're not going to see in clear detail everybody's actions at every time.
Sure. And so, armchair quarterbacking, hindsight 2020, you're familiar with those terms?
Yes.
They both refer to situations where somebody can go back and maybe look at a video or look at a photograph and make decisions about things as to how maybe they were happening when you didn't realize that was the case at all at the time.
Yes.
All right. Was this the only use of force event that you were involved in the 20 plus years that you were at the Sheriff's Department?
No.
These things happen, right?
Right.
And they're serious matters, yes?
Yes.
Okay. And there are strict protocols to follow when you anticipate that a use of force event may occur, right?
Yes.
Were those protocols followed with respect to how you approach the cell, handheld and all that?
What happened there, that would be common with the situation we encountered as far as wanting to put in the restraint chair, or if we have someone that's running actively in our booking area, we would, if they're not cooperating, we would assist them to the ground so that we can gain compliance, shackle and cuff, and then place in a restraint chair.
In fact, the Richland County Sheriff's Office has general orders and directives that form the protocol for your policy and your training, right?
Yes.
You're familiar with those as a former supervisor, and you were familiar with them as they existed back in September of 2019, yes?
Yes.
Okay. This is going to be B series, Judge, B1, B2, and B3. Okay. Okay. Yes, please. Thank you. May I approach the witness?
Yes.
May I approach, Judge?
Yes.
Thank you. All right, Mr. Odell, I'd like you to take a look at these, I guess in order. Just take your time, as much time as you need. First is B1, B2, and then B3. Once you've looked at all of them, front to back, and again, take as much time as you need, let me know when you're ready to identify, if you can, what they are and answer questions about them, okay?
Okay.
I'll wait to hear from you.
Dan DeRose with 19 News. As this witness reviews, looks like quite a few pages of paperwork here. We're getting awfully close to our 3 o'clock news, which means some of you are about to lose connection to this trial, and you'll be switched over at 3 o'clock to our 3 o'clock newscast. If at any time in the next couple of minutes your feed goes out, we are still streaming this on the 19 News or the Cleveland19.com website. Cleveland19.com. Find the story for the Richland County officer, and this trial will continue to stream in that platform. Mm-hmm.
little light reading for you. Do you recognize those three documents that are B1, 2, and 3?
Yes.
Can you tell us in order what they are?
This is restraint chair policy. This is the EID policy on non-lethal electronic immobilization devices. And
Tasers, for
the taser,
example?
yes. And the use of force and use of deadly force, or use of force continuum.
All three fair and accurate representations in their entirety as you recall them in place back in September of 2019?
Yes.
Okay. Now, you seem to take your time with that, so I expect you're ready to answer some questions. If I ask you something that you'd like to be able to look at it or refresh your recollection, let me know, and I'll ask the judge to allow you to take a look at it. I'm going to read from portions of it, okay?
Okay.
I noticed when you were reviewing, when you got to the last page of the use of force directive, you got to what essentially amounts to the only chart in the three documents, correct? And of all the pages you reviewed, you seem to spend about the least amount of time on that. Yes? Give or take. I'm guessing that's because you're very familiar with it.
Yes.
Okay. All right. So I want to kind of get back to where we were. We're going to talk about the video. We're going to talk about everything that you recall specifically, and then which portions that you see on the video as well. Okay? All right, so when you look to what would be B3 in front of you there, the last document that you reviewed, what you have identified as the use of force and use of deadly force policy statement, Direct General Order 24.8. Do you have that in front of you? Right there on page 1, in bold letters, it indicates a peniological interest. Yes? Do you see that?
Yes.
A peniological interest is the interest in the jail, or the jail's interest in making sure that use of force is done the right way. Is that fair?
Yes.
But specifically, it indicates peniological interest to provide reasonable and necessary force options when an inmate exhibits resistance, attempts an escape, is non-compliant to lawful instructions, threatens, or uses force. It kind of gives all the different examples that the order takes into contemplation as to what might justify use of force and how we should respond, right?
Yes.
Okay. And based on your recollection and being able to take a look at the video again today, hearing your testimony, it seems fair to conclude that Rios exhibited resistance, yes?
Yes.
It seems clear that Alex Rios escaped his cell, yes?
Yes.
It seems clear that he was non-compliant to lawful instructions made by the corrections staff, including yourself, correct?
Yes.
And during the course of the resistance, his behavior is threatening to you all. I believe you said that, yes?
Yes.
It's concerning as to your own safety and that of the other officers?
Yes.
And it was also concerning to his own safety.
Yes.
And to be clear, when you read the entirety of that document, it starts out by saying that use of force should never be punishment, right?
Right.
And that goal number 1 is the safety of the inmate, yes?
Yes.
Okay. As you were interacting with Alex Rios, starting from the moment the camera starts rolling until the time it finishes, anything you did, was it for the intent of trying to punish or otherwise harm Alex Rios?
No.
Okay. What was your primary objective from even before the camera starts rolling? Because if I understand, you were already engaged in trying to negotiate him off that wall, right?
Yes.
You saw him first in that cell when he was creating a verbal disturbance, right? And then he climbed up on the wall while you were trying to get him calmed down, right?
Yes.
So your attempts to get him calmed down, instead of having the desired result, he ended up climbing up on that half wall, right?
Yes.
Did that raise your concern for Mr. Rios' safety or lower it when he climbed up?
Raised my concern for his safety.
Sure. And why is that? Okay, I want to give you a full opportunity to answer that because you talked about that with Detective Radio and you started talking about it here. So
Yes.
please tell us.
So when he's on the divider, he has a risk of falling off of it, and he can harm himself much more than if he's in level ground. And based on his behavior, my main concern was to get him to come down so that I could talk to him. One, the main thing was for his safety. And when, through repeated opportunities to talk to him when he did not comply to do so, and the things that he was saying, we realized that his safety and our safety was definitely in jeopardy at that point in time.
Okay. And so the option of just leaving him in the cell to see how it all played out was not an option, right?
No, it was not.
Because, of course, he's in that green smock, right?
Yes.
Which has been described as a suicide smock, right?
Yes.
One finds their way into the suicide smock either because of behavior that's concerning, right?
Yes.
Things they're actually physically doing, perhaps, that are concerning for suicide, right?
Yes.
Or the words that come out of their mouth, correct?
Yes.
And you know that in this case, Rios had communicated to other officers that he had thoughts of harming himself, right?
Objection.
If he knows.
Only if you know.
I don't know that.
Okay.
One way, among those others, that you can end up in the suicide suit in your 20 years of experience is if you communicate to an officer that you're going to harm yourself.
Yes.
Which one of those things or something else that caused Alex Rios to be in the smock, you're not sure. Which one, right?
Right.
But what you do know is that's the type of thing that gets you in that suit, right?
Yes.
And when someone is suicidal, by definition, you have to be concerned for their safety, right?
Yes.
And that's why we don't just leave them in the pod with all the other inmates, right?
Yes.
If we do that, we're setting ourselves up for all kinds of problems because we're not paying attention to what the inmate is telling us, right?
Right.
And in the end, we have to protect the inmate above all else, right?
Right.
That includes when we become concerned that they may be suicidal, right?
Yes.
So we bring them down to the booking room, we put them in that gown, right?
Yes.
What is the purpose of putting them in that smock?
For their safety, so they cannot harm themselves.
Give us more. What do you mean by that?
So they can't use anything inside of the cell. So they can't use it as opposed to their own regular issue jumpsuit.
Stripe
so
suit.
they can't use it. Yeah, they can't use that to harm themselves in that way. Cut off their circulation.
Ligature.
Use it around their neck. Any type of material that could be utilized for that purpose. We want to make sure they don't have any of those items present with them at that time.
And of course, that's why when we're watching the video, we can tell that aside from the suicide smock, he's got nothing else on clothing-wise, right?
Right.
And that's for his safety.
Yes.
Because those garments could be used to harm himself in a suicide attempt.
Yes.
Okay. And that smock is specifically designed so that can't happen.
Yes.
Okay. So when he climbs up on that wall, and you already know that he's down there because he poses a risk of harm to himself based on the suicide concern. When he climbs up on that wall, yes, you're concerned he could fall off, like you said, right?
Yes.
He could also jump off intentionally and harm himself, correct?
Good. Yes.
And if you do that, like Mr. Salisbury said, everybody got to go down and take a look inside that very particular cell. On the other side is the bathroom and a bunch of corners and edges and things like that,
Right.
right?
Yes.
And those are hard surfaces, right?
Yes.
People could do serious damage to their head and the rest of their body in an intended leap or an inadvertent fall, right?
Right.
And based on the behavior that he was exhibiting, did he seem stable to you?
No.
All right. Now, how long were you familiar with him having been down there before this event happened? You?
Not very long. Literally, I came on duty.
What time?
Went into the book. I would have been on duty at about 9:30, so 21, 30 hours at that time. And when I went in there, I immediately noticed that his behavior was not right.
Okay.
And that not to respond would be indifferent in a way that would be harmful to him, so I had to respond.
It's fair to say that his behavior continued to escalate or deteriorate, depending on how you want to look at it.
Yes.
And so that it was making you even more concerned.
Yes.
Right? You talked about he was speaking in a way that suggested to you that he didn't know what was going on.
Right.
Right? Confused state?
Yes.
Fair? All right. And so you told the jury that you recall him making comments that he wasn't supposed to be there in that cell, right?
Yes.
Okay. To be clear, he was arrested on a valid warrant, and he was rightfully in the Richland County Jail, correct?
Right.
This was not some great big mistake made by everybody here in Richland County, and he was falsely imprisoned. He was supposed to be there, right?
Right.
All right. Now, with respect to other things he was saying, as you were in the booking room, I suspect this is what you're referencing when you talk about it in your interviews previously. He was also making comments as other inmates were coming in, one in particular, hey, that guy's got my stuff. Can you talk about that?
So I do recall that, and that didn't seem to suggest that made a lot of sense either, that
Right.
somebody else would have someone's stuff, not in that, because he would have been there long enough for his property to have been secured, and that would not have been an issue that we would have been concerned about with this property.
Not taking anything for granted here. The booking room is where you bring me if I just got arrested, right?
Yes.
And that's where you inventory my stuff so that when you let me out, I got a piece of paper that says this is all my stuff and I can get it back, right?
Yes.
Okay. And so that process is happening in front of Alex Rios as he's in the booking room, right?
Yes.
And during one of these processes, he started making comments that guy who's getting his stuff turned in, that's actually all my stuff.
During inside of there, he did make a comment, yes.
And that was just bizarre and didn't make any sense, right?
Right.
Okay. In total, you just described it as all very erratic behavior, and that's what we're seeing once the video starts, right?
Yes.
Objection. Not asking the question.
Conclusion, it's a conclusion, so you can rephrase it as to.
It's okay. Thank you. Now, we see the discussion going on for a little bit of time, maybe a minute or two. How long was the discussion going on before the camera started rolling, best of your recollection?
A few minutes.
Okay.
Enough for me to know that I wasn't going to be able to get compliance from him unless we took additional steps.
And when we talk about compliance, the jurors had an opportunity the other day when examining that cell, their attention was directed to the food flap. What is the relevance of the food flap as far as the protocol and procedures that were followed as it relates to trying to get compliance?
So they're given an order to turn around and be handcuffed to the food
I'm the
flap.
inmate. What am I supposed to do?
Turn around, put your hands behind your back, put your hands up to the food flap, and then an officer will come grab your hands and they will handcuff you.
So does the food flap open in and out, almost like a doggy door?
It does.
That kind of thing?
We unlock it with the key, and then it comes down and you put your hands through that.
Okay. Once I do that, what happens next if I'm compliant?
If you're compliant, once you're handcuffed, then you're instructed to go back into the cell. We close it up, and then we open the door up to take you and put you into the restraint chair for your safety with compliance.
If that process had been followed, would any of these other things happen?
No.
Any doubt in your mind about that?
No doubt.
And when you talk about him being non-compliant, that's one of the factors that you're talking about, right?
Yes.
In addition to just not coming off the wall, period.
Yes.
You talked about he was looking around up at the ceiling, you had concerns about sprinkler heads and so forth.
Right.
Why?
Because that's also a risk. One, lots of water coming into the cell, potential that inmate the cell being flooded out. Water could obscure his vision, knock him down,
Slip,
fall. Again, another reason for concern. And pressing against the top there could also be showing intent to perhaps try to come out of the cell as well.
Okay. Now, you give the order to have the door popped, right?
Yes.
Before that happened, how did you get the other COs that you're supervising in position to be prepared for this? Describe that process.
So we had the restraint chair. I had officers that were present. I recalled officers on each side. And before I enter that door, I asked and instruct my officers if they're ready, if they're in position. And then once I know that that's the case, then we open the door up and then we go to get him with compliance if we can get him to come down. If not, then we're going to have to forcefully try to get him to come down from that divider.
Okay. And so you're prepared for, at least trying to be prepared for whatever happens next.
Yes.
To be clear, the man that you've identified as Mark Cooper, while all of this process is taking place, he's not there, correct?
Initially, I don't recall.
Okay. Now, with respect to video, of course, we've got the Sony handheld, right?
Right.
In the corners of the booking room, there's also little glass balls that are like that one up there that are cameras, right?
Yes.
And you know that there's other video showing all those different angles, right?
Yes.
And you've reviewed those as well, correct?
I've seen them.
Does it refresh your recollection in having me remind you that Officer Cooper could be seen running into this situation after Mr. Rios is already down on the ground and wrestling?
I don't recall.
It's okay. We'll look at those videos later. And it's difficult to recall because of the passage of time, for one, right?
Yes.
And also because you were doing very specific things that are easier to recall than what other people were doing.
Yes.
Fair? Okay. Now, when the doors popped,
Describe what happens next in your own words.
We see the inmate, we see him come off of the divider. He runs down pretty quickly to our surprise, and he's able to press past one of our officers in position to gain free access into the booking room.
How quickly did that happen?
Very, very quickly.
Right.
Like, I've never seen anything like that before.
Okay.
In my time there.
20 years.
In my 20 years, yes.
All right. And so now, Mr. Rios has broken detention, correct?
Yes.
He has escaped his cell, correct?
Yes, he has, yes.
That's correct description based on your training, right?
Yes.
All right. Now, it was mentioned to you on direct exam that there was nowhere for Mr. Rios to go. Do you recall that?
Yes.
I heard you say, well, he's in the book-in room, right?
Yes.
There's all sorts of items that are just laying around in the book-in room, right?
Right, yes.
Anything in a hostile situation can turn into a weapon, is that fair?
Can be used as a weapon, and there's also buttons that can help you get out of said area.
Sure. You also mentioned that without someone pressing one of those buttons necessarily, he's not able to just go open those doors, right?
He's not able to.
Right. Because a jail is a secure place, right?
Right.
And it's a place of rules, yes?
Yes.
The rules are important for the protection of the inmates, yes?
Yes.
And the protection of the officers, right?
Yes.
And everyone else who works there, correct?
Yes.
Got nurses and all sorts of other types of people, food workers, et cetera, right?
Yes.
And just outside that book-in room door is the open hallway where you can find all those different areas, right?
Yes.
And you can run into those areas without having to push buttons, right?
Yes.
You indicated that if someone simultaneously was coming in, a door would be open, right?
Right.
And the book-in area is a high-traffic area. It's the nerve center of the jail, yes?
Yes.
By definition, when people are being arrested, that's where they're brought, right?
Yes.
Another area, which would be a point of ingress or egress from the jail, would be the sally port, right?
Yes.
What's the sally port? Tell them.
It's basically the area where they would bring in cruisers or anywhere. It's basically the last line of defense before you're outside the door.
Yeah. You leave the booking area and you're
outside, like free.
Open air.
Yes.
Right? So that's not far from there, right?
Not far.
And when you talk about other people coming in during this event as a concern of yours, to him escaping all the way, right? You mentioned that. Who is Officer Boyd?
He's a deputy.
Right. What's his rank? Just Deputy Boyd?
Lieutenant. He was a lieutenant, to my knowledge, at the time. Yes.
Right. In fact, he arrived in the middle of this event from the sally port, correct?
I don't believe it was a sally port.
Where do you arrive from?
I think it was our main hall area.
Okay.
He arrived from, yes.
So he arrived during that time, right?
I believe he may have, yes.
Okay.
I don't recall.
Fair. If I showed you your statement at some point, talks about him going to get leg shackles and things like that, does that sound familiar to you?
I don't recall.
It's fair. All right. I appreciate you doing the best you can. All right. When you look at the guidelines, we're going to stick with the use of force continuum for now. Page 2. Under procedural guidelines toward the bottom.
Yes.
In the context of use of force, whether it's describes conditions under which resistance, force, or deadly force may be used, that emphasizes the need for an application of a particular level of response. Do you see that portion?
Yes.
It goes on to say, most often, such a thought process requires split-second decision-making under very trying and stressful conditions. I already see you shaking your head yes. Why are you agreeing with that?
Because that's exactly how it is when we're dealing with a situation that is a high stress level event.
What makes these events high stress?
Not significant levels of non-compliance and things that happen that are far out of the norm of what we would normally tactically respond to.
Is it fair to say that there's a degree of uncertainty amongst officers as to how these things are going to end?
Yes.
When these restraints and uses of force are happening, are you concerned for your own safety?
Yes.
Why did you switch out with Mahon? She's a
because
CO.
of the concern behind what we saw. I saw that officers were at risk of potential harm, and I made the decision to put myself in that situation to help because of potential of risk of harm to our officers.
At that time, weren't there already 4 or 5 officers involved?
Mm-hmm. Yeah, there were, yes.
Why do they need you? Tell us.
Because it did not see based on what we've seen presented by that individual. We saw an unusual amount of strength and determination, and whatever we were using was not working. And I immediately knew that I needed to get involved to help to gain compliance to this situation.
We watched that video with you. If you want to see it again, please let me know. Okay, I'm not trying to keep it from you, all right? We can roll the whole thing again. So if this doesn't go along with what we just watched or your recollection, you correct me, okay? But what you would have been noticing during the time before you decided to get involved, right, is a situation where Alexander Rios is actively resisting, right?
Yes.
If you refer to page again 2 of your use of force continuum, just above there, you have a definition section. Would you agree with that?
Yes.
The last one before you get into procedural guidelines is active resistance. Yes? Could you read that out loud and tell us if that's how you understand and understood active resistance, that definition back then?
Active resistance. A subject actively resists when they take affirmative action to defeat an officer's ability to take custody or control.
The moment he comes bursting out of that cell like nothing you say you ever saw before, was he actively resisting at that point?
Yes.
Once he got to the ground as a result of some of the wrestling, does he continue to actively resist?
Yes.
Eventually, you made the decision that the officers that were working, it sounds like, weren't able to gain control of him.
Yes.
They were using body weight. We can watch it. On top of him. They've got him on the ground. He starts on his side. He gets down on his belly in a prone position. You would agree with all this based on the video, right?
Yes.
We see officers, all of them, using leverage and using their body weight on his back in order to try and gain control of him, correct?
Yes.
You've talked about identifying Officer Cooper as being the officer about 2 minutes and 50 seconds in who gets both feet up off of the ground on his back area, correct?
Okay.
Give or take?
Yes.
Prior to that, we have other officers, very large men, that are also using body weight on his back, torso, legs, head, anywhere they can to try and gain leverage on him to gain compliance. Fair?
Yes.
Do you know Officer Nate Long?
Yes.
If you walk through that door, he'd be a big dude, right?
Yes.
Bigger than Cooper, right?
Yes.
He's a mountain. Fair?
Yes.
All right. Longshore's not a small guy, is he?
He's tall.
Good. Not compared to Long, right?
Right.
All right. The point is, these are full-grown men that are exhibiting leverage and all of these different techniques in order to try and gain control of Alex Rios, right?
Yes.
You're watching this with the hand, you have the hand held up until you don't, right?
Right.
And it's your decision that they just aren't winning.
Right. Yes.
So eventually you go hands-on, right? Has the taser been deployed, yes or no, at this point?
Initially, no.
Okay. So once you're hands-on is when the taser starts being deployed?
A lot of different things, including deployment of taser, yes.
You watched the video. Officer Prender also had his taser out, right?
Yes.
You see the portion where Alex Rios was grabbing the taser?
He was grabbing the taser, yes.
What's the concern when an inmate...
That he could overpower the officer and he could take over the taser and use it on officers at that time.
Right. You have a word for that, don't you? What are they trying to do in that moment?
Trying to harm officers at that point.
Are they potentially trying to disarm the officer?
Yes.
Of the taser?
Yes.
1 to 10, what's your concern level? 10 being super concerned about that.
That's a 9-10 concern level.
Right?
Yes.
Okay? Now, we know that the tasing that occurred in this case was a couple different kinds, right? So let's learn about tasers a little bit. Can we do that?
Okay.
All right. You're gonna go use your taser. You're gonna go use your taser, right? There's 2 ways you could deploy that. Yes?
Yes.
All right. Most people think of, I'm gonna shoot the taser at Boone over there, and if the prongs that protrude are gonna have wires, correct?
Yes.
And if they get in him, those prongs are hard to get out, right?
Right.
Kind of like fish hooks almost? I don't know.
Something, yeah.
They're designed that once they get in there, they're hard to get out, right?
Right.
Sometimes you have to, if you're inadvertently tased, you might have to go to the hospital to get it taken out.
Right.
The wires conduct the electric shock to the prongs, is that fair?
Yes.
The wires, when the taser's deployed, meaning taser, as opposed to the tasee, the person who's shooting the taser, does he control when the electricity hits based on a trigger?
He shoots it, and then yes.
Okay, so I want to understand this, okay? So you tell me. So if I'm tasing someone who's standing at that door,
Okay.
using the probes and the barbs, and I shoot it and the probes go in, is the person going to feel the electric shock as soon as the probes hit them, or do I have to do is there a separate action that causes the electric shock to conduct?
Well, once it's been deployed,
Yes.
It's going to go through its process. So
Yes.
then it's going to
A
take
cycle.
Yes, it's going to
Okay.
go through its cycle at that point.
Okay, the cycle will end.
After 5 seconds.
Okay, am I done tasing? Do I have to go get another taser if I want to do that and then do the process all over again? Or as long as the probes are in, can I cycle it again? If you know.
I don't recall.
Fair. The wires themselves during the tasing when it's cycling, if I grab one of those wires, am I going to get an electric shock?
I don't recall.
If you know. Oh, fair. Okay. But to be sure, the taser is a pain compliance technique, correct?
Yes, yes.
Can you tell the jury what a pain compliance technique is?
It is a brief interruption, a technique to get a brief interruption so that then you can gain compliance of that subject.
The idea being that the normal person, when they get tased, doesn't like that,
Right.
and whatever they weren't doing before, they might start doing now to get in compliance.
Yes.
Like cuff up.
Yes.
Okay. Did the taser appear to be having the desired effect on Mr. Rios?
No.
Now, you indicated that's one way a taser can be used and how most people might think of it. There's also the so-called dry stun or drive stun. I've seen it both ways. Do you know how it's actually...
The drive stun?
Like
as in
drive
drive.
directly on you.
Yes.
If I understand the drive stun process, I remove the cartridge that would have the barbs and the hooks in it, prongs, probes. I can set that down, and now I can put this up against the person who I want to tase, and there's an electric current that kind of goes right there,
Yes.
right?
Yes.
We can see that process happening on the video between Officer Prendergast and Mr. Rios, right?
Yes.
And we can also see the struggle over the taser that's happening before that, right?
Yes.
Or after. And we see the area that is drive tased, I think is in the shoulder blade or the back of the neck. Is that fair? If you know.
I don't recall.
Fair. But you recall those two separate events going
Yes.
on with the taser,
Yes.
right?
Yes.
And it was before or after that you think you put the camera down and got in?
Before.
All right. You know that from watching that video and from that night, and probably just even in real time because you're holding the handheld, when the taser was first deployed, one of the prongs was it went at Rios, and the other prong inadvertently struck my client, Mark Cooper, correct?
Yes.
Where did it get him, Mr. Cooper?
The finger, I believe. Is
Right in the webbing of the hand there?
Yes.
Have you ever been tased?
Yes.
Painful, yes?
Yes.
Okay. And you can kind of see that in Mark Cooper's reaction on the video, yes?
Yes.
And it's kind of right as he enters the fray, right?
Yes.
Comes in, taser, he's hit, he walks away from it, right? See that on the video, yes?
Yes.
All right. Then he re-enters. Now, you talked about training and placing weight with feet on backs and things like that, right?
Yes.
Okay. Can you show me anywhere in that use of force continuum where it says that an individual cannot use their foot for leverage on a back in a restraint situation?
It's not on there.
All right. Can you repeat that?
It's not in here.
That thing's 9 pages long. That's it, right? That's the policy, that's the training, right? And that's what was in effect back in September of 2019, right?
Right.
Okay. Now, if I'm an officer, right, that's got my hand tased, I can just call it a day and quit helping out, right?
Right.
Theoretically. Or I could still try and be actively involved in trying to gain compliance, right?
Yes.
Sort of lost use of the hand, right?
Yes.
Okay. And so do you draw any correlation between that and the use of the feet instead of the hands?
Judge.
I can withdraw. That's fair. Thank you. With respect to using leverage and weight on an individual's back, torso, anywhere, okay? What you're doing is trying to gain control of someone who is doing everything they can in this circumstance to work against you, right?
Yes.
How is it that you can gain control of a person? He was not being compliant, correct?
Correct.
What do you mean by that?
That it had no effect on him and he continued resisting.
That's not just the tasing, right? It was also wrist locks and joint
Everything.
manipulations.
Yes.
There were also some strikes that were used as well, correct?
Yes.
Okay. And so, unless we just want, and we could see on that video, a couple times he's up to his knees and starting to raise up, right?
Yes.
When you got hands on him, were you able to tell firsthand what you described as this abnormally incredible strength or whatever it is that you described it as? When is it you noticed he had increased strength?
Well, I knew when we had some of our strong officers that were trying to gain compliance when it wasn't successful early on, I knew that we had something. Basically, at the time that I chose to hand over the camera, that's when I knew.
And once you got involved, did it confirm that suspicion that it appeared?
Absolutely, yes.
All right. So you also noticed once you got hands on, man, this guy's
Yes.
exhibiting. He's one guy.
Yes.
By the time you get in there, how many officers are involved?
I don't recall.
Okay. When we watched the portion here that the prosecutor directed you to, where my client is seen lifted his other foot up the back area of Mr. Rios that goes on for 7 seconds, you can also see that there are officers also leaning on his torso, right?
Yes.
Okay. All right, I want to get into the continuum itself, okay?
Okay.
And so I'm going to direct you to page 3, all right? And then we can also, if you want, you can just pull out the back page as well, since those, ask me, or let me know, do you agree that pages 3 into 4, section E, the use of force continuum, that sort of goes hand in hand with the chart, I guess the flow chart almost, that is illustrated at the back end on page 9.
Yes.
All right. So let's kind of deal with those, I guess, together. All right. So as I look through that, am I correct in stating that each level has a corresponding color?
Yes.
Level 1 is your blue, level 2 is green, level 3 is tan, level 4 is orange, and level 5 is red. Is that accurate?
Yes.
And I suspect if this chart that I had a color copy component to it, when I printed it out, it would probably have come in those colors, the chart itself, right?
Yeah.
That correspond with what I just read.
Yes.
Fair to say that each color or each level is representative of a different type of behavior that an inmate exhibits, and then you have a corresponding response level when it comes to force.
Yes.
Okay, so let's kind of start from the bottom, okay? Level 1, we speak of an inmate who is passively resisting. You see that?
Yes.
This inmate is not responding to commands, verbal or physical danger cues. He's perceived by the officer to be passively resistant. Do you see that?
Yes.
That's not defined earlier, but I'm assuming we're going to think that is like the opposite of actively resistant.
Right.
Okay, and it stands to reason that the level of force that goes along with that to meet a passively resistant inmate is going to be the lowest level of force.
Yes.
When we see inmate Rios in the cell, would it be fair to say that he is falling into category level 1 a little bit?
Yes.
Okay. All right. When we get into level 2 green, and that's why if you open the door and Mr. Rios had simply climbed off the wall and stood there, y'all couldn't tackle him and then start trying to gain leverage on him and all those things because he's not actively resisting.
Correct.
He would almost be doing exactly what you asked him to do.
Yes.
And of course you wouldn't respond with a higher degree of force.
Yes.
Okay, so let's talk about level 2 green. The parenthetical immediately refers us to inmate is actively resistant. Do you see that?
Yes.
And we just talked about what the definition of actively resistant is, right?
Yes.
That's what we're talking about. The inmate is perceived by officers to be actively resisting. He is pulling away from the officer. He is refusing to move or dead weight. Right?
Yes.
Okay. So, in this particular circumstance, Mr. Rios, he sort of goes beyond that when he runs through officers, right?
Yes.
Okay. But even still, at a level 2, the officer responds, right? Just for pulling away from an officer. That would mean, hey, come here, inmate, and grab the arm. It's like, get away from me. Just that. Or, inmate, we got to take you down to bookend, and then it's just like this. It was dead weight, right? If that's the level of resistance, on level 2, your response can be balanced displacement, right?
Yes.
What's that?
Where you get him off balance in order to gain compliance. Basically, you can
sweep the leg, Johnny? I mean, what are we doing to do that?
Yeah, any number of things that will get him off balance.
Get him to the ground.
To the, possibly to the ground if you need
Sure.
to. So.
Stunning, striking muscle groups is contemplated in level 2?
Yes.
Takedowns, joint manipulations, or pressure points, yes?
Yes.
This is the threshold for any reasonable correction officer to consider this inmate to be dangerous or a threat to himself, yes?
Yes.
Compliance techniques may include all reasonable means to bring the inmate into compliance as soon as reasonably possible, yes?
Yes.
These include restraints, forced movement, forcing an inmate.
Judge,
Yep.
I was just reading the whole policy and not asking any questions. I mean, the exhibit is going to speak for itself whether it's admitted or not. He's already identified and said that as the exhibit.
I'll ask him a question.
Okay, please do.
Okay, directing your attention down to the bottom of the level 2 response. I'm going to read a portion and ask you a question about it, okay?
Okay.
Once inmates are perceived as actively resistant, officers should not relax care until the subject is fully secured and in an isolated cell.
Yes.
Is that consistent with your training in 2019?
That's consistent.
Okay, now let's break that down. We've already talked about what actively resistant is, correct?
Yes.
You have defined inmate Rios as being actively resistant, yes?
Yes.
Any doubt in your mind about that?
No.
You should not relax care until the subject is fully secured. Let's talk about fully secured. Fully secured means cuffed, yes?
Yes.
And in an isolated cell, correct?
Yes.
In this circumstance, fully secured meant cuffed behind his back with the leg shackles. That was the plan and
Yes.
stated intention, correct?
Yes.
And then placement into what would be the restraint chair,
Yes.
right? Level 3 TAN. Tell us what level 3 inmate is what?
Assaultive and a threat to bodily harm.
What types of behaviors can the inmate exhibit to fall into this category?
So he can be wrestling with the officer or pushing the officer. We're perceiving him to be assaultive, a threat to bodily harm. Behavior may be directed toward a fellow inmate, another victim, or an officer.
And without having read that into the record during direct examination, isn't that exactly how you described inmate Rios?
Yes.
Okay. And so, with respect to a level 3, the officer's response is included but not limited to, and you would have the exhibit striking and punching, yes?
Yes.
Use of baton?
Yes.
Electronic stun device?
Yes.
And immediate defensive tactics, yes?
Yes.
Including impact weapons?
Yes.
What are impact weapons?
Well, since we don't have any, we think about like the baton and things of that sort. We could use less lethal.
But, so even though the policy allows, it's not something that you have there at the jail?
Right.
Okay. In addition to that, hard fist?
Yes.
All right. And any other reasonable means available to stop the aggression at hand, yes?
Yes.
And bring the inmate into compliance, right?
Yes.
Is this why you hesitated when you talked about the use of leverage and things of that nature? And placing weight on the back of the inmate? Yes?
Right. Yes.
In other words, do the circumstances dictate what is appropriate?
Yeah. Yes, they do.
And just like the statement indicates at the beginning, these are split-second
high-stress, adrenaline-filled moments, yes?
Yes.
The last sentence of that, I'd like you to read the portion as it talks about level 3 TAN, beginning with, "It is contemplated."
It is contemplated and understood that reasonable officers, while employing defensive tactics, may cause injury, serious injury, and in some isolated instances, death, without intending such consequences.
As soon as you all realized that Alex Rios had lost consciousness, what did this immediately transition into with respect to the response of the corrections officers?
When we noticed this, it was immediately the AED call for the squad because the medical care component, we noticed this was an issue and we wanted to do everything that we could for his well-being at that moment.
Fair to describe that as life-saving measures?
Yes, absolutely.
That involves CPR?
Yes.
Did that also involve use of a device called the AED?
The AED, yes.
Tell the folks what that is.
Yes, it's a device that you hook up and you try to get, when someone's rhythm and they're not breathing, it's to try to get that heartbeat back and get them back to functioning at that point in time.
And is it your recollection that correction staff, including yourself, did everything within your power to provide aid and medical care until the medics showed up and took over?
Yes.
And of course, the medics are more experienced in that area?
Yes.
Okay. And that's level 3 TAN, right?
Yes.
Level 4 orange speaks as to inmate is assaultive or causing bodily harm, striking or kicking the officers, perceived by the officer to be assaultive. Yes?
Yes.
Wrestling and active resistance and these types of things are concerning for that. Yes?
Yes.
All right. With respect to a level 4 response, a number of different responses are appropriate. Yes?
Yes.
I want to speak last about level 5. Okay. Can you read to us the parenthetical for level 5, red in parentheses?
Inmate is assaultive and threat to serious bodily harm or death.
Okay. And this is like what would otherwise justify the most serious response as far as use of force. Is that fair?
Yes.
Okay. Well, if you could you just read to me the circumstances that would otherwise justify use of force at the red level?
It says inmate using a weapon against an officer, attempting to disarm officer, life-threatening weaponless assaults. The inmate is perceived by the officer to be assaultive, serious bodily harm or death, or attempting violent-based escape.
Based on your testimony here this afternoon, you have indicated that Alex Rios did escape his cell, yes?
Yes.
And was heading toward exit doors and running around the book-in room in an effort to break detention, yes?
Yes.
Also, while previously indicating that he wasn't supposed to be there.
Yes.
Okay. Does, when your guidelines talk about attempting violent-based escape, do they talk about the likelihood that the escape will be successful? Do you see that anywhere in there?
No.
Regardless of the likelihood that Alex Rios was ever going to make it outside, okay, is the threat still the same with respect to what's going on?
By definition, yes.
Okay. Of course, you mentioned attempting to disarm an officer as well?
Yes.
All right. Officer Prendergast was armed with a taser, yes?
Yes.
It doesn't talk about disarm firearm, disarm knife, it just says attempts to disarm the officer, correct?
Correct.
In these circumstances, in a level 5 situation, the appropriate level of response is deadly force, yes?
Yes.
Okay. Now, when you look at page 9, okay, we have some different characteristics, both, I guess that would apply to the staff members and the inmate factors. Do you see those at the middle portion underneath the chart?
Yes.
Okay. With respect to inmate factors, Mr. Rios is 27, 28 years old, correct?
Yes.
We've heard testimony at the time he was 5'10" and 194 pounds. Seem about right? You don't know. Fair. Seem relatively fit to you?
Yes.
All right. And relative strength is one of the factors.
Yes.
And you've already talked at length about that
Yes.
and the increased degrees of strength that you noted with him. Yes?
Yes.
All right. Have a moment, Judge.
Yeah, it might be a good time for a break anyhow. Okay,
Yes, sir. Thank you.
Ladies and gentlemen, 10-minute break, same instructions as always. We'll see you back here in 10 minutes and continue with Mr. Odell. Mr. Odell.
Dan DeRose with 19 News. As you just heard, the jury's going to get a 5 to 10 minute break here. Interesting testimony from the supervising corrections officer who, when he was examined by the state asked him very directly, are you trained to put your foot and to put all your weight and to stand on the back of an inmate? And he said, no, we're not trained like that. And he said, in fact, you're trained not to do that, correct? And he said, yes. But then this is why we have a court of law. Now it's the time for the defense. The defense gets to get up there and he has him read the 9 or 10 page training manual for use of force on an inmate who is non-compliant. And nowhere in that training does it say you cannot stand on the back of an inmate. It is going to be the crux of this position or of this case. You're going to have to make a decision, put yourself on that jury. So which is it? Is the supervisor saying, well, we're not supposed to do that? And he even got quiet when he asked if he saw anything in that video. And of course, he's referring to the fact that this corrections officer, Mark Cooper, does in fact put both, he has one foot on his back and he lifts the other foot up off the ground so that all of his weight is on there. And you saw the corrections officer, the supervisor, get quiet. He did not want to answer that. The question that he saw, his friend, Mark Cooper, has been identified as a friend. They're close, their families are close. He could not answer that question, and it was tough. So then you get the defense, and the defense is not done yet, going through the actual training manual, and there is nothing that says you can't do it. So again, which is it? And we're going to play that video for you again, and it is tough to watch. I want to warn you that it is ultimately what led to the death of Alex Rios. But it is the best evidence that we have, whether it's the supervisor, whether it's a coroner. This video is going to weigh heavily on the minds of the jury when they get this case. So let's watch the video again. I want to warn you again, if you don't want to watch, just mute for a few minutes and then we'll wait for the trial to resume. We won't miss a single second of it. This is about a 5-minute video, so it should take us through the rest of the break. But again, this is the video that ultimately led to the death of Rios. Think about all the testimony that we've just heard, the different levels of non-compliance. Ask yourself, what level is Rios? He does escape from the cell. He is able to run past the corrections officers. When he is on the ground, and there's 3, I believe at that point there's 3 corrections officers on him, he is still able to get up to his knees and almost break away. And so is this a all or nothing type situation? That's for the jury and for you to decide. Let's take a look at this video. Again, last warning, it is graphic because it is what leads to the death of Mr. Rios. Take a look.
What's his last name again?
Rios.
Rios, I need you to come down so we can. Okay. All right. All right. I'm not going to call anybody unless you come down from down here. Okay, this is the last time I'm going to ask you. I've asked you for like 5 minutes. I'm not going to do it anymore.
What do you mean?
Okay.
I'm not supposed to be in here.
We're going to put you in a restraint chair for your safety due to not listening and being on the divider, causing a risk to harm yourself. We don't have time to continue that all night.
There's no reason
Okay.
for it.
All right, this is the last time I'm asking, and we're going to go in. We're going to go ahead and put you in a chair.
Why can't you just open the door?
Right here, go. All right, come on down.
Do that, CO, baby.
No.
Handcuff.
Is that a yes or no?
I'm supposed to.
Go ahead and turn around, put your hands behind your back, and cuff up for me. If not, we're going to come get you. All right.
You guys
No.
are wrong, man.
Okay, we're coming to get you.
Ready?
Let's go. Go. Talk to back. Hands behind his back here.
Come on, man. I'm not even fighting.
Use your taser.
I'm not fighting. Tasing.
Tasing.
Fighting.
No, take it off.
Taser.
Taser, taser, taser.
I'm not even fighting him. Ow! Ow! Ow!
Glasses, let me get my goddamn glasses off. Taser.
Ow! 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 All right. Ow! Ow! Can someone
Try tasing.
Can you explain to me?
Because you're a dumb.
No, you're the dumb.
I didn't say you were. Oh.
Got out of the cell.
Really?
Yeah, he's looking.
Oh! Ah!
Give me your hand behind your back.
Oh.
Somebody take it.
He's on some type of drugs, I believe.
Keep playing.
If you need to. We have anybody else available?
I got this hand. You got it?
Rios? Alexander Rios. Alexander Rios.
Oh, that's the one that they sold the warrant on last night, wasn't it?
Yeah, he thinks he's supposed to be out of here and he wouldn't get down off the wall.
Take me.
Cut it off. Cut it off.
Turn it off.
I would like to help.
Let go of the cuff. Ow. Let go of the cuff.
Right up there on the wall.
I try to pull that thing out when it comes out.
Get a pair of shackles.
We got another handcuff.
Where's the other hand at?
I got it.
Where's that?
Behind Nino.
I only have one hand, guys. I can't help.
Do you want a pair of shackles?
Okay.
Well,
Somebody
I
get
can't
beside me. Nino, you're
Buck.
gonna have to get up. All right.
Grab some. Oh, he's got them.
Cooper, you ready?
We got shackles.
Ready?
All right.
Yeah.
Shackles.
Give me the other hand. Bring it towards me, guys.
You got it?
Shackling down there.
This cuffed.
Those are too big?
Give me 1 second.
Where's the regular side?
Think that's gonna be too big? Let's slide his foot out there?
What we got?
Try it.
That might be able to cinch up around his ankle.
Do his ankles now, so.
Keep going.
Hey, Gardner. Yeah. Come on the other side of Long. Yeah. When we come up, we're going straight up into the chair. All right. Cooper, I'm behind you. Me and Long are behind you guys.
Nino.
I got you.
Yes,
All right, I got the chair so it doesn't move.
Okay. You two ready?
Rolling, rolling. He's turning.
Straight up.
Turning. Hear me?
Get up.
He's turning blue.
Get up.
I'll put him in a chair.
Call the squad.
I'll put him in a chair.
Master Control, call the squad.
We need, turn him on his side. Turn him on his side. Just laying down on his side. Lay him on his side. Try to get us some action, make sure everything's going okay for him. Get him back.
It is a tough video to watch, to say the least. You saw Rios break out of his cell. The supervisor who's on the stand said when he ran out of that cell, it was faster and he said it was faster than anything he'd ever seen in his 20 years as a correction officer, the speed at which he was able to get down from that wall, out the door, and around the corrections officers to run down that hall. The concern then became not only for the safety of Rios, according to the supervisor, but also everyone else in that booking room. And then you heard him testify that, of course, it would be highly improbable, but if he could find the buttons behind the desk to press, to get out certain doors, or if somebody had been coming in one of the doors, say to the Sally Port, then that could have been an issue of him getting out into the public. But the question is going to be on the use of force. The only officer of the 5 corrections officers that has been charged is Mr. Cooper, Mark Cooper, for standing. He has his foot on his back, and then he puts all of his weight. He actually gets his left foot off the ground for 7 seconds. There's a terrible noise that comes from Mr. Rios. It is just a terrible, terrible sound that comes out of his mouth as he stands on him for 7 seconds and then never regains consciousness. He dies 7 days later at the hospital, basically, from what we're hearing from the coroner's report, basically brain dead at that point and taken off facilities and machines 7 days later by his family. Now, the person who has really been pushing for this case, you heard that Mr. Cooper, Corrections Officer Mark Cooper, remained on the job. He was never suspended. He was never fired. He remains on the job for about a year before he transfers to another location. And then that's when he retires. And then, of course, gets brought up on charges. He's facing manslaughter and reckless homicide. He is the only officer being charged here. If you're the defense, you have to say, well, wait a second, there were 3 or 4 other individuals that had weight on Mr. Rios, so why is he the only one charged? And then if you're the state, you say, well, he's the only one charged because he stood on the back of Rios. And that's right around the time you hear that awful noise, that last breath, so to speak, come out of Rios before he goes unconscious and starts turning blue. You hear, and I've watched this unfortunately too many times, that there's a lot of miscommunication. There's somebody saying why, and it sounds like Rios, when he's being tased, he said why, and one of the corrections officers says because you're a DA. I'm not going to say it. It says because you're a DA. And the woman that's holding the camera says, no, you're a DA. Well, no, Rios didn't say that. It was one of the corrections officers. So you can see there was a lot of confusion. And then once they see he's turning blue, they start to turn him over. You hear twice. It's very faint. You hear 2 corrections officers saying, he's blue, he's blue. But yet as they try to sit him up, one of the other corrections officers jerks up on that vest and says, stand up. He didn't even realize that Rios was blue at that point. A lot of miscommunication in this. It was not the smoothest video we've ever seen of whether it's on the street or in a jail setting of an inmate being taken back into custody. But that may go to the fact that there were amphetamines in Rios's system. You heard the supervisor that was just testifying, and I'm keeping my eye on it. We're not back into court yet, but the supervisor saying that he had some kind of strength, and it's that strength we hear about when people are on drugs, depending on what it is, that they get this sort of superhuman strength. So as for needing 5 corrections officers to get Rios down to the ground, get him turned over, and get him handcuffed, you have to ask. And we go back to, and I still want to see where that's going to come into play, that piece of plastic that was taken out of Rios's digestive system in the autopsy. There was a debate about whether or not you can call it a plastic bag. The debate took place away from the jury. You had the defense want to say, absolutely, it's a plastic bag, and it's consistent with the plastic bag of somebody carrying drugs and swallowing drugs right before they're arrested. And you have the state saying, oh no, we don't know what that is, and that's not what contributed to Rios's death in any way, shape, or form. But we did hear from the coroner who originally signed the certificate, the coroner's report back in 2019, that he concluded that Rios died of excited delirium. That's a phrase that apparently is no longer used. It needs to be more defined, but at the time it was this idea of having drugs in your system put into some sort of excitable situation that ultimately leads to someone's death. And the coroner stands by his report saying that this was an accident at the time. But it was really Rios's stepfather, Don Mould, who has really pushed this case to this point, asked for an investigation, asked for the prosecutor to come up with charges, and that's where we land now. We've got our camera back on in the courtroom, still focused on the ceiling, which means the jury is more than likely being led into the room. Just going to show you this as we are clearly getting close to getting back to the trial of Officer Mark Cooper. I would anticipate that we will finish with this witness. This is the supervisor who originally was holding the camera, said he had to hand the camera off when he realized that Rios was putting up such a fight that he wanted to that he needed to get involved. I would anticipate maybe we'll finish with this witness. It is 4 o'clock, and this may wrap it up for the day. Let's take you back into court in Richland County.
Did you say I could go, Judge?
Go right ahead, continue, please.
Last question for you, Mr. Odell. If you could look back again, as you have been, at the use of force continuum. That would be section E, page 3. Are you there?
Yes.
It continues on to page 4, doesn't it?
It does.
And there's a little letter F at the top of page 4 that kind of finishes off that section, yes?
Yes.
Okay. I want to ask you about that passage. It reads, "It is important to remember that almost all incidents faced by officers are not scripted, easy to understand, or predictable as to the outcome."
Yes.
The incident that we have watched here in court today, that you've testified about in great detail, how would you describe that incident as it compares to that statement?
I would say that's exactly what it was, yes.
Okay. And so specifically, it was difficult to predict what the outcome was going to be.
Right.
And you've talked about the risk associated with this in great detail.
Yes.
It's a dangerous job, right?
Yes.
Mr. Odell, I really appreciate you coming in today, and I don't have any other questions for you at this point. I think Mr. Salisbury may have some follow-up with you. I'm going to clear my things away, okay?
Okay.
I'm going to leave those exhibits up there with me.
So Mr. Odell, with respect to that last sentence that was just read about being unpredictable and you can't predict the outcome, right?
Yes.
That's life, right?
Yes.
That's everyday life for everybody, right? And that's exactly why, isn't it? Would you agree with this? Isn't that exactly why you receive such extensive training as to how to react in these situations?
Yes.
Wouldn't you agree? I mean,
Yes.
and even there was a section in there that I read that says that people that aren't trained on the use of force should not participate in anything like this. Is that?
Yes.
Do you remember reading that in there?
Yes.
Do you agree with that?
Yes.
Because they might react inappropriately because they're not trained. Do you think that's the reason, or that's a good reason?
Yes.
Okay. Mr. Mayor, ask you about where do you see it in that B3, Exhibit B3 we're talking about, the continuum on force. Where is it in there that you can't put pressure with your foot on somebody's back? And you immediately said, it's not in there, right? It's not in there, is it?
No.
Where is it, turn to the page that says you can't take both hands and wrap them around an inmate's neck and choke the life out of them. Where does it say that in there?
It's not in there.
Of course it's not, right? Because there's not an exhaustive list as what you can't do in that continuum, is it?
No.
Okay. Because it's not in there does not mean it's appropriate or trained, does it? I mean, that's why you get the training.
Yes.
Correct? Okay. And again, you were the lieutenant, so would you say out of that group of folks that were the COs, I shouldn't say folks, out of the COs that was in that group that's trying to restrain Alexander Rios, that you were the in charge?
Yes.
Okay. You were their boss, right?
Yes.
And it also says in that continuum that when you use deadly force, you have to announce it, right? Does it say that in that? In that B3?
Announce that you're going to use deadly
Yeah.
force.
Did you read that in there?
So where are we looking in?
I don't know what page it's on, but let's talk in the section that talks about the use of deadly force. The section on page, so I'm looking at page 5 of 9 on exhibit B3. Right? Doesn't it say you need to announce, you should announce when appropriate, the use of deadly force before using it?
Okay. Verbal warning. Okay.
Go ahead.
Yes.
What does it say? So I don't misstate it.
This is verbal warnings are given prior to use of firearms if reasonably possible.
Okay. And it was not decided, you did not think use of force or use of deadly force was necessary in this case, did you?
If you can't answer, I don't want you to give opinions, so.
I can't answer that.
Well, you were involved in the incident and you did not use deadly force, did you? You yourself did not use deadly force?
No.
So one can reasonably assume from that you did not think it was necessary in this case. Or else if it was necessary, you would have used it. Is that accurate?
The use of a firearm? If I would have announced the use of a firearm?
The firearm is not the only kind of deadly force. You would agree with that?
Right.
Right?
Yes.
Do you agree with that or not?
I would agree with
There's
that.
other kinds of deadly force. Okay?
Yes.
So we agree on that. So now I'm not just talking about firearms. I'm not just talking about that. I'm talking about the use of deadly force. Did you think it was appropriate? Did you think it was necessary to use deadly force? Being that you've already answered that you did not use deadly force in this case.
I'm going to say fifth on that. I'll take the fifth on that.
Okay. Mr. Rios didn't have a weapon, correct?
Right.
Didn't have a knife or gun.
Right.
He never gained control of that taser, did he?
Full control?
Full
No.
control. He never tased an officer, did he?
No.
And in fact, couldn't it be a reasonable response to him being tased that he wasn't trying to gain control of the taser, he was trying to stop himself from being tased? Wouldn't that be a reasonable conclusion of what he was trying to do, it's not a fun.
Actually, it calls for speculation.
It does, sustain.
You've been tased, you said. Is that part of the training? I know it used to be, I don't know if they do that anymore. That you have to be tased before you can use a taser?
It's been where you can be tased, and also it's elected. You can or can choose not to, but I was tased, yes.
Okay, that's part of your training?
Yes.
Not because you did anything wrong?
Yes.
All right. Extremely uncomfortable, isn't it?
Yes.
I mean, not something to be taken lightly and you would want to ever go through again, I assume. Is that a fair statement?
Yes.
Okay. And so when you get tased, that's the reason for the taser, you're supposed to react, right? Or not react, or comply, right?
Can you repeat the question again?
The reason for the taser is to get you to comply, to either react or stop reacting, right? React mean, okay, I'm going to get cuffed up, or I'm going to stop resisting, whatever,
Yes.
whatever it is, right?
Yes.
And that's why you announce it, right? So we heard that on the video. Taser, taser, right? That's so everyone knows that somebody's going to be deploying a taser, correct?
Yes.
Including the decedent. Okay? Right?
Yes.
He said it loud enough that was heard by everyone in that room, correct? Taser, taser. Right? Yes?
Yes.
Okay, that answered it loud. But as an officer in that fray, you do not expect to be tased. Is that a fair statement?
Repeat the question again.
As an officer, as a CO in that fray, you do not expect to be tased yourself as an officer.
Correct.
Okay. So it's a fair assumption to say when Cooper got hit with the taser, it was surprising. It surprised him.
Yes.
Because he wasn't expecting to get tased.
Yes.
And you've been tased.
Yes.
The reasonable reaction is anger, isn't it?
Objection. It calls for speculation as to what Cooper felt when he.
I didn't ask what Cooper felt. I said it's a reasonable reaction.
It would be as to his experience. So you can answer as to your experience when you were tased.
Was I angry when I was tased?
Not you, because you expected it. I'm saying since you've had the experience of being tased, if you were unexpectedly tased.
Well, that's different. I object.
Okay. Only if you've had that experience.
Unexpected.
So I don't think he would have to speculate to decide what his thought would be if he was unexpectedly tased.
So you saw the video, correct?
Yes.
And you saw Cooper walk away and rip the wire out of the taser, right?
During the video, I don't recall.
Okay. Well, you recall the end of the video, he didn't have the wire in his hand anymore, right? So somehow it got ripped out.
Okay.
Somehow the wire got disconnected, right? Would you agree with that?
I didn't see the very end where it was out, but
Oh.
if it was out, then yes.
Okay. So he walks away. What's the first thing he does when he returns from, if assuming that he ripped the taser wire out, what's the first thing he did when he came back to that pot? What's the first thing he did?
I don't recall.
He stepped on his back. He stepped on Rios' back, didn't he?
Okay.
Okay. And that is something that you and he, we can assume, have been trained not to do. You've said that earlier. That hasn't changed, has it? You said you were trained not to do that.
Under normal circumstances, no, we would not do that.
And you did not do that. Have you ever stood on a man's back?
No, not in how we describe, no.
Okay. Well, what is it? Well, what do you mean? Have you ever stood on a man's back? That was my question.
No.
Okay. I don't have anything for it.
All those, yes.
Okay, so Attorney Salisbury went through a couple of examples with you. One specifically that does not appear in here as a type of use of force that is prohibited. Do you remember that? I'll ask it this way. Do you remember when he said, it doesn't say in your use of force continuum that you can't grab a hold of someone's neck and choke them,
Yeah.
right? You remember that? And it doesn't say that you can't do that, right?
Yes.
But if you look to level 4 on the use of force continuum, let me know when you're there. That's page 3 of 9? Yes?
Okay.
You'll recall level 4 orange. The inmate is assaultive and causing bodily harm, striking or kicking the officer, perceived by the officer to be assaultive.
Yes.
You've already testified that you perceived Rios to be assaultive, yes?
Yes.
The officer responds. Can you read it? Reasonable response.
Non-traditional impact weapons.
Okay.
Less lethal munitions, baton strikes, use of sleeper hold.
Wait a second, what? Now a sleeper hold is a chokehold, right?
Objection.
If he knows, only if you know what a sleeper hold is based on your training.
I don't recall.
Do you know what a sleeper hold is? Do you know how to apply one?
Yes.
Show me. Come get me. Come on. Demonstrate. With court's permission.
You can demonstrate on him, you can do so. I don't think you really want to put him to sleep.
I'll go pro wrestling style. Go to 3, then I'm out.
But come back behind.
Okay.
And read it
Now wait, whoa. And where are you applying pressure?
underneath.
On my neck, right?
Yeah.
Okay?
With what? Objection. Not with his hands, that's not what my question was.
That's fine.
Well, for the record, since you're demonstrating, we'll have to put on the record what the demonstration is, but go ahead.
Why don't you just take step by step what you're doing with your arms and where you're applying them, please? Is that fair, Judge?
That's fair.
Okay. We're almost done. Get me.
So I'm coming underneath.
Okay.
It's the
Underneath
neck,
what?
It's underneath the neck area.
Yes, sir.
It's underneath the neck area.
Okay.
And then I'm applying pressure until
Until I do what?
you pass out.
Right. And that's as a result of me being asphyxiated or choked, right?
Yes.
And under your use of force continuum, that is, does not fall under even the deadly force category, correct?
Correct.
That's level 4 orange.
Yes.
And so while it is true that the manual does not contemplate prohibiting 2 hands around the neck, right? It absolutely contemplates
Yes.
what
Yeah.
appears to be a safer
Yes.
chokehold, which is a sleeper, right?
Yes.
And why is that safer? You know? If you know.
I want to be accurate, so I'm going to say I don't recall.
That's fine. All right. So not only does the continuum contemplate a sleeper hold or a chokehold type move, but it specifically tells you when you can use it, right?
Yes.
And it stands to reason that if you're using it at level 4, orange, that's the level before you get to deadly force, correct?
Yes.
And that's your training.
Yes.
Now, you were asked questions about the taser and disarming, right, as it gets you to deadly force, right?
Yes.
You asked a number of questions about that. Asked about he never gained control of it. Do you recall that?
Right.
And ultimately, he never did wrestle it away from Officer Prendergast. You would agree with that, correct?
Yes.
But if you look at your training again, words matter, page 3 of 9, level 5 red, response deadly force. You read this into the record earlier, I want to be clear on it, as it relates to the disarm the officer section. Let me know when you're there.
I'm here.
What is the full passage when it comes to disarming an officer that would justify deadly force?
Attempting to disarm life-threatening weaponless assaults.
Okay.
The inmate is perceived by the officer to be assaultive, serious bodily harm or death, or attempting violent-based escape.
Yes. And going back up to the disarmed officer passage, the words are attempting to disarm an officer, correct?
Yes.
That's the effort to disarm the officer, correct?
Yes.
And so what that tells you as a corrections officer in 2019 is I don't have to wait for the inmate to disarm me before I can start doing stuff in response to that, right? And that's just reasonable, isn't it?
Yes.
Because once we wait to be disarmed, all bets are off now, right?
Objection.
It's more argument, so it's just
But again, once that attempt to disarm the officer occurs, it lends itself to that situation that is contemplated, where these are split second, the outcome is unclear, and they are characterized by split seconds, excitement, and adrenaline. Yes?
Yes.
That's all I got for you. Thank you.
Do any of the jurors have a question for Mr. Odell? Yes, okay.
Again, the judge is going to continue with this pattern. One of the jurors has a question for, this is the supervisor of the takedown of Rios. He was the supervisor in the jail. There you see our defendant here, Mark Cooper. He is the man who stood on the back of Rios, had his foot on his back for quite a while, stood on it with the full weight of the other foot coming up off the ground for 7 seconds. And again, this debate of, were you ever trained to stand on the back of an individual? The supervisor said no. Have you ever stood on the back of an inmate or of a man? And he said no. So you're getting this back and forth, and again, put yourself in the juror's shoes. Can you say one way or the other whether or not Mr. Cooper should have put or stood on the back of Rios? If you're emotional, yes, you can say one way or the other. But as defined by the training literature that has just been gone through ad nauseum here, can you say for sure whether or not he should have stood on the back of an inmate? It sure doesn't say it in there anywhere, but as pointed out by the state, it also doesn't say you should put your hands around the neck of an individual and squeeze until they die. So it's this, it's just like, I loved the comparison. It was just like in the movie with Tom Cruise, Jack Nicholson, A Few Good Men, when the one soldier is on the stand and he said, can you show me in here where it says no code reds? Can you show me in here in the military handbook where the mess hall is? And he said, well, it's not in there, you just know. And so again, it's this idea of, because it doesn't spell out every single situation, every single way of how you can take down an inmate, doesn't mean that it's wrong that he stood on his back, or doesn't mean that it's right that he stood on his back. That's going to be the big question for the jury here. Just because it doesn't say in the training manual, stick your finger in his eye so that he can't see and can't grab a hold of the taser, well, you have to make a decision on whether that's right or wrong that you stuck your finger in an inmate's eye. I mean, we're trying to simplify this just a little bit into the argument here. And again, just making sure our shot isn't frozen. It's not frozen there. We had a little bit of an issue earlier. But this question that the juror has, and again, I've never seen this. I'm not saying it's wrong. I've just never seen it, where the judge is going to allow the jury to ask a question of each individual witness before they leave the courthouse. Normally, jury has to basically stay silent about their questions, because that can also tip the hand, you would think, to the defense or the state. If you see one juror that keeps asking one particular type of question, that might help out a defense or a prosecutor. So interesting move here by the judge to allow this. Normally, jury has to sit there, take it all in. They get the case, they go back to the jury deliberation room, and then if they have any questions, they can write it down, give it to the bailiff. The bailiff takes it to the judge, and the judge decides if he can get an answer from whoever the witness was, or if there was testimony that already addressed that question. So whatever this question is, notice how long we've been away as we're about to get started.
The jurors are going to have to decide So I don't think it's proper to ask a police officer that question. I think it's something jurors are going to have to decide in the case based on their finding of facts after they hear the call. So I won't be asking the question, but thank you. Mr. Odell, you may step down. Prosecutor Thompson, do you have a witness, or do we need to discuss something up here at the bench? What are your thoughts?
We should probably approach Judge.
Okay.
Sorry.
No problem.
So the judge asking the prosecution if they have any other questions, if they're going to call another witness. It'll be interesting. Do they have anybody else? Does the state have anybody else that can say, you would almost think you could find some sort of expert, and you can find an expert on either side of a case, on either side of an argument. You would think you could find some sort of national police training expert who says you should never stand on the back of an individual. Again, I'm just saying this in regards to the prosecution. The case is still in the hands of the prosecution because then it'll go to the defense, and you could think the defense could find somebody who would say, oh, well, in an extreme situation where you're losing control, you're dealing with an individual who may be hopped up on a drug, maybe that is your only tactic, is to stand on the back. So that's kind of where we are with this, is waiting to see. It's very possible, if the state is done, if the state will rest, that we would break today and they would start tomorrow with the defense, that it would be the defense's turn to call up all of their witnesses. But you're looking at the man who has the fate of his future in the hands of the jury. That is Officer Mark Cooper. Let's remember, he's facing manslaughter and reckless homicide in this case. Just kind of an unprecedented case. The fact that it went on, this happened in 2019. He wasn't charged until much, much later. Let's see what we get in court.
I told you we always try to end between 4 and 5, and it is between 4 and 5. It doesn't make sense for me to have you go out there in the hallway and wait around 10 or 15 minutes before I can make my rulings in here. So I think the better thing to do, we can do that without you, so we can go ahead and send you home, and I can continue working with the attorneys. So your job is to come back at 9 o'clock in the morning, and we'll tell you who the next witness is. Leave your notepads here and pens here. Remember those instructions. You're not discussing the case with anybody, and don't let anybody discuss with you. Again, you're not ready to have an opinion on the case because you haven't heard everything, so save those opinions and those thoughts until deliberation. Don't pay any attention to media coverage. Don't do your own research or investigation. We'll see all 13 of you back here at 9 o'clock in the morning, and we'll find out who the next witness is going to be. Thank you.
Dan DeRose with 19 News here. As you see the jury being excused for the day, they're going to start tomorrow morning at 9 o'clock. We will continue our gavel-to-gavel coverage. It sounded like the judge has a few issues that he needs to discuss between the attorneys, and I think we're going to stay with this because as we saw during the lunch break, the first part of the lunch break, very interesting to watch the inner workings that was on the record. The court reporter was there. Everything being discussed was on the record, was going down in the books. So when it's on the record, it's very interesting to show you, boy, it got a little heated during the lunch break between the prosecution and the defense about the discussion about that plastic bag. Was it a bag? Is it not a bag? Could it be discussed? Was it ever tested for drugs? A little tough to test a plastic device that was in someone's digestional tract when it's been in there for at least a week. A little tough to test it for drugs, but that was never done. You would have thought, and again, they didn't know at the time, the week after that this incident took place, they had no idea that this was going to lead to charges for Corrections Officer Mark Cooper. And that was the reason that that was never tested. We're going to hang out here for just a second. I want to see if we do go back on the record. Our camera is still there. That is an indication that we're still waiting for the jury to go out. Looks like we might be getting back into position here. And let's... Just watching right along with you to see what.
Sir. Let me step up here. Before we swear you in, is Officer Pendergast?
Yes.
Yes. How are you?
Good, sir.
The parties wanted me to give you Miranda warning before you testify, and then I know you have counsel here, and then we'll let you decide whether this is something you would like to testify or would you like not to. So outside the presence of the jury, we've decided I'll go ahead and read those to you, and then you can let me know based on the warnings whether you are elected to testify or not. So you do have the right to remain silent. Anything you say can and will be used against you in a court of law. You have the right to talk to your attorney and your attorney presence while you're being questioned. You cannot afford to hire a lawyer. One would be appointed to represent you before any questioning. If you wish, you can decide to exercise these rights and not answer questions or make any statements at any time. Do you understand those rights? And with those rights, first of all, do you understand those rights?
Yes, sir.
And with those rights in mind, what would you elect to do as far as testify or not testify?
Under the advice of my attorney, I would like to plead the fifth.
Okay, very good. Thank you for that. I appreciate you being here, and we were able to put this on the record, so thank you. You allowed me to testify.
Yes, sir.
Yep. Before you leave, sir, we got a couple other witnesses. For your name for the record.
Douglas J. Behringer, 0066483.
Thank you. There were a couple other people that I was going to go through that with that were going to be maybe called, and I was wondering if you knew at this point whether those people would be exercising their rights.
Nathan Long will be tomorrow.
Nathan Long. Okay.
And I haven't talked to there's two deputies, I believe.
Okay.
One or two. I haven't talked to them yet.
Okay. I would probably have, do we want to, based on him saying that Mr. Long is not going to testify?
We could call him off, Judge. It's just a dog and pony show. We don't need to do that. I mean, unless the court wants to do it on the record, I'll take him at his word.
Take counsel's word.
Yeah.
So if
we have no objection.
Yeah. So Mr. Long does not need to come if he's going to exercise his rights. And if you would find out those other officers who not desire.
I will do so. I wasn't aware of the other ones.
Well, if they're not employed there anymore, we're going to be consulting with them.
I don't represent the ones that aren't employed here anymore.
I think that's the issue there, Judge.
Okay. So
that's why I think Mr. Odell was in here on his own.
Okay.
If I've got that right.
Counsel, if you're talking about deputies, we're not calling any. Who do you have names?
I was just informed by somebody that there may be one or two deputies. And I do represent the deputies.
You do not represent a Mr. Longshore.
But I'm not 100% sure.
He doesn't.
If he does not work here, I do not represent him.
All right. All right. And then, yeah. Okay.
But I haven't talked to them yet.
Okay. Well, thank you for being here, and thank you for letting us know about Mr. Long. And if you do find out the others are intending to exercise their rights, if you just let counsel know or someone know, we appreciate it. Thanks, sir.
Thank you. Take care. Drive safe.
Yes.
Anything else we need to put on the record before we end for the evening?
No, you're right.
Okay. All right.
We've got nothing else, Judge.
All right. We'll see everybody back here. Thank you.
Thank you.
Yep.
Dan DeRosa with 19 News. Very interesting there. You saw the deputy take the stand, read his Miranda rights, and he pleaded the fifth. Does not want to testify. He was apparently involved in this. You heard a couple of the other names called out, and corrections officer Long will also be pleading the fifth. The reason they're doing this is they don't want to self-implicate themselves. You don't want to be on the stand and say, oh, while Officer X was doing this, I was doing this, and have that come back on you to say, oh, well, that's illegal. You're not supposed to do that in an inmate type situation. So you can understand those individuals not wanting to implicate themselves in any way, shape, or form, and they are given the right to plead the fifth. So we will pick this back up tomorrow morning, 9 o'clock. We will see who the state The state did not rest its case, so that tells me they have at least a couple more witnesses to call on Friday before they turn this case over to the defense of Mr. Cooper. We're going to wrap up our coverage here. Again, we have committed to gavel coverage throughout all of our streaming properties. It's on one property or another at all points during this entire case, because it is so interesting and has caught the public eye. So we'll see you back here at about 9 o'clock tomorrow morning. Until then, I'm Dan DeRose with 19 News. Have a great afternoon.
19 News is everywhere. Download our CTV apps and